I'd like to call to order this meeting of the Sacramento County Board of Supervisors for Wednesday, September 9th, 2020. Madam Clerk, will you please call the roll and establish a quorum?
Good evening. Supervisors Frost.
Here.
Kennedy.
Here.
Natoli.
Here.
Peters.
Here.
Cerna.
Here.
And you have a quorum. This meeting of the Sacramento County Board of Supervisors is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T UVerse cable systems. The meeting is closed caption and is webcast at sacmetrocable.tv. Today's meeting will be repeated Friday, September 11th at 6 p.m. on Channel 14. This meeting is also broadcast live on KUBU Radio on 96.5 FM. A DVD copy is available for checkout from any local library branch.
Thank you. Mr. Ferguson, will you please do us the honor of leading us in the pledge, please?
Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Again, I'd like to welcome everyone that is here joined us in chambers. That includes staff and department heads and those that are watching remotely. In compliance with directives of the county, state, and Centers for Disease Control and Prevention, the CDC, this meeting is live streamed and closed to the public. Temporary procedures are subject to change pursuant to guidelines related to social distancing and minimizing person-to-person contact. Of course, we do welcome verbal comment at today's meeting. You can do so, that is make a verbal comment to the board on any item on the agenda or off the agenda by dialing 916-875-2500 and follow the prompts to be placed in queue for a specific agenda item or off-agenda matter. Please refer to the agenda and or watch the meeting to follow along to determine when is the best time to call to be placed in queue to make your public comment. You may be on hold for up to an extended period of time, and your patience is appreciated. When I open public comment for a specific agenda item or an off-agenda matter, the clerk staff will begin transferring you into the meeting. Each agenda item queue will remain open until the public comment period is closed for that specific item. We thank you again for your patience, and of course we also welcome written comments. You can provide your written comment again on any item on the agenda or not on the agenda by sending an email comment to boardclerk@saccounty.net, and that's Sac County, SACCOUNTY. Your comment will be routed to the board and filed in the record. Okay. Again, I want to welcome everyone to our final budget deliberations beginning today. Just a little housekeeping ahead of getting into the substance of the budget this evening. Again, as a reminder, we're having this meeting at a different time than our usual convening. We're having it obviously in the evening. And again, that is to hopefully invite more public participation, especially for those individuals who couldn't otherwise do so due to their work schedules and or their class schedules. I think for today, what I'd like to do, and I've been in consultation with both our clerk of the board and the CEO on this, is that in light of the fact that I suspect there's a good amount of public comment that we can expect tonight, I'd like to get through our department head presentations that the CEO has planned for us this evening to go over some of the highlights of specific departmental budgets. Certainly the board can obviously ask questions in the course of those presentations, and I would encourage us to do so. But please keep in mind that just before the meeting started, I asked the clerk of the board how many folks we already had in the phone queue for a verbal comment, and it was close to about 100 people. So we are going to institute a 2-minute rule tonight in terms of the amount of time each individual has to address the board, and that's there so that everyone can address the board if they so choose. Mr. CEO, I don't know if you had any opening comments you wanted to make.
Yes, I did. Just to kind of echo what you mentioned, what we plan on doing this evening is have a presentation from our Chief Financial Officer that will walk us through how this budget is built. After that, we have our sheriff. He's here to make a presentation. And then our Health Services Director, Dr. Bielenson, is here. There are other various department heads here that if you have questions, there was a question that came up about body cameras for probation. Chief Lee Seals here, and all the deputy county executives are here. So that was our intent for this evening, and then go into public comment.
Okay, very good.
So I just want to make a couple comments before I'm...
Sure.
Before I turn it over to Mr. Ferguson, I wanted to let you know that the budget that you have in front of you is, that's four things basically. Number one, it provides about $89 million fighting the pandemic. So that money is available. For bulk of that is in health services, but human assistance for homeless programs and the senior meals on wheels, not senior, I mean the meals for seniors in child, family, and adult services is included in that.
The dine-in programs.
The dine-in program, yes. Number two, what this budget does do is that it does provide for an expansion in a couple of programs. Our health services department, by the time if the board adopts the budget, their budget will increase by $140 million. And it's two-pronged, and Mr. Ferguson's going to go through it, and Dr. Bielenson will too. Mental health, there's $53.8 million that this budget provides for. During the last fiscal year into this fiscal year, we've been presenting to you some expansion in the mental health area, and they will walk you through what that is. And the second one is a public health commitment that we've made. It's about $70 million that you will hear what we have in there. Also, this budget, numerically, it's a small number. It's about $2.1 million, and the sheriff is going to address that. Is a body camera for the sheriff and for park rangers. Number three that this ends up doing for us is that it buys us time. As the economic uncertainty continues, we have a lot of data that comes in. What we are hoping to accomplish with this budget, if the board so adopts, is to continue monitoring during the fiscal year how our revenue picture looks, how our expenditures are looking, and then have a budget discussion with the board in June. The reason why I do spotlight that, and we say that every year, but this year is a particular urgency for us, is that this budget is balanced with $226 million in one-time money, which is a historical high. We've never been that high in the number. It is a risk that we are taking and presenting this to the board, that if that money does not materialize in even 50%, 60%, it will get us into a cut mode, and that will be positions, services, 71J contracts. But as we are reviewing this budget with you, those are four things I want to make sure that the board has the framework on how this budget is being presented and why we are presenting the way we are. So with that, Mr. Ferguson.
As Mr. Ferguson is making his way to the podium, I just want to acknowledge at the outset that we are in receipt of a great number of written correspondence leading up to today's budget hearing. I think in excess of actually 1,000.
Correct.
Emails, letters. We also have some written correspondence from a number of organizations, including but not limited to Sacramento Housing Alliance, Sacramento County Children's Coalition, Sacramento County Mental Health Board, our Public Health Advisory Board, Building Healthy Communities, Sacramento Latino Medical Association, and most recently a letter on behalf of the 6 cities in the county other than the city of Sacramento, signed by Mayor Aquino from the city of Folsom. So I certainly want to assure all the organizations and individuals that have taken the time to address the board today or in advance of the meeting that we have your written transmittals. They will be part of the record. In addition, I did make sure, in fact, this afternoon, that those that are advocating on behalf of the people's budget and who presented, the board members will recall on September 1st, their ideas about participatory budgeting. That entire presentation is also in the record for today's item. Before we get to you, Mr. Ferguson, I do have a number of colleagues that want to speak, so we'll start with Supervisor Kennedy.
Thank you. I really just wanted clarification from yourself and Nav, is because typically we have budget hearings during the day, and then often in the afternoon, staff will come back with some of the questions. I take it we're going to do that part tomorrow.
I think it's safe to assume that we're going to probably do that part and more tomorrow. What I'd really like to try and get through tonight is certainly hearing from the department heads that Mr. Gill mentioned. Certainly we're going to get an overview here shortly to begin with from Mr. Ferguson, but with a list of 100 speakers and perhaps a growing list of folks that want to call in and provide their input. Certainly want to afford them the opportunity to do that tonight. I suspect there'll be some questions and perhaps even some suggestions that are made by all of us. And some of what may be suggested certainly probably needs to be carefully thought through, at least over the course of another day before we reconvene. And that's not a departure from the way we've done it in the past. So good question, but that's how I see today's proceedings unraveling here. Supervisor Tully?
Yeah, just a question, again, a clarification. Nav, in your comments, you talked about what had been allocated under the COVID-19 CARES response, almost $90 million, 89.1 million. But my question is that does this budget, because some of those had time-sensitive expiration dates, does this budget anticipate in those areas where we've made allocations and board actions in recent weeks, but there may be a part of the conversation as we go through this evening and tomorrow and how long it takes us? Is it anticipated that there is full funding to continue programmatically, and whether it's contact tracing, it's testing, it's ramping up for potential vaccine distribution and so forth, whatever those components are, this budget then anticipates funding for the entire fiscal year as a part of the premise here?
So the answer to that question is we will be working with health services closely on how the expenditures are coming. If it turns out that we won't be able to spend the money by December 31, we will be back in front of the board going through a process on how to free up the money to make it go until June 30th. What I mean by that is we do have eligible expenses that we can offset with Treasury, but we do not want to have the services not go through all the way to June 30th. So when we get close to that, we will have that conversation with you.
And just by way of I guess, a more detailed point on that, as part of the action that we took with regards to the public health budget, the additional $44 million a couple of weeks ago, that included hiring up epidemiologists, additional public health nurses, a whole host of folks, positions that will have to be advertised if they're not already hired up. We have a number of contracts in that, but the task that you just said will go beyond December 30th. I think that's without any question. So it's anticipated that by adding those positions in, that again, both to the funding but to the staffing, that those will be for a full remaining portion of the fiscal year.
Correct. And I want to just emphasize the point is that whatever money we're not able to show Treasury that we're spending, we have a plan that will come back to you that will show how that will free up and become general fund and go to end of the fiscal year.
Okay, and it will then be the backbone funding for those authorizations that the
Correct.
board previously made. Okay, thank you. That's all I have for right now.
Thank you. One last point before we hear from Britt to Mr. Kennedy's earlier question. I also expect that we'll have a full, uninterrupted conversation about CIP tomorrow as well. So.
Good.
All right?
About what? I couldn't hear you.
About CIP.
CIP,
Yeah.
okay.
Any other kind of process questions? Okay. With that?
May I read the item into the record?
Sure. Please. Thank you.
Item 1 is your public hearing on and consideration of possible revisions to the fiscal year 2021 approved recommended budget.
Thank you, Mr. Chair, members of the board. As indicated, I'm Britt Ferguson, the county's Chief Fiscal Officer, and I have a PowerPoint presentation. This evening, I will be presenting an overview of the fiscal year 2021 revised recommended budget, which is fully balanced as required by state law. Like all counties in the state, Sacramento County's fiscal situation and this year's budget process have been impacted significantly by the COVID-19 pandemic, and of course, I don't have to tell you that. On June 16th, your board approved the recommended budget that provided appropriation authority until the budget is adopted at the end of this month. This year, however, that approved recommended, or approved budget, as we call it, was a placeholder budget that, with limited exceptions, rolled over the 2019-20 adopted budget appropriations, revenues, and use of fund balance. This was done to provide additional time to, first, further refine our estimates of the impact of the COVID-19 pandemic on the county's revenues and expenditures. Second, learn whether and to what extent additional federal or state relief might be available. And third, work with county departments to develop carefully thought out plans to make whatever reductions in expenditures that might be needed. Although many uncertainties remain regarding the impact of COVID-19 on the county's revenues and expenditures, it is clear that the negative impact will be significant. Nevertheless, as Mr. Gill alluded to, the revised recommended general fund budget provides substantial additional funding to address the impact of COVID-19 on the community, avoids significant reductions in critical county programs like Child Protective Services, Homeless Services, Indigent Health Care, and Public Safety Services, and makes new net county cost-funded investments in a very limited number of other programs, mostly to meet legal requirements or address the most critical needs. Our intent, as Mr. Gill indicated, is to provide time for the economy to improve and further COVID-19 impacts to be known before making any further budget reductions to critical county services that might be needed. It is important to keep in mind, however, that this budget is precariously balanced with $226 million in one-time resources, and if our discretionary and semi-discretionary revenue picture doesn't improve significantly, if our costs related to the pandemic increase dramatically, or if we don't receive additional federal or state relief, the fiscal year 2020-21 budgeted expenditure levels are likely unsustainable into future fiscal years. The county's all-fund budget totals $6.41 billion, and that's comprised of $2.4 billion in enterprise and special revenue fund expenditures funded through things like utility rates, fees, and other dedicated revenues. $875 million in restricted funds, which is dedicated revenue that is ultimately transferred to other funds for eligible expenditures, and examples would include realignment, Proposition 172, revenue, Mental Health Services Act funds, and the general fund with $3.1 billion in appropriations, of which $855 million represents the use of discretionary resources. The $6.41 billion all-funds budget is a $157 million increase in appropriations compared to the fiscal year 2020-21 approved budget, which is the same as the fiscal year 2019-20 adopted budget. This is the net result of increases and decreases in appropriations in different funds, including a $204.6 million, or 7.1% increase in the general fund budget, which I'll be talking more about later, a $54.6 million, or 31.4% increase in the waste management and recycling funds, due primarily to increased capital costs for new and continuing projects, a $38.7 million, or 36.7% increase in the Mental Health Services Act Restricted Fund due to the transfer of additional resources to the Health Services Department to fund initiatives that began in fiscal year 2019-20 and new initiatives for fiscal year 2020-21. A $28.6 million, or 16% increase in the water-related funds, due primarily to increased capital project costs, including things like the Arden Service Area Pipe Meter Project. A $19.2 million, or 7.2% increase in transportation-related funds, due primarily to the timing of capital projects. A $93.9 million, or 11.5% decrease in the semi-discretionary restricted funds, which is a reduction in the amount of realignment and Proposition 172 revenue transferred to fund realigned programs in the general fund. The primary reasons for the decrease in appropriations here are that the fiscal year 2019-20 adopted budget for these funds was balanced using a significant amount of fund balance carryover, which is not available this fiscal year, and the projected reduction in realignment and Proposition 172 revenue due to the COVID-19 pandemic.
Rick, can I interrupt you? I know that Supervisor Tully has a comment or question here, but I have one as well. It's a comment, and I think it's the comment I make every year during budget. And can I ask you just real quickly because this is for the benefit of the viewing public, just quickly explain why when they see a slide like the one you have that shows expenditures and revenues associated with, for instance, the airport system, why that is so different in terms of what we talk about when we talk about general fund, and especially net county cost within general fund, and how non-interchangeable these funds and expenditures should be considered.
That's right. So the special revenue and enterprise funds are funds that are set up specifically because the revenue in those funds, the money that comes into these funds, is legally restricted in what it can be used to. For example, is the airport. Airport Enterprise Fund receives money for the operation of the airport. It's not legal to use that money to fund any other county operations. Similar with regard to water funds, where it's ratepayers paying for water services. We can't take that money and use it for other things. The general fund is the one fund in the county that does not just include discretionary revenue, it includes dedicated revenue as well, but it's the only fund that has discretionary revenue that can be used really across a variety of programs.
Thank you. Supervisor Tully?
Yeah, thanks. Britt, just on this slide, in the last bullet point you were going over was the semi-discretionary revenue restricted funds decrease. Does that 93.9 million decrease, does it take into account the realignment backfill of 34.2 million? So where does that get plugged in? Because
So
we talk about reduction, but we actually got some back.
That's true. So that we did get 34.9. I'm going to get to that million in realignment backfill from the state. That is not technically considered realignment money, and so it does not run through the realignment funds. It doesn't run through them at the state level, and it doesn't run through them at the local level. It's factored into as basically departmental revenue to those departments that have realigned programs.
So it's not reflected in the general fund increase?
It
It's
is
not-
reflected in the general
So
fund.
that
yes.
204 million is includes the 34.2
Well,
million.
it's not really an increase because it's really backfilling part of the reduction. But yes, it does. It is reflected as revenue to the general fund.
Okay, so if someone was trying to track that on this chart to find out, you talk about decrease and increase, but it's really not shown in either of those two. Where is it? Is it spread throughout, like mental health?
Yes, so the direction from the state was to allocate the money essentially using the same formulas that we allocate realignment money. So that's what happened. So what we did was we looked at realigned programs, and just like we annually allocate realignment money to those programs, this year we also allocated the realignment backfill money to those programs.
And so, in brief, what departments received that?
So that would be, it would be health services, it would be child, family, and adult services, human assistance, the sheriff, probation, IHSS. I think those would be the primary recipients.
The proportional shares, because it was only a partial backfill, was allocated on what category?
So what we tried to do, the way we approached it this year was because we did have a significant reduction in realignment revenue. What we tried to do was hold all of the departments sort of harmless for that reduction.
Okay.
So between the amount of realignment revenue we had and the amount of realignment backfill we had and the amount of net county costs we had, we tried to hold them harmless from where they were when departments originally prepared their June budget before COVID-19 hit.
Okay. And just lastly, I appreciate the explanation, and that wasn't clear to me, and that's why I asked the question, but the amount of money then, it goes back into their base then? It supports the base programming funding in those?
Yes, pretty much, yes, because otherwise there would have been reductions in the base, yes.
Okay, very good. Thank you very much.
Yes. So I mentioned there's maybe I didn't mention, there's an $86.6 million, 14.7% decrease in the airport system funds due to a decrease in capital expenditures, and a $24 million or 20.1% decrease in the economic development fund due to the annual fluctuation in costs for environmental remediation at the former McClellan Air Force Base.
If I could, Mr. Chair, just before you leave that slide, just on the airports, could be the airports received separate CARES money?
They did.
Under stimulators. Is that reflected? You said capital, but there was almost 40 million plus, I think, that came to airports. And so how is that reflected in airports enterprise?
So the airports use most of that to basically defease some debt. So the impact of that was a reduction in their debt service obligations, and that would be reflected in their budget.
Okay.
The 2021 amount of that, yes.
Okay, thank you.
Oops. Okay. The general fund has total appropriations of $3.1 billion, a $204.6 million or 7.1% increase compared to the fiscal year 2021 approved budget. The budget units with the largest appropriation increase are Health Services with a $95.3 million or 20.1% increase in appropriations, due primarily to a $53.8 million increase in funding for mental health programs, and that's partly due to increased salary and benefit costs for existing staff, including the 29 positions added during fiscal year 2019-20, and budgeting for other program enhancements that began during fiscal year 2019-20 or that are included as growth in this year's budget, and a $25.8 million increase in funding for public health programs, mostly due to COVID-19 response initiatives, such as testing and contact tracing. This increase does not include the $45 million in coronavirus relief fund money the board allocated to health services after the budget document was prepared. There is a supplemental budget request to place that money in a reserve for public health response to COVID-19 that would be appropriated for the department as needed. And the department, I understand, intends to come back to the board in October with a budget adjustment. If that $45 million is added to the $95 million, the increase in appropriations for the Health Services Department will eventually total $143.9 million, or 29%. The next largest increase is the sheriff, with a $38.2 million or 6.9% increase, due primarily to increased salary and benefit costs for existing staff, and $12.3 million in growth, primarily in the Corrections Division, to meet our obligations under the May's consent decree regarding conditions of confinement in the county's jails.
Brett, can I just help you put a finer point on that? Isn't it the case that about 50% of the 6.9% increase is it's associated with contractual salary and benefit adjustments, correct?
That's about right, yes.
About 19.2 million?
Yes, that's correct.
Supervisor Tully?
Just a similar point. So as you run down through this, you point those out, but when we say contractual obligations, those are negotiated bargaining agreements with our employee representative groups. And so whether they be salaries or benefits, all that's rolled in. And so those that have the larger proportion of the workforce then would have proportional shares of that. And I just wanted to, as you look at the sheriff there on that slide, so if you backed out roughly $19.1 million for salary and benefit negotiated increases, as you mentioned with the May's consent decree, and I'll probably ask about this later on in the evening or tomorrow for certain, that there is a staffing increase under that of 36 positions, if I'm not mistaken, plus some in correctional health. All that's rolled in. I would just suggest that this is spread throughout our budget. There's a capital portion, there's contractual portions as relates to previous actions this board's taken. I guess I'd like to see somewhere beyond just in a summary statement, either related to sheriff or correctional health or Department of General Services or under county executive. If we can find a place in our budget going forward, because we'll be living with that consent decree for some time to come, where we can actually see a breakdown and kind of the additive, because you mentioned this, and you may get, and I don't want to get ahead of you in your presentation, but we've already committed, I think, if I'm not mistaken, with this year's budget, about $44 million ongoing to staffing pieces of that consent decree. I think it's important. This budget document has a lot of information in it, and it's a result of obviously of many months of work, ongoing work. I would like to see us, if possible, Mr. Chair, if we could, for the purposes of going forward, to have that, so we can at least, and then we can go back into the various elements of the budget and pick that out for ourselves, and/or as you pointed out in your presentation. I just think that would be helpful, Britt.
Sure, we can do that for you.
Okay.
Yeah,
I think
absolutely.
I think it's a good suggestion, because it's no fault of anyone, but it sometimes can be a bit disjointed. There's a lot of moving parts to the consent decree, so I think it's a good suggestion. Also, I'd like to just remind viewers and have it confirmed again by you, Britt, that when we're looking at personnel increases for per the consent decree, it's not personnel increases or even capital expenditures to add capacity in the jail.
Right.
It's to basically satisfy the time out of cell requirements of the consent decree, as well as making sure that we have a more robust correctional health and mental health system that's appropriately staffed, is it not?
That's correct. We're not looking at adding any capacity. It's all, as you say, directly related to conditions of confinement, like out of cell time, like as you say, mental health. Additional mental health services is a big part of it. Health services, meeting HIPAA requirements, meeting ADA requirements, those sorts of things. Yes.
Thank you.
So the next, in terms of the size of the increase in the budget in the general fund, is the Human Assistance Administration budget with a $26.4 million or 7.8% increase. That's due primarily to increased salary and benefit costs for existing staff again, and approximately $11 million in increased expenditures related to the COVID-19 homeless response plan that the board has approved, and approximately $12 million to add 129 new positions to process CalWork applications to deal with backlog and other issues in that area, and that part is funded by additional federal and state revenue. Next is Child, Family, and Adult Services with an $11.8 million or 5.5% increase, and that's primarily due to the inclusion of $6.9 million in funding for the Dine at Home Sacramento program that Mr. Gill alluded to, and that provides restaurant meals to homebound seniors at risk of getting COVID-19, as well as, of course, the increased salary and benefit costs for existing staff. And then the last department in terms of this list of departments with the largest increases is the Probation Department with an $8.6 million or 5.4% increase, and that's due to increased salary and benefit costs for existing position, including the 15 positions added during fiscal year 1920 to implement the Supervised Pretrial Release Pilot Project. The revised recommended general fund budget is driven by a number of factors, including, first, the budget assumes a general fund available fund balance carry forward of $161.6 million, an increase of $75.6 million or 88% from the approved budget level. Approximately $146 million of that fund balance carry forward is due to the use of federal coronavirus relief fund revenue to offset eligible salary and benefit costs of existing employees in fiscal year 2019-20. Without the use of CRF revenue for this purpose, the general fund available fund balance carry forward would have been only $15 million or a $71 million reduction from the approved budget. This additional $146 million in fund balance was used as follows. First, $15 million, as you'll see in the budget, was used to fund additional COVID response activities with net county cost in fiscal year 2021. That's in addition to what was funded directly with additional CRF money in fiscal year 2021. And $131 million was used to help balance the fiscal year 2021 general fund budget and avoid major reductions in programs and services. The revised recommended budget includes $89.1 million in expenditures to address the impact of COVID-19 on the community. This includes $70.1 million for the Health Services Department, including $26.1 million in appropriations in the Health Services budget itself, and $45 million in the new reserve for public health response to COVID-19 that I mentioned earlier. And this money will be used for things like testing, contact tracing, business navigators, and Dr. Bielenson will be providing more detail about that shortly. The budget includes the money for the COVID response, as I mentioned, includes $6.9 million for the Child, Family, and Adult Services Department to continue the Dine at Home Sacramento program that pays restaurants to provide meals to homebound seniors, and $11.1 million for the Human Assistance Department for the COVID-19 homeless response plan. These investments are funded with CRF revenue, net county costs made available as a result of the higher fund balance created by using CRF revenue to cover eligible salary and benefit costs in fiscal year 1920, and other revenue sources like ESG and CDBG. With these investments, all CRF revenue has been allocated.
Britt, I'm going to stop you there. Question or comment from Supervisor Tully?
Quick question. So the dine-in program, we're providing meals to roughly 1,000 seniors working with Area 4 Agency on Aging. And
Bruce,
yeah.
Bruce Wagstaff, Deputy County Executive. With the total amount, with the additional amount that Britt made mention of, would take you to that number. That's correct.
To 1,000, and that's funded through June of next year?
Well, yeah, that's right. I mean, we're going to try to continue the meals, and we're going to be monitoring the effects of the pandemic too. But at this point, that's where we stand with the Area Agency on Aging.
So as long as we're under emergency health order, stay at home, at-risk folks being advised to not go to their homes, again, meeting the age qualification, this is budgeted, assuming that those conditions exist, whatever else is the criteria, through June 30th.
So, Supervisor Tully, it's the same question earlier.
Yeah.
Whatever is not used by December 31st, we plan on converting that into general fund to continue the appropriation until June 30th.
But ever how the money, whatever that color money, we're going to have enough to do 1,000 seniors to June 30th, whether you have to,
Correct.
to refinance it through another means or whatever, but we have the ability to do that.
Correct.
So seniors are one of the most vulnerable populations, as you know, Supervisor, and we wanted to make special efforts to address that need. If I could, just one other mention while I'm up here. Britt made reference to, in the last bullet there, the ESG and CDBG money that we've allocated. We have used amounts of those funding sources for our COVID homeless plan to date, but I wanted the board to know, based on comments that have been coming in, that in addition to those amounts that we've already allocated, there are additional amounts of ESG and CDBG money coming forward out of the Federal CARES Act. And our homeless team is actively looking to confirm those amounts and determine how best to use them during the course of the pandemic. But in addition to that, we are actively working with SHRA and our stakeholders to look at a potential rental assistance program with the use of that additional money. Again, we're trying to confirm the amounts that we're actually getting, but it's our hope that we can come back to you in October with the details of that. But given those comments that have come in, I thought it was worth mentioning that we are actively working on that.
And I assume, Bruce, when it comes to rental assistance, there's no reason why we couldn't explore the prospect of trying to complement what some of the other jurisdictions within the county are doing on that front.
I think we could take a look at that, yes.
Okay.
Again, the SHRA has had the lead on the rental assistance, so we're working actively with them. They've already put a proposal together for the city. So
That's why I make the comment.
yeah,
So,
thank you.
was that all your comments? So I had just one comment before you leave the slide, Britt, and it really is mostly for the benefit of the mayors of the 6 cities that wrote the board and received their letter late today. I think if they're watching, they're going to see that in the course of the presentation, there are a number of their suggestions and concerns that are directly addressed by the detail that you're providing with the budget that you're presenting. But I just want to put a fine point on the fact that of the $45 million that was appropriated for public health a few weeks ago, I believe it's $3 million of that includes assistance for businesses. So I just didn't want. I'm actually looking at the memo from Dr. Kasiri. I just didn't want there to be no mention in your presentation about the fact that there is kind of buried in that $45 million some specific assistance for businesses. It doesn't mean that we couldn't explore other ways to assist businesses, especially restaurants in the unincorporated county, but that's one of the things that was specifically referenced in a good portion of the letter by the mayors.
Mm-hmm. Right.
Thank you.
So, continuing with the drivers of the budget, the revised budget assumes the use of $6.6 million in general reserves to balance the budget. This will leave a general reserve balance of $12.7 million and will require a suspension of the board policy that calls for increasing general reserves each year by an amount equal to 10% of the general fund's available fund balance carry forward. And so for this year, that would have been an increase of $16 million rather than a decrease of $6.6 million. The revised budget recognizes receipt of $688.5 million in discretionary revenue and reimbursements, an increase of $23.7 million or 3.6% from the approved budget level. This is due primarily to a $27 million or 5.8% increase in property tax revenue, partially offset by a $6.6 million reduction in sales tax and transient occupancy tax or TOT revenue due to the economic impact of the COVID-19 pandemic.
That's not on your slide, though. Where are you reading from that?
I think it's there.
I think it's under discretionary revenue. He doesn't have property tax and sales tax.
Didn't break it out in the slide, but it's in the budget
That's what you
document.
reference. The $23.7 million is those 3 sources. The
Yes.
TO, the property tax, and the sales
Yes.
tax. Okay.
Yes.
Okay.
Yes. The revised budget assumes the receipt of $721.5 million in semi-discretionary reimbursements. Again, semi-discretionary being realignment of Prop 172 revenue, a decrease of $94.2 million or 11.5% compared to the approved budget level. Again, that's due primarily to the economic impact of the COVID-19 pandemic on both fiscal year 1920 and 2021 realignment and Proposition 172 revenue, which are derived primarily from statewide sales tax revenue. The revised budget includes $34.2 million in realignment backfill revenue, as you mentioned. This is state general fund money the state provided counties to partially backfill the loss of realignment revenue. Although not technically realignment revenue, the state required that the money be used to fund realigned programs. The revised budget includes $57.7 million to cover salary and benefit cost increases for existing employees as required by our various collective bargaining agreements. The revised budget maintains funding for the various programs historically funded with TOT revenue, like the civic organizations such as Visit Sacramento, the Center for Sacramento History, and the Greater Sacramento Area Economic Council, board community funding, the TOD grant program, and the arts. And it maintains funding at the same level as in the fiscal year 2019-20 budget, despite the significant reduction in TOT revenue. The revised recommended budget includes funding to meet various legal obligations, including, as you mentioned, $44 million, including $9.4 million in growth to meet our obligations under the May's consent decree regarding conditions of confinement in the county's jails, a $7.7 million payment to UC Davis to meet our obligations under the UC Davis Health System lawsuit settlement agreement, $4 million in the litigation settlement reserve to help address the county's as yet unknown liability under the Hardesty Schneider lawsuit, and $6.7 million to repay the money owed to the general fund, by the general fund to other funds that loaned money to the general fund during the Great Recession.
Supervisor Tully?
Yeah, and just on that last item, Britt, so what's the outstanding balance? The workers' compensation fund, one that we borrowed from, and I know we were still at $30 million or $40 million balance a year or two ago. What do we pay that down to? And again, that's an obligation we have to ourselves, and I think we've told our credit raters.
Yeah. We started the year owing $20 million. So this will bring it down to about around $15 million.
Okay, and just with that number, again, I think it's certainly keeping faith with what the board's actions were a number of years ago when we were trying to find every nickel we could to maintain county services at the time. But the 6.7 is a number that's being recommended. We have the ability to do more or less, but we certainly want to repay that. Is that correct, or are we on some schedule?
So that's technically true. But we have certainly the county's rating agencies, for example, are very aware of this plan and look for this when we have meetings with the rating agencies, the bond rating agencies. So I think if we were to deviate from this, it would certainly raise questions and perhaps impact our ability to issue debt. So I think we need to be careful about that because, as you know, the original commitment, I think, was to pay it back in 3 years, and now we're at like 10 years and counting. And so I think they are looking for, they weren't so much concerned with the exact amount we paid back each year, but they're looking for the ability to stick by the commitment they think we made to get it paid back.
Right. No, I appreciate the caution, and that's an obligation that certainly we need to pay back to the funds. I just wanted to know, though, this board has not approved a particular schedule or plan in any budgetary units. You're as a fiscal agent for the county, obviously.
I think, Supervisor, I hate to jump in, but I think one of the couple fiscal years ago, we did bring something to kind of show you what the plan will look like, and that's what we took to the rating agencies. Yes, we did not ask you for a formal vote, but when we presented the budget, we said this is what the schedule will look like.
Right.
We went back to the rating agencies, which helped stabilize our ratings. So there is an expectation, as Britt said, that 6.7 is in there. And the main point that we have with them that they continue using was that there's an original document that we did that the board approved in 2009, I believe, that all these loans will be paid back by 2012. So we're going 2020, so that's sort of the risk with that number, is that there is this expectation they have from us.
So again, but nobody predicted a pandemic in 2020 either. So let me just ask to that point, is the schedule then 6.7 for the next 2 ensuing years, so you're down to 0 by 22, 23? Is that what the plan is here?
2022, right?
21, 22?
Yeah, one more.
In 22, 23, because you
I think
just
we've
told
got
me.
2 more fiscal years. I
This
think.
and 2 more?
This and 2 more, I think, yes.
Yeah, this and 2 more.
So that's the plan. But if, for example, we wanted to just pay $6 million this year and use $750,000 for something else, I mean, that's within the board's discretion. It doesn't deviate that much, but it's 10% of what the amount there. Or 6.7, you just take the $20 million, divided it by 3 to pay it off in the next 3 years. Is that?
So I think, again, so having been sat through now over the last years that I've been here, meetings with the rating agencies, I think what they're looking for, it's from their perspective, frankly, it's the equivalent of a test of character on the part of the county. We committed to paying this back. They're looking for evidence that we are sticking by that commitment. We told them of the plan that Mr. Gill mentioned, that this was our plan to pay it back. They're looking for that. I think if we did, legally you're right, we don't have to do that.
Yeah.
But I think if we didn't, it would really.
I'm not suggesting we don't pay it back, and we started out at $79 million, if I'm not mistaken.
Yeah.
It was way up there, and we have paid it back even in tough years. And so I'm not, argumentative. I just want to make it clear that where we started from, as we've worked out of the recession, and now in the particular position we're in, and not knowing what next year's going to bring, I'm even thinking ahead of here. Is that
Didn't take it as argumentative. I just want to make sure that
Yeah.
I had the background that there's a different expectation they had, and that wasn't to argue the point. I just wanted to make
I
sure
know.
you were aware that their expectation has been very different than what we've done.
And you said, a sense of our character as a county, we are committed, and we started out, it was almost $80 million, if I'm not mistaken. I could be wrong about that number, but we brought that down significantly over the past 10 years, and with every intent to pay it. So, thanks.
Supervisor Peters?
Yeah, thank you. I remember those discussions. We had them here, and all the ramifications of not paying it down, turning into higher interest rates and things like that. So I think we got to keep that in mind as we go through this. It's not something we want to do. It could be more expensive than whatever we might get out of it.
So if you take the available fund balance and you add the discretionary revenue and reimbursements, the semi-discretionary reimbursements, the realignment backfill, and other departmental revenue and reimbursements like federal, state, and fee revenue, we end up with $3,081,876,000 in total general fund resources. From that, you subtract the requested base appropriations of $3,081,876 which basically that's the impact of salary. That's sort of current staffing and programs and adjusted for cost of living increases and so forth, and the $61.5 million in recommended growth. That's newer enhanced programs, which I'll be talking about later, and the required net increase in TETR reserves, and you end up with a budget gap of about $24.5 million. To bridge that gap, the revised recommended budget includes $17.8 million in expenditure reductions and the cancellation of $6.6 million in general reserves, as I discussed earlier. To identify where to make expenditure reductions, general fund departments were given an initial net county cost target, which was generally their fiscal year 2019-20 adopted net county cost allocation. As part of their budget submittals, departments were asked to identify what reductions they would make to meet that target and what the impact of those reductions would be. Staff from the county executive office reviewed department submittals, discussed them with the relevant department heads, and recommended whether to accept the reductions identified by departments, restore some or all of the reductions, or request additional reductions, and we did all of those things. In making our recommendations, we were guided by the following considerations. First, limit the impact on board priority programs or initiatives, things like the Black Child Legacy Campaign, the Healthy Partners Program, the various homeless initiatives, and neighborhood and parkway cleanup initiatives that I will talk more about later. Second, avoid backfilling reductions in federal, state, or other revenue other than semi-discretionary revenue, but recognize there may be circumstances where backfilling or using net county costs to cover cost increases is warranted to avoid serious negative consequences, and the revised recommended budget does include some limited backfilling. And third, avoid employee layoffs and the resulting impact on contracts with community-based organizations due to Measure J to the extent possible, and we were successful in avoiding layoffs. And I'll just say a word there. Your board may know that under Section 71J of the county charter, if we do layoffs, we're required to do an analysis and identify contracts that essentially where, say, community organizations that essentially do some of the same sort of thing and eliminate those contracts before we do any layoffs. So that's the 71J issue.
What's the approximate amount of those contracts?
I think it's about 50 million?
100.
Oh, was it 100
It's
million?
about, our approximate amount is 100 million at this point.
So we'd have to eliminate $100 million in
We
contracts before we get to laying off
We'll have to
employees.
analyze which positions are being impacted.
Right,
So it won't
okay.
be a blanket 100, but we have to go through what's the position, what's 71J that backs up, and then go through those reductions.
Thank you.
As noted, the revised recommended budget includes $17.8 million in program reductions in 14 general fund budget units and reflects the elimination of 26 vacant positions. No layoffs are proposed, as I indicated. All told, there are 40 specific reductions identified and described in more detail in the budget document. I'm not going to go through each reduction here, but I will highlight some of them. The relevant department heads and I will, of course, be available to answer any questions either today or tomorrow the board may have. To begin, then, the recommended program reductions include $6.1 million in categorical reductions. That is, expenditure reductions in response to reductions in state or federal revenue for particular programs. The departments with the largest categorical reductions include Health Services, with a $2.3 million reduction due primarily to the end of the Dental Transformation Initiative, which is scheduled to end on December 31st, 2020. This initiative was a 3.5-year pilot project from July 1st, 2017 to December 31st, 2020, funded by the State Department of Healthcare Services, focused on increasing access to dental care for Medi-Cal-eligible children and young adults up to 20 years old. And I think this was actually federal money through the state, for the federal government, but it came to the state.
And Britt, that's part of the $6 million that's listed there for health services?
That is part of it, yes.
Okay.
Yes, that's the largest categorical component of that, yes.
Okay.
Then the next largest categorical reduction is in child support services with a $1.6 million reduction. And child support services, as the board knows, is a program that the county essentially provides as a contractor to the state, and it has always been entirely funded by the state. In fiscal year 2019-20, the state increased funding for this program substantially, and we added 23 positions and enhanced services. Due to the impact of COVID-19 on state revenues, this year the state reduced funding and funded positions are being reduced by 15. So actually the number of positions the department has is still higher than it was 2 years ago, but less than it was in 2019-20. So that's the main categorical reductions. The remaining $11.7 million in reductions are non-categorical. Here, the department with the largest increase include Health Services with a $3.8 million reduction. This is due primarily to a $3.4 million reduction in funding for the Psychiatric Health Facility or BEDS program. This is a situation where the Health Services Department submitted their requested budget when the Health Services Department submitted their requested budget in February, they anticipated a higher demand for beds in fiscal year 2019-20 than actually occurred, and based their fiscal year 2021 budget request on that estimate. Based on actual fiscal year 2019-20 caseload data, the department has revised downward their estimate of how many beds will be needed and also revised their estimate of when a new psychiatric health facility, or PUF, will open, and thus have indicated that appropriations can be reduced by $3.4 million with no impact on services.
Britt, I'm going to interrupt there. I know Supervisor Tully has a question or comment, but before we go to him, we've received a number of emails in recent days that are specifically concerned about what they view as the cuts to public health in the middle of a pandemic, and it's hard to refute that when you simply see a spreadsheet like this without some explanation. And when you look at both the categorical and the non-categorical, and the largest amount is $6+ million for health services. What's the best way, the most effective way, do you think, to explain to folks what that means in the context of the pandemic?
So I think part of the issue here, and if I had an easy way to do that, I probably would have done it that way. But I think what people have to keep in mind is the Health Services Department is a large department. It has a budget of over $500 million, and it provides services in a whole variety of areas, some of which are funded with local money, some of which are funded with state and federal money. And we typically, when for example, in the case of the Dental Transformation Initiative, when money is made available by the state or federal government for certain programs, if we think it's a program that's worth pursuing, we will apply for that money and use that money for the program with the clear understanding that if the money goes away, that program is not going to continue. And then also in some cases there's programs like the psychiatric bed facility where there's a reduction, but there's really no impact on service levels because caseloads are down. And we see that a lot, for example, in human assistance, where on the aid payments budget, where sometimes it'll go up dramatically, it'll go down dramatically, and it really is not related to people getting less services. It's related to caseloads changing. They go up, they go down, whether it's foster care or CalWORKs. And so I think that's really the message here. It's important not to look at just a number and say there's a reduction, and that really means services are being reduced.
I can agree with you more. That's why I'm asking the question. But I think it deserves to be said, though, that the reductions, whether they're categorical or not here, none of them are COVID-19 response related.
They are not.
Okay.
No, they're totally unrelated to that.
Supervisor Tully?
Yes, just in that same category, then there's another reduction. You mentioned the dental transformation program, and obviously I appreciate the explanation on the psychiatric health facility beds, because it's no reduction in services. It's actually a budget revision where the utilization, if I understand correctly, is not as high as estimated, which I guess is a good thing. But what about the Women, Infants, and Children's program, which had a categorical reduction, but actually $187,000. I don't know what the match requirement, if there was any, but that could be, again, it's categorical reduction, but it's also nutrition assistance for families, largely, families with infants and toddlers. That is a piece of that, and that's 3 positions that is kind of buried in all that $6 million. That, and again, I've raised this certainly in my briefings, an area I want to spotlight when we get to deliberations later on. But I just wanted to note that because that's an important program. It's important for support for families, and I think that a lot of times we take categorical reductions because, as you said, in child support services where it's a state contract, here either we provide some match or some accommodation, and then when those are cut, we just we can make the assumption that either we're not going to do it or we got to backfill it. So I don't know. Can you shed a little light on what the decision was to not fund those nutrition assistant positions? So
again, sort of the bias going into federal and state funded programs is not to backfill reductions, but we did look at some, and we did backfill
right,
some. So we did look at this one. The department identified what their priorities was part of the issue. In addition, in this case, some of the positions have been vacant for some time, so there has not been essentially the services have not been being provided. So it's not literally a reduction; it's just not getting back up to where they were originally budgeted for. So I think those were some of the issues, but perhaps Dr. Bielenson can speak more to that.
And it's okay when he comes up for his presentation. I don't want to interrupt your presentation at all. When Dr. B comes up, we can probe that a little more deeply. But one other question regarding categorical programs. Because they are tied either to state or federal funding directly, are they subject to 71J? So
yes, it doesn't matter.
It doesn't matter.
Nope.
So if there's a reduction and there's actually a person in that position, then before that person can be laid off, either we have to backfill it or you go through that whole exercise of seeing if it displaces somebody who's in the county workforce.
That's correct.
Yep.
So if we saw sizable categorical reductions where you didn't have vacant positions, either the choice is either we backfill, or then you look to begin to cut contracts before you got to actually reducing.
So what you're remembering is the exercise we went through starting in 2008, because we were starting to see categorical reductions before we saw reductions on our side. Once we started taking categorical reduction, it triggered the whole 71J analysis we had to do that we didn't finish till 2010, 2011.
Okay, so to your point, it doesn't matter. I guess it matters to the employee and obviously to the contractors that are providing services. But
Correct.
Okay.
So how that works then is we have to, if we do trigger a layoff, 71J gets triggered, we have to exhaust the layoff list before we can go back and do another contract. So the employee has a right to come back.
Okay, thank you.
Then continuing in the larger non-categorical reductions is the District Attorney's Office with a $2.8 million reduction in appropriations, which they will achieve by not filling positions as they become vacant throughout the year. And then the Sheriff with a $2.3 million reduction, and he will achieve that by keeping positions vacant and reducing services and supplies costs in a variety of programs. In addition to reductions in certain programs, the revised recommended budget included $124.9 million in new or enhanced programs, again, what we call growth. The general fund budget includes $22 million in growth funded with net county costs, that is discretionary resources. Most of this represents either what are essentially mandated services, like expenditures to comply with the Mays consent decree regarding conditions of confinement in the jails, or efforts to address the impact of COVID-19 on the community. The remaining growth is funded with state, federal, or other dedicated revenue. Some of the more significant recommended growth include $26.8 million to respond to the COVID-19 pandemic, funded with $17.5 million in CRF revenue and $9.3 million in net county costs. This includes $22.4 million in the Health Services Department budget for things like testing and contract tracing, and $3.5 million in the Child, Family, and Adult Services Department budget for the Dine at Home Sacramento program that provides restaurant meals to homebound seniors. And a point to make there is the total amount for the Dine at Home Sacramento was about $6 million, but $3 million's in the base because it started in 1920, and then the additional $3 million is in the growth for 2021. There's $2.1 million, as Mr. Gill indicated, in net county costs as the first phase of an effort to provide body-worn cameras to all sheriff's deputies and regional park rangers. This phase provides cameras to all patrol deputies, watch commanders and sergeants, the special enforcement, major crimes and gang details, deputies assigned to the Elk Grove School District, and regional park rangers. Future phases will include deputies and security officers assigned to regional transit, Folsom Dam, security services, the courts, and corrections. Phase 1 includes $1.4 million in the non-departmental cost budget unit to cover the cost of the cameras, and $675 million and 6 positions in the sheriff's budget unit to review and maintain videos and respond to public records requests, and I'm sure the sheriff will address that in his presentation. There's also $9.4 million in net county costs as part of continuing efforts to provide enhanced staffing and services in the county's jails to meet our obligations under the Mays consent decree. This includes $7.6 million and 36 new positions in the sheriff's budget, as Supervisor Natoli indicated, and $1.8 million and 13 new positions in the Health Service Department's Correctional Health Services budget. And there's $2.6 million in funding for various mental health initiatives, including expansion of the Behavioral Health Crisis Collaborative Project with Dignity Health and program expansions at the Mental Health Urgent Care Clinic. As proposed, as I indicated to you earlier, the revised recommended budget continues funding for the priority programs and services that were initiated over the last 5 years with board approval. Here I will just briefly summarize what those initiatives are. You're all aware of the Black Child Legacy Campaign, which involves the implementation of a strategic plan to reduce disproportionate African American child deaths through community-based contracts and targeted staffing in child protective services, public health, and probation. The Healthy Partners Program, which provides health care services to undocumented immigrants. The board has approved several homeless initiatives, such as providing rapid rehousing, the Winter Shelter Program, improving family crisis response in shelters, preserving Mather Community Campus, establishing a full-service rehousing shelter, and implementing a flexible, supportive rehousing program. The Sacramento COVID-19 Homeless Response Plan that was just recently implemented in response to the COVID-19 pandemic. This is a collaborative effort between the county, the city of Sacramento, Sacramento Steps Forward, and the Sacramento Housing and Redevelopment Agency that utilizes approximately $11 million in local, state, and federal funding to mitigate the spread of COVID-19 among the homeless by using motels to provide housing, along with meals and health services, and assisting persons in motels to find more stable housing. The Parkways and Unincorporated Communities Cleanup and Safety Initiative to reduce the incident and mitigate the impact of illegal camping in the American River and Dry Creek Parkways and in the county's unincorporated communities. The Sheriff's Intelligent-Led Policing Model that utilizes data to target resources to the most important areas with the most critical needs. And the Behavioral Health Services Initiative that provides enhanced services to persons with substance abuse problems with the goal of reducing reliance on hospital emergency rooms and ensuring that persons experiencing substance abuse crises receive the best treatment possible in the most appropriate setting for their needs. The continued implementation of the Mental Health Services Act plan to expedite services for individuals with serious mental illness and/or co-occurring substance abuse disorders that are homeless or at risk of homelessness. The continued implementation of the probation adult supervision model that prioritizes supervision and services for all high-risk probationers in the first 6 months to a year of probation with the goal of reducing offender recidivism. Implementation of probation's new supervised pretrial release pilot program as an alternative to cash bail that uses validated risk assessment tools to determine who should be released from jail while awaiting trial and monitors those released to help ensure they appear for trial. The goal is to get more people who are awaiting trial out of the jails. Community livability initiatives, such as increased code enforcement and graffiti abatement activities, the enhanced 311 call program, and the community prosecution unit in the district attorney's office. Initiatives in animal care focused on maintaining the animal shelter's 90% live release rate. And finally, efforts to reduce fire danger and illegal camping, increase debris removal, and generally enhance the visitor experience in the American River Parkway and the county's regional parks. The revised recommended budget includes 12,555.4 full-time equivalent positions, a net increase of 186.8 positions. As indicated, the revised recommended budget is balanced in part by the cancellation of $6.6 million in general reserves. With this cancellation, general reserves will stand at $12.7 million, which is 0.4% of general fund appropriations. We are recommending one supplemental adjustment to the revised recommended budget based on information that became available since the budget document was prepared. And of course, I've mentioned this a number of times. And as you know, on August 19th, the board approved an allocation of $45 million in CRF revenue to the Health Services Department to address a variety of needs related to the COVID-19 pandemic, primarily to expand the surge capacity workforce to process laboratory specimens, conduct contact investigations and tracing, administer tests, process test results, and provide education. Contract with community-based organizations to provide public outreach and education and wraparound services to disadvantaged communities to facilitate adherence to measures that reduce the spread of infection and provide food and housing assistance to individuals that need to be in isolation or quarantine. There's other aspects, and Dr. Bielenson, I'm sure, will be addressing those. We are proposing that the $45 million be placed in a reserve for public health response to COVID-19. That reserve will be canceled as the Health Services Department identifies and brings to the board a specific budget appropriation adjustment request, which they are currently planning to do in October. The revised recommended budget is based on certain assumptions about future revenue and expenditure requirements and relies more heavily than usual on one-time resources, as has been noted. Though currently balanced, there are many factors that could negatively impact the county's fiscal situation this year and/or in fiscal year 21-22 and future years. These include the use of one-time funding. As noted, the revised recommended budget is balanced largely with one-time resources. Unless discretionary and semi-discretionary revenue comes in significantly higher than the current estimates in fiscal year 2021 or very high in fiscal year 21-22, or we receive additional federal or state relief funding that can be used to offset revenue loss, it is unlikely the fiscal year 21-22 general fund budget can be balanced without substantial program or staffing reductions. Second, the COVID-19 emergency discretionary, semi-discretionary revenue situation. Expenditures to deal with the COVID-19 pandemic could be higher than budgeted, or discretionary and semi-discretionary revenue could come in lower than our projections. Salary and benefit costs for county employees could increase substantially depending on the outcome of negotiations with the county's employee bargaining units. All 30 of the county's collective bargaining agreements are set to expire at the end of the current fiscal year. In addition, in May, the Sacramento County Employee Retirement System, or SCRS, board voted to lower the assumed investment rate of return from 7% to 6.75%, which will increase both employer and employee share of retirement costs. And finally, the Hardesty Schneider lawsuit. The county could be required to pay a substantial amount of money as a result of that lawsuit. The county lost this case in federal district court and was found liable for $105 million in damages. The Ninth Circuit Court of Appeals recently affirmed the judgment against the county, but vacated the damages amount as excessive and remanded the case back to the district court to reconsider the damages. At this point, it's unknown the level of damages the county may face, and as indicated, we only have $4.7 million in reserve to cover these costs. So in conclusion, the budget is precariously balanced with one-time resources. The budget includes $17 million in program reductions. The budget has a limited number of net county cost-funded newer enhanced programs. And given COVID-19 related economic and fiscal uncertainties, additional program reductions will likely be needed in the future. At this point, after your board has listened to the public and deliberated and made any revisions that you'd like, our recommendation is that you approve the revised recommended budget, that you direct the Department of Personnel Services to prepare an administrative salary resolution amendment to reflect the positions approved by the fiscal year 2021 adopted budget, including any deletion of positions, and that you direct the Department of Finance to prepare the fiscal year 2021 budget resolutions for board consideration on Tuesday, September 2nd, 2020. With that, if you have any questions, I'd be happy to try and answer them.
Great, thank you, Britt. I know Supervisor Natoli and Frost are currently in the queue to ask questions or make comments. One of the things I didn't see in the presentation, but certainly I know Mr. Gill's well aware of my interest in, because we've had conversations about it as recently as about an hour before this meeting commenced. But in terms of the CARES Act funding, because there continues to be a great amount of community interest in the disposition of those funds due to the fact that we've accounted for them to maintain fund balance here. How best to kind of characterize what is left to consider that is discretionary, or that has already been assigned through contracts, especially given the fact that we acted again a couple weeks ago relative to the request made by our public health officer and the $45 million allocation. I think it's important for us to all have a very clear understanding of what the board can and perhaps should be considering in our deliberations relative to the balance of funding left in that particular pot.
So I guess the best way to sort of summarize it is all of the community coronavirus relief fund money that the county received has been utilized. It's either been utilized to balance the provide additional fund balance for that carried over and was used to both to fund additional coronavirus activities and to balance the budget, or it's actually included either in the budget as money to, say, the Health Services Department or the Child, Family, and Adult Services Department, or in the reserve for health services. So all of it has been used for that. Not all of it has been spent, obviously, and I don't know exactly how much has been spent at this point or entered into, or where contracts have been approved, but it is all included in the budget for some purpose.
So every 2 weeks when Dr. Bielenson's coming back, he will be making a presentation on the allocation that's made, how much of that's been spent, how much of that has not. So part of our commitment when we made the decision a couple of weeks ago is that if we start seeing that money is not going to be utilized, or if there's a different direction we need to go in, that will be the opportunity for us to redirect that money. But if that's the desire. If we still want to continue with it, then if we're not going to spend the money by December 31st, as Supervisor Natoli was asking, then we do have expenditures to free it up and make it general fund money.
It's my understanding, Nav, though, that this budget actually includes some of the expenditure of, or the appropriation of the balance of the CARES Act funding, but that there is a portion of it that I believe it's around $32.9 million, and of that there may be some contracts that have already been let, which would obviously limit the application of our discretion to do any kind of reprogramming if it was the will of the board to do that. But there may be a subset of that $32.9 million that we could, if again there's enough interest on the board to reconsider how we would
So
spend
we
those
could
dollars.
we could check with the departments and see what the status is to see whether, well, for example, the Dine at Home Sacramento program, about half of that money has been contracted. I don't know if it's all been spent, and half of that money will be coming to you with a new contract here, I think, within the month. But that contract hasn't been approved yet, so you could scale back that program if you wished and use that money for something else. That would be a possibility. It's in the budget going to them, but you could make that change. And we can look and see where else in the budget, health services, for example, that they might not have spent all that money. We could see if some of that money could be reprogrammed.
I believe there was a commitment made, correct me if I'm wrong, Nav, that you were going to, by tomorrow, give us kind of an estimate of what that dollar figure is, correct?
Yeah, we are working on see how much is committed, how much is contracted, and what's the balance that's still available.
All right, very good, thank you. Supervisor Tully?
Yeah, just a couple of quick questions in the adult, family, and child services, or child, family, adult services department. There was mention in the growth request not recommended the Care Plus program through the Conservator's office, and that there'd be $440,000 annually in avoided costs. The net county cost would be $168,000. But the growth request was not recommended, and it would help behavioral services. So I guess maybe for tomorrow's purposes, we have a report back as to what didn't pencil out there. If you're saving $440,000 and you're spending $168,000, it would seem to me that that's a net improvement, hopefully both in service delivery, but also in budgetary responsibility. And again, it's one of those where it crosses over to behavioral services. So I guess I'd like to know, maybe you took a very close look, obviously, at growth requests, but if there's some savings to be accounted for and services to some folks who are obviously very frail and vulnerable that are being conserved as it relates to their situation. So
I didn't catch the program. Can you?
Yeah, it's Child, Family, Adult Services, the Care Plus program.
Care Plus, got it.
Yeah, it's under the Guardian Public
No, I got it.
Conservator. Along those same lines, we've had discussion. I know I've raised it in 2 previous budget sessions, and that relates to what to a senior safe house for vulnerable, neglected, abused seniors and adults. And we had a report, and we had some discussion regarding this about, on average, you turn 1 or 2 people a day away. We have capacity for 6. We were good enough, I guess we were able to get some money to the state, $300-something thousand for the Home Safe program. But what I see in the budget document is that we served, again, 29 APS clients who were in need of those services. But if we're turning 1 or 2 a day away, 29 is not a very big number. It's important to all those 29 that were served. So I guess I'd like to have some explanation tomorrow regarding Senior Safe House, whether there is some discretion in some of the monies we've made available here. We have a contract with Volunteers of America, obviously through one of our departments, to administer the current Senior Safe House with 6 beds. But it seems to me that the Home Safe program is providing certainly some needed capacity. But I'm still not convinced and not persuaded here from the dais that vouchering someone into a hotel that's in a vulnerable situation, a vulnerable adult, is better. It's better than being in an abused or neglected situation, but it's not, I don't think, the same setting as a senior safe house. And so I guess I'd just like to have some analysis around that for tomorrow's purposes as we get into some deliberations. So
Okay.
that's all I have for right now. Thanks.
Supervisor Frost?
Yes, Britt, we did, Supervisor Cerna had mentioned the letter from the 6 mayors from the surrounding cities in Sac County and their concern regarding the impact on the small businesses and economic recovery, which it seems like would be a great thing for us to invest in at this time. And I'm wondering if tomorrow, I believe there is a lot of economic recovery that we've already done. I mean, the food program, and I know there's some training programs, because I'm hearing about people who received contracts to do training for job training. Mm-hmm. But I wonder if you can bring back a list of or an accounting of the CARES Act funds that have been allocated for or will be allocated for, or maybe that any discretionary CARES Act funds that may be available to apply to economic recovery. And I want to point out an important part of their letter, which really stood out to me, was that They're citing that the surrounding counties have already allocated or devoted a significant portion, 20 to 25% of CARES Act funding for small business recovery and assistance. So they're asking for our help, and I'm just wondering, I think we might already be doing some of that, but I'd like to receive an accounting of what we have done and see what more can we do to help the small businesses, because they're reeling right now. Thank you.
On that point, Supervisor Frost, I think it's a great suggestion. And again, prior to the beginning of the meeting, I had a conversation with Mr. Gill about not just the funding, and some of which I mentioned earlier as part of the $45 million appropriation we made for public health. Some of that is obviously, I think, at least in my opinion, based on the description, intended to provide some business assistance for restaurants and whatnot here in the unincorporated county. I think on top of that, in addition to the request made by Supervisor Frost, I would also like to understand what do we have in our control, especially with regards to EMD, who, as we all know, is responsible for certifying certain aspects of restaurant food operations. There may be something that is non-monetary or maybe not associated with directly writing a check, so to speak, that we might be able to consider in terms of some relief, especially for the restaurants that were responsible for certifying their public health aspects, whether they're in a city or unincorporated county. There might be a complement of actions that we could consider taking that EMD could provide some value to them. So.
Okay.
All right. Who did you want up next?
Sheriff.
The sheriff? Okay.
Thanks, Britt.
Thank you, Brett.
Thank you.
Good presentation. As the sheriff is making his way to the podium, I do have an announcement. The clerk has confirmed that, I gotta get my glasses on. The clerk has confirmed that there are almost 100 callers in queue for item 1, the county's budget. It is highly likely that the budget hearing may continue deliberating through tomorrow. If anyone is signed up to speak tonight for an off-agenda matter or any other items besides the budget, item 1, please call tomorrow to sign up to speak. Due to the potential of this hearing lasting for several hours this evening, I will be asking clerk staff to alert callers to sign up to speak during tomorrow's hearings. Tomorrow's hearings begin at 9:30 a.m. Thank you for your understanding. Again, this is due to a large volume of interest on the budget, so I appreciate everyone's patience. Sheriff?
Well, good evening. I appreciate the opportunity to present. My presentation will not be very long, and in fact, as has become the practice in recent years, I haven't made a presentation at all. I've worked, as I have this year, myself and staff with the county executive officer as well as the county fiscal officer to get not everything we wanted, certainly, but everything we needed, and came to a figure that, as was indicated, when you back out the mandatory cost increases as well as the consent decree obligations, we were asked to and did accept cuts in a little over $2 million. So I wouldn't even be making a presentation this year, except that this year is no ordinary year. For a lot of reasons, but one of the reasons is because of the activism, calls for social justice, whatever you want to call it. There's been a resounding call in the media and around the country for defunding police. Now, I'm not going to stand here and suggest that this is directed at any of you, or that any of you intend to or desire to defund the Sheriff's Department, either entirely or in part, but I am certain that there is an organized effort on many of the phone lines and phone comments that you will get this evening from local folks as well as folks from around the region that will be calling for defunding the Sheriff's Office. And so I think it only fair that I'm able to provide a counterbalance with some actual facts to help you kind of work through some of those comments. Yep, wrong way. So I want to go with just a little bit in the beginning about what defunding the police means. And first of all, it's important to recognize that we're all familiar with the term defunding the police, but it has many different names. Abolition, realigning or reprioritizing police funding, reimagining police, and here locally there's been quite a bit of traction gained with what is called the People's Budget, and a presentation was made to this body in the past about the People's Budget. But importantly, it means taking money specifically from law enforcement as opposed to any other source and reallocating it for other purposes. The general discussion is for programs in the community or social programs or justice programs. The only specificity in the defunding effort is that it must come from a law enforcement organization, in our case, the sheriff's office. The intended recipient of the money is secondary to the fact that it must come directly from policing budgets. For some reason, to perhaps punish policing or punish me, I'm not sure. I'm not sure which, but it has to come from a policing budget. So I think it's fair to examine what will defunding mean in Sacramento County. And to do that, I've compiled a list of cities that have. There's many more cities that are talking about it, some that have reviewed it and dismissed it, and some that are still looking at it. But these cities that you see up here, Los Angeles, Austin, Baltimore, San Francisco, New York, Seattle, Washington, D.C., and Portland, Oregon, have in fact defunded their police department. It's important to note that none of these cities completely defunded their police department. They were all partial defunding of their police departments. So these are the models that we have, and I think as we go through each of these cities, you will see that there is one outcome and one outcome alone. There is no alternative reality than what has occurred in each of these cities, and I'll go through each of them in turn. Los Angeles County, for the benefit of folks that might not be able to read this on a small screen, I'll just read the news headlines. They can see the pictures on their own. Coinciding with calls to defund the police, large cities see massive crime wave. Homicides in Los Angeles increased 250% from previous week. These are both headlines from this summer. Austin, Texas. Austin voted to defund its police. The murder rate rose 67%. That's from just about 1 month ago. Austin has worst homicide spike in U.S. amid COVID-19 pandemic, report says. As you can also see in that screenshot, aggravated assaults and robberies are also up. Baltimore, Maryland. Harvard professors research defunding the police could cost thousands of black lives. Additional headlines: concern raised about Baltimore police budget cuts as city deals with persistent violent crime. Again, from this summer, and that's after the fall of last year, their governor proclaimed that Baltimore crime is out of control. San Francisco. Some crimes are spiking in America's major cities, as you can see highlighted there in San Francisco, as well as San Francisco crimes continue to rise. Again, from this summer. New York, New York. No shortage of headlines here. Crime soars in New York's wealthy Upper East Side as Democrats move to defund police. Gun violence spikes in New York City, intensifying debate over policing. New York's murder rate is up, way up. New York City moms fleeing Upper West Side amid crime and chaos. Seattle, Washington. Seattle sees 525% spike in crime thanks to CHOP, says the mayor. Democrat-controlled Seattle votes to defund police as violent crime and far-left riots surge. Again, all headlines from this summer. Washington, D.C., the latest to defund their police. D.C.'s murder rate continues to go up despite coronavirus. D.C. police are investigating more murders in historically low crime areas so far in 2020. Again, both headlines from just this summer. Lastly, Portland, Oregon. There's no shortage of news coming out of Portland as they've gone over 100 days of violent protest up there. But I did choose one just to give it a flavor. Portland has record high murder rate in July after defunding police gun violence team. So again, I cite these examples not necessarily for shock value, but for factual context. So the folks that might want to defund the sheriff's office, my question to them would be simple. Which of the cities up there would they want us to emulate? Which of those cities should be our model for defunding policing services? there's no model that's 180 degrees the opposite of any of those cities. It will end up like one of those, so which city should be our model? So looking specifically at Sacramento County, what will defunding mean in Sacramento County? As was indicated before, no cuts can be made in corrections, which is a significant portion of our department and in fact our budget because of the consent decree. All cuts would then be from remaining field services. They would be the homeless outreach teams, problem-oriented policing or POP teams, our youth services unit, and patrol forces. And frankly, those are listed in my order of priority from the first thing listed would be the first thing to go. The last thing to go would be impact to patrol forces. But in the process, there would be a loss of significantly successful programs. Not only that, even if we didn't affect patrol forces, those things do take quite a weight load off of our patrol forces. So patrol would have to accommodate and compensate for those losses in those programs. There are those that will say, isn't this overstated or just for shock value? I know historically, this board has had the sheriff's department come in and we normally present first and oftentimes suck all the oxygen out of the room with colorful presentations and analogies about how crime will be out of control and will look like Mexico City from prior sheriffs. We've had these presentations. And that's all pre-2010. I want to point out my approach. Once I became sheriff in late 2010 and my first budget presentation in 2011, my approach was completely different. I'd have never said anything for shock value. I've never threatened, even though, if you recall, during that time period, we still had laid off officers who had not returned to work yet. My approach was one of collaboration, working with county officers as well as other departments, so it didn't become like a cage match up here that every dollar I got was a dollar taken from the district attorney or probation department. And it's been collaborative ever since. As a matter of fact, as I mentioned before, the last several years, I haven't even made any budget presentations because we were able to work through and get a budget that was workable for the county as well as the sheriff's office. And plus, it allowed other county departments with needs to be able to present without being under the fallout of a sheriff's presentation. And I also think it's important to note that every year for the past several years, I have returned money to the tune of millions of dollars a year back to the county. At the end of the year, we've come consistently under budget and have returned millions of dollars back to the county to deploy and disperse to their other priorities. Last year alone, not this year that's ending, but the previous year, we came in over $4 million under budget that we were able to return to the county. And so I don't present this as a shock or as a cautionary tale, but more as a factual accounting. So let's look at who wants to defend law enforcement. Black Lives Matter and other activists, I'm sure you'll hear from many of them this evening, although it's important to note that Black Lives Matter Sacramento does not want less funded police. They don't want better police. They are self-described abolitionists. They simply want no police. So anything short of that will be unsatisfactory to Black Lives Matter Sacramento. The ACLU, and regardless of what they have been historically and what else they are, they have of late become an anti-incarceration, anti-policing organization. And lastly, I put in just a catch-all category of anarchists and Antifa. They don't want police for obvious reasons. They want to be able to do whatever they want, whenever they want, as we've seen in some other cities, without consequence. Strong law enforcement and a strong district attorney's office provides those consequences. So if that is who wants to defund law enforcement, I think a fair question is to ask, who doesn't want to defend law enforcement? Aside from the stack of emails that I'm sure all of you have gotten, I've gotten hundreds myself that I've been CC'd on that were sent to the board and the board clerk. Literally everyone else. No one wants to defund law enforcement. The vast majority of Americans don't want to defund the police. I put representations from both of our presidential candidates. This transcends politics of either party. Both Biden doesn't want to defund police, Trump doesn't want to defund police. Okay, but what about Black Americans? What about those communities of color that these activist groups purport to represent? No. not Black Americans, not in communities of color. A Gallup poll last month, about 1 month ago, 81% of Black Americans want the same or more police presence. So no one of consequence wants to defund policing. So that being said, let's look at some real solutions that we can collaborate on together. Number one is body cameras. And we've heard a number of things talked about body cameras. I don't think I have to get up here and sell it as part of my presentation. I think everybody on the board desperately wants body cameras, as I do. I have to give a special recognition to Supervisor Cerna. You wanted cameras long before I wanted cameras, before I was comfortable with cameras. But when I came to this body in 2018 and put a proposal in, we've had at least 2 different wear testings throughout our department, testing many different manufacturers. We have a general order already written. We're just waiting to get them and get people trained up, and we'll have them deployed. But I want to thank this body for, even in this economic picture that we find ourselves in this year, finding it to commit to funding the body cameras. I appreciate that. Mental illness response and homeless response. I think there's some opportunity here. And I'll kind of group them together because the discussion points are the same, even though they're obviously 2 different things, although there is much crossover, as you can imagine. Look, we have become the responders of first resort for many of society's ills, for many of society's issues, such as problems or mental illness. I'll be the first to tell you that I'd rather not be in the responding to homeless business. I'd rather not be in the responding to mental illness issues when there's no crime that has been committed. There are probably other models that we could look at that are more appropriate, would likely be more effective. But right now we don't have that. But I would like to offer the suggestion that we do have experts in these fields now and great community collaboration and partnerships. Look, for example, our homeless outreach team right now has 8 deputies and a sergeant. 8 deputies and a sergeant is pretty expensive. It could hire a lot of lesser paid staff to do something that we can then free up those officers. And that could free up resources from the sheriff's office that we'd be happy to reallocate to other sources. Those things don't exist yet, but I think with some vision and some collaboration between the board and the appropriate departments and our department, I think we could come up with something that is a better response than us being the responders of first impression to some of these calls. And there may be other areas.
Sure.
Yes, sir.
Sorry, could I interrupt there? On that particular subject, I just want to make sure I'm hearing you correctly. So you would have no opposition, no concern if we explored reappropriating budgetary resources from your department that is currently assigned to the HOT teams to come up with a more collaborative approach that might, for instance, I'm just throwing this out, dedicated mental health professionals that would work alongside maybe fewer of your staff to accomplish the objective perhaps more effectively.
I think we're saying the same thing, but let me clarify just to make sure we are saying the same thing. The short answer is no, I would not be opposed to that, and I would assist in any way. I'd love to get out of the homeless response business entirely. But I will say that there is nothing that exists. So to do so prematurely in the hopes that we could come up with something better is putting the cart before the horse. It's foolish. But I will commit that I will work with the appropriate entities, the board or the county departments, to try and come up with something that might be a better model. Understanding, of course, that we'll still have to respond to homeless calls and mental illness calls because there might be crimes being committed, or for public safety issues, it may not be safe to deploy whatever we could come up with. But we responded to over 462,000 calls for service. Over 100 a day have to do with homeless issues. So even looking at it pragmatically, statistically speaking, if we could cut out a good percentage of those, that would free up resources that I would be more than willing to have a discussion at that time about what is our workload and how can we turn that workload into dollars saved that we could then invest in other programs that we would jointly come up with.
Thank you. Supervisor Kenny?
Thank you, Sheriff. So on that slide, you talk about mental illness response. You say there is no mechanism right now, but what about the mobile crisis teams? And I'll say that I've been with one of your deputies on a ride-along, and at least 3 times they were called out during that ride-along during that day, and it was extremely effective. It's also a diversion program to not send them to jail when they really shouldn't be there, or emergency rooms, and get them to appropriate care. The hit on them, as far as if they're not as effective as they could be, and I think they are, is that there aren't enough of them, and
Correct.
their hours are too limited because people don't have mental health crisis from
Also
9 to
correct.
5. Yeah, so that is in place. Couldn't that be increased?
So there's a couple of things, yeah. So I didn't mean to imply that, what we're doing is no good, because we have had to adapt as an agency, as the responders of first impression for some of these mental illness crisis calls. And we have done some training. We've done great training of dispatchers, and we have reduced the number of what I would call bad to very bad outcomes considerably. And that's one of the tools that we have, that we've adapted to be better practitioners to these types of calls. So yeah, obviously increasing those would give us more better outcomes, but I'm also suggesting that I'm wide open to looking at other, perhaps non-law enforcement at all, response units. I mean, deputies are expensive, and so, being able to get greater staff with maybe a lesser deputy presence, maybe the deputy presence is less than the clinicians. And when the appropriate calls, it could just be clinicians without a public safety element unless that's necessary. So I think there's probably other models, and I know there's other models out there, and I know there's probably great ideas in this room for the appropriate department heads. I'm just, I'm not really offering a solution from this dais right now. All I'm offering is a commitment that I'm not an empire builder. I'm not trying to hold on to everything we have at all costs. I am, I think, open enough to realize that there may be a better model. We don't have one now, but there may be a better model out there that we can develop through collaboration, which actually could reduce the need for deputies, and reduce deputies could increase by greater numbers the other staff or clinicians that might, in that particular case, might be hired.
Thank you.
Supervisor Natoli?
Yeah, and just along those lines, Sheriff, and I think it goes to discussion with behavioral health services. I too have done a ride along in past years with a deputy and one of the senior mental health counselors, and again, I thought the approach from the standpoint of both, first response, but also in some cases calls for service that weren't necessarily in a situation where somebody was in immediate danger, but there was distress, and having the mental health worker in concert with the officer, and even in some cases where emergency responders with the fire department responded to one of the calls that I accompanied them on that day. But I guess my question is here, and we had some information based upon a question from board member, that we're funded for 11 teams throughout the county. Some of them will serve cities. We only have 6 that are currently operating. They operate 4 days a week, 10-hour shifts. We don't have 7-day-a-week coverage. I guess I'm curious that to the benefit that they bring, and maybe expansion of that model, they're during hours when maybe the highest preponderance of calls come in on average using an intelligent-led format. But I guess my question is that if we had that either 24/7 or at least 7 days a week with some alternate hours. I don't know how those are adjusted and who makes those decisions. Is it you? Is it Behavioral Health Services? Is it a combination thereof? But I know this board has supported them. They've been supported by the community. It's been before the Mental Health Board. We've heard from others in the community, and so I guess I'm curious that if we were looking at trying to adapt the model. And I don't know, it sounds like what I understood, there's some hiring issues for the other 5 teams that are funded but currently aren't even the slots filled. So I'm curious as to where all this lies, but if in fact we're doing something that, and I didn't hear you explicitly talk about that, you just talked about the mental health response, in certainly in response to Supervisor Kennedy's question kind of on the detail. But the effectiveness of the teams, and is it the right combination? Law enforcement, mental health, is there another component to this? Again, this board in recent years obviously has approved the expansion of the teams, support teams, but really haven't had any discussion, not with just you, Sheriff, but obviously with Behavioral Health Services, Mr. Bielenson, Dr. Bielenson, and Mr. Quist. It just seems to me that if we've got something in place, and again, if it's effective, then we got to build upon that, and if we need to deploy it, if we can't fill teams now for some of the other geographical areas that we've approved, because we wanted to get this more countywide, both in cities as well as in the unincorporated area, I guess I would just throw out for purposes of discussion here this evening and this budget deliberation as to, can we deploy it differently, and is there a way to try to bring this up to a different level? Mr. Gill, maybe you might be able to weigh in too. I know.
Well, before you mention, I'll just make a couple of foundational
Sure.
comments, and you're absolutely right. I mean, nothing, although it could sound like it, I want to make clear that I'm not diminishing any of the work that they do. Those teams are fantastic. The results are fantastic, and including our homeless response. Our homeless outreach team has been fantastic. I'm sure there's not one of you up there that hasn't gotten, accolades and kudos from some of your constituency about some of the work that they do. So they're great teams. So obviously, expansion of any of those programs is going to have expanded results. I was only suggesting that if there are conversations to be had for the future for something that looks a little different, I'm just committing to this board that I'd be a willing participant to those conversations.
And maybe there are models, again, beyond what we're using right now. I mean, I don't, again, I've heard positive responses from...
And that's just kind of hand in hand with the bit of caution that I would say that, willing to have those conversations going forward. Maybe there is something better going forward, but that certainly doesn't exist now. So, what we've, we're kind of, we have what we have, which is great. But let's keep what we have until we have something else.
So let me ask this: those teams are assigned, and they have a professional qualification goes with the mental health personnel that are available. But for example, there's 3 days a week we don't have any coverage at all. And if you have a call for service, do you have the ability, as a part of the responding to the incident, to have somebody that can be there on the spot with your officers? Again, not every incident rolls out the same, but I'm just assuming you've got, and you can take any different situations that one might imagine, but to have that available on a as needed and as need to be basis might be pretty frequently. It would seem to me that's being responsive, that you obviously you're going through dispatch, somebody's going to have to make a judgment about who to dispatch, not just from the standpoint of the law enforcement response, but if it's more appropriate because there's some known mental health issues at a particular address, or or some associated other events. I guess what I'm asking for is that I think in response to what you've outlined, what at least I'm knowledgeable about, at least in brief about this, that there's an opportunity here to either build upon it or to modify it in a way that I think goes, maybe a greater degree, certainly with just the daily coverage of being able to be able to respond.
I think certainly, taking care of the gaps in service. So just to answer briefly, is the officers have, and the dispatchers, frankly, call takers have at their disposal a number of different resources, so they can divert calls and folks to other resources, educate them about other resources that are available that they might not have been aware of, if it's appropriate a case for that. I know the officers do as well. Oftentimes the officers will call the person making I would say the complainant, but the person making the call, and try and talk through that when they're on the way to the call. But I would say probably more often than not, the officer will show up and try and do some of these things in person. So most certainly that the gaps in time of day and days of week do provide a gap. Greater service, greater coverage, reallocation of shifts. I mean, I know all my deputies are more than happy to work whatever shift I give them, 24 hours a day, 7 days a week. I can't speak for folks that I don't have control over, but there may be an opportunity. I don't know.
Well, and I think some analysis. I mean, I referenced intelligent policing, but it would seem some analysis around, again, you're not going to predict with 100% certainty, but to know when, greatest stress, there's got to be times of the week, times of the day, I would imagine times of the year, that when there's a higher preponderance anyway. So again, if we're deploying not only law enforcement in response to a call for service, but if it's a mental health worker or it's a CPS or APS, depending upon the nature of the call. But it would seem to me that that's the partnership that's going to make this thing work, even more effectively than I'm sure now, just by having additional coverage, but the ability to kind of, have some predictability around that.
Well, I mean, that's the way we deploy resources and allocate resources, and field models is based on the stats of what we know. Obviously, the greatest predictor of what going forward is what's
But are your mental
what's
health,
occurred.
behavioral health partners utilizing the same thing, or are they just decide?
Well, I don't know about that. They'd rely on us, and so I can
Okay.
I can work offline with Mr. Wagstaff about how much flexibility they may have with their scheduling, but we can provide the data to fill up that need and see if there can be a response to it.
Just to add to what the sheriff was just saying, Supervisor, we do have data not just on the time of the day that is most frequently utilized, but also parts of the county where that might be the case. So that is data that we could throw into the mix, take a look at.
Again, and if you need to authorize, because again, you have a 24/7 coverage, but if you have later hours, it may not be a day shift, it may be a swing shift. It might even be a graveyard response during certain weekend hour. I don't know. I mean, again, it's those types of things again where obviously people have greater expertise than I would have by all means, but I think that could help us be more responsive.
It's definitely a great resource. I mean, it exponentially increases the likelihood of a good outcome.
Good outcome. Thanks.
Supervisor Peters?
Do we know if the crisis response team, are they active in the cities that are in the county?
No.
They're not?
They might be with their police departments, but not with the sheriff's office.
That was going to be my next question. Do you know if any of them have had any reaction, response?
I don't know that. I would suspect that. I think I've heard something from the city of Citrus Heights and perhaps the city of Sacramento.
That's correct. That's correct. If I may, Sheriff.
Yeah, please.
Why don't you stand up?
Throw me a
I can't see
lifeline
you.
here.
You're behind
Thank
the
you,
chair.
Supervisor. And Dr. Bielenson can speak to this, and we also have Dr. Quist here to answer questions on this too. They are operational throughout the county in the different cities, so we do have them in Elk Grove and Citrus Heights and those places. To answer your question.
So they have trained officers in the city police forces in these other cities?
So you have a law enforcement officer riding along with the mental health professional.
Okay. So for Sheriff Jones, this would be just the unincorporated area. It's really the county that has the mental health workers who represent the whole county.
Correct.
Yeah. Yes.
Okay. Thank you.
Supervisor Frost?
Oh, I just
I'm
wanted.
sorry, could I ask one more follow-up on that? You said you had 100 a day, 450,000. The calls for service, is that calls for service in general, or is that mental health calls?
So we had, last year, for example, we had over 462,000 calls for service. Of that, we have, it's hard to say exactly how many have a component of mental health unless they're flagged that way or dispatched that way. We could arrive at a scene of a burglary, for example, and there could be a mental health issue or suspicious person call or anything. So it's very difficult without going into each call, but I think it's safe to say that well over 100 calls a day relate to homeless issues that have specifically regarding homeless, and well over 20 a day are attributable to mental health crises of one sort or another, whether or not it manifested itself into criminal behavior.
So do you keep statistics then on if it's a burglary and there's a mental health problem? Would that be something over the next couple months you'd be able, you and Bruce working together could?
So I mean, I will say it's possible, but the reality is we literally would have to go through every dispatched call. And so it would be, and believe me, I've wanted this information. I know other county departments have wanted this information, so it's not for lack of wanting it or looking at it and trying. We can get pretty good estimates. I think we sent something to Britt, maybe it was Nav, a month or so ago, trying to detail as best we could regarding what the mental health, I think, response was, but there's just no way of getting it accurately without literally pulling up every one of those 462,000 calls for service. So one of my discussion points with my executive staff has been how we can better track that in the future, because this problem's not going away, and certain funding and other opportunities and discussions are going to be based on how well we can keep those stats. So we are in the process. To say that we're far down that road would be overstating it, but we are in the process of at least having those discussions about how we can better track it going forward.
Okay, so it seems like the 911 operator would be an important link in that.
Well, certainly if the information comes to the 911 caller, that would be in the call, that would be flagged. But it's more the ones where, for example, if it's a homeless call, somebody, the business owner, somebody calls that there's an issue regarding homeless, and then we get there and there's a co-issue of mental illness or mental health issue that we can address. That might not get flagged or disposed of with any indication of mental health issue. We might move the person from blocking the sidewalk or whatever the case may be. We might know it was a homeless issue but not a mental health issue. If there's a crossover, we might show up for a suspicious car, an occupied car in a neighborhood, and there might be a mental health component or a homeless component, but it might not get entered into that dispatch. So it might be a line of text in the call as it goes through, as they update the dispatch, but it won't be in the dispatch information or the disposition information, which is what we can query easily. Otherwise, we'd have to just go and look at the free-form text of all of those calls.
Okay, thank you.
If I just could, Bruce, do you want to give a little bit of an overview of the work that you're working with the Sheriff's Office and Health Services and Probation?
Yes, absolutely. So over the last few months, we have begun this effort of looking at the types of calls that come in, Sheriff, and we have gotten data. We're working with Chief Deputy Madison and Santos Ramos from the jail, and we have a work group of our own department heads that are taking a look at this too. The initial step was to start looking at the data that was available and identifying data that we'd like to have, looking at models from other jurisdictions that have taken on this approach. So it's some work that is already underway. Taking a look at this.
Okay, thank you.
Supervisor Frost?
Oh, okay, my comments relate to some of my experience as from my nursing background when I used to work in the lockup ward. And back in the 70s and 80s, when you were working in a mental institution, it's a controlled environment whereby if someone is having an exacerbated situation, you can give them medication and help them through it. You can actually feed them their medications every day and make sure they get it. Fast forward to today, a lot of these situations, and I think, Sheriff, you probably know this better than I do, that it's more of an exacerbated situation, and now it's a reaction on the streets and it's a one-time off. You try to get them to resources, but there's really no place to send them, and you can't necessarily make them go if they don't want to go, and a lot of these folks are maybe suffering from psychosis from heroin and meth, long-time use, or schizophrenia where they're not on their medications. So I want to preface my questions and comments because of that. I think it would be really great. I think it would be great if we didn't have to use sheriff deputies and law enforcement to perform the mental health services. I know that the mobile crisis support team and the HOT team, I know what it means to the community when we were talking about cutting back on HOT. And they were really nervous because they're afraid of the homeless people. They can sometimes be threatening in the neighborhood. And as far as the mobile crisis support teams, I remember when I was in Citrus Heights, we had the DVERT, where we had domestic violence response teams, where we teamed up an officer with a social worker, and they would go out to the house, and so many times it turned into a shooting, an all-out war shooting, where the guy comes out shooting. So it isn't, I think you're right. Yeah, I don't think it's something we can casually just pass off, but what I think would be a good start, and Bruce, I'm interested to know what kind of data you're looking at. Are you looking at drug abuse? Are you psychosis? How many? What are you looking at?
The data that was provided by the Sheriff's Department supervisor had to do with calls related to homelessness and mental health related calls. So we're trying to break that apart.
It seems like part of the problem that we have is that there are many individuals who have fallen into this drug situation. There's or a psychosis, or they're paranoid. Whatever their situation is, they're not interested in. They won't necessarily seek treatment unless they have a little, unless that we find a way to encourage that, I guess is a good way to say it. I've read about Laura's Law. I've read about programs where we do the Veterans Court. We give them an opportunity rather than going to jail. They can go to treatment, but we have to have the treatment. Do we have the money to provide that? But I think what I'm trying to say is I love the idea about taking some of that off the sheriff, but how do we do that? It's kind of like when we were going to have code enforcement go out and make calls on drug houses, and all of a sudden code enforcement was in our waiting room here, in our chambers here, talking about we weren't trained to carry guns. So now what do? We're going to have the sheriff and code enforcement go out. It's because that's it in a nutshell. It's a lack of. It's a failure of the mental health system that has caused this to be something that fell on the law enforcement, which they didn't choose. And I think what would be great is if we can continue. I love the idea that Supervisor Cerna said, let's explore this. But while we're exploring it, keep in mind the community members who are afraid. And they have comfort when they know someone packing is coming out. Someone who knows how to protect them is coming out to deal with it. So that's the success of the mobile crisis support teams. Good on you for that.
Well, I appreciate that. And a point you made can't be overstated, and that is the lack of actual facilities. So, when the county mental health facility, for example, was a tremendous resources to me when I was on patrol. They basically knew all their patients. It was a place that oftentimes folks having a crisis were comfortable in going. It's a place that had a relationship with the family members of those in crisis. We can't often solve people's problems in 5 minutes or 10 minutes or 30 minutes. We can only get it to a level that's manageable, so we can leave the scene and be reasonably assured that the problem is taken care of for that moment. But we're not solving anything. We don't have the capacity of the staff to advocate for conservatorship, to force folks to be on their medication. Some of those things that having those facilities, they have that infrastructure to do that we just don't have. So that part about these facilities no longer existing has been huge for the explosion of mental health issues requiring a law enforcement response. And it's frankly one of the reasons we have to go back to some of these folks over and over and over and repeat it again, because we can't solve the problem. We can only solve it for right then.
And even the families that live with some of these people are struggling, trying to figure out how to get them to treatment. We wish you would help us make a law that will get them to treatment, make them go to treatment, but they're an adult and they have a choice.
Well, they do have a choice, and that's, you go through a complicated course for conservatorship, which the facilities can do. We certainly do it in our jail for incarcerated folks who meet that criteria. But for an average family, that's beyond their means and their wherewithal to do. So that's a huge issue. That's obviously not solvable today, but it's certainly, I agree with that as a fundamental problem in that system.
Supervisor Stolle?
Yeah, if I could just back to the body cameras here for a moment. I have a couple of questions. One is that in looking at this, for not just for the sheriff's department but for parks, and it's been suggested that we consider probation officers. I know we'll talk about that later on. One thing that the sheriff has at his disposal is the asset forfeiture program, and I guess I'm curious, again, this is general fund dollars. Those can be utilized with certain, I'm sure, guardrails relative to the use of asset forfeiture. I know I asked in some of my briefings about what might in any given year be available to the sheriff's department for other equipment needs. I know there are some restrictions. So would you object if again, I don't know the particular budgeting for that, but if we used some of those monies to, again, offset some of the general fund costs of the body-worn cameras for the sheriff's department?
Well, I'm obviously not opposed to that in concept, but the issue with that is obviously the sheriff's department, as you know, utilizes a number of different particularized asset forfeiture funds. The particular term escapes me. What are they? Help me out, Britt. The type of funds, like a Tucker fund, is what's the name?
Well, Tucker funds So there's Tucker funds, but there's the asset forfeiture, there's
Your mic
federal,
I'm just talking about what kind of, what are they called, those particular?
restricted funds.
Restricted.
Okay, so they're restricted funds. It's no different with asset forfeiture funds. It's much like they described enterprise funds for the airport or water funds for some of the water district. They have to be used for specific purposes. I guess conversely stated, they can't be used for certain purposes. They can't be used to supplant other things that are funded or should be funded by the municipalities or counties. They are for one-time purchases to improve the department, such as we just used some for SWAT equipment, protective vests and helmets and I think
And there's
some
something for the
microphones.
Tucker fund in this budget relative to.
Tucker fund's something different. I was using that as an example. That's
But restricted, again, that's restricted.
all restricted. Trust accounts, trust funds. So, yeah, it seems if you're looking at a balance sheet that we have a lot of money that's just sitting there. Well, number one is balances go up, and then we use them like for our education fund. It might get way up there because we're going to use it all for one particular academy that's coming up. But they have pretty strict requirements on how we can use it. So, in looking at it, and I've looked at that before because I've really wanted to come up and say, hey, look, we'll buy the cameras if you provide the staff for the ongoing maintenance and redaction and all the facilitation of it. But my read of it is not allowed us to use asset forfeiture for that. Happy to look at it, although I don't think we could shoulder the entire, even if it were
No, not the
permissible,
entire amount, I recognize that in any given
it would
year.
deplete the entire fund. But again, my read of it was not appropriate to use it for that. It would be a supplantation issue. But I'm happy to look at that.
Supervisor Tully, I'll just read from the budget. It says state and federal asset forfeiture funds are restricted for use on non-personnel services and supplies used to supplement law enforcement services. So it sounds like no personnel, but you could use it for capital costs.
Well, except you're using it to outfit a new unit that the county is paying for. So, I mean,
it says
obviously,
here
my
law
concern
enforcement
is I don't want to get audited and lose the ability to utilize forfeiture sharing ability with the
Well,
feds.
something we can look into, I assume, obviously with yourself and maybe with county council to, and I know you have in-house counsel, I guess, as well, but just to, again, it would seem to me that if you could make initial equipment purchase, granted, obviously the upkeep of the equipment and certainly the staffing behind that, which is built into the budget, that's under $675,000 for that purpose, and that is general fund as well. I just, again, for the hardware purchase, it seemed to me it might be something that would be justifiable. I don't know all the details, and again, I read that same language in
Do
Supervisors.
we add that to our list of questions? to
Sure.
get
Yeah, well, I mean,
answered by maybe county
It's not
council?
my money, so
Yeah.
I don't get to keep it if we don't spend it. So I'm happy to explore that. It's just my read is, and historically, I mean, we use that asset forfeiture money for a lot of different things. So, we always have to make those internal assessments of whether something's appropriate or not.
Okay.
And so just my read based on history was that it would not be appropriate, but I'm always happy to have that discussion.
I appreciate that. Just one other question on body cameras then. And again, we're talking about a complement of departments here, availing themselves of that. So is it the intent, and I guess I would ask this to Nav, and certainly the Sheriff ask you to respond if you chose, but to develop a policy then, and it may be reflective, obviously, of the, the mission of the particular department that's using them, but relative to how that information is gathered, how it's made available, how it's redacted, and all the various things. And so I guess that's my question, and who would be involved in that? Obviously, I would mention department heads, elected sheriff. I assume the district attorney would have some role in that potentially. The parks director.
So I can respond to that if you'd like.
Yeah.
So we've already got a general order made. It's kind of ready to go. Obviously, some of the practical things that we'd have to figure out is, the procedures for redaction and public release, how to integrate that into our public records releasing and things like that would still have to be worked out as just a kind of a practical matter. The policies, we are far along, professionally speaking, as a profession, in other agencies having body cameras. So there are plenty of policies that are out there, including sample policies from organizations that we subscribe to that have model policies. And so the policies really aren't an issue. The issue would be the practical application of mechanically how do we go about doing it, getting folks trained. So initially that would be training a cadre of trainers that could then go out, and we're a large department, so then go out and train the rest of the department, the folks that are going to be using our field services predominantly, and then just getting it done. The law sometimes changes. As we've noticed, the confidentiality of certain records has been fluctuated over the last couple of legislative cycles. I'm sure that will continue. So, obviously adapting to those types, but the policies, the core policies are already in place based on kind of the best practices of what's already out there.
But how about for probation or for parks, parks?
So the individual departments will come up with that policy with assistance from county council, DA, whoever they need to bring in.
And my understanding is our crew of folks are going to be facilitating the coordination of their records releases and so forth, and redactions for them. So they're not going to have their own units. So that part will be consistent.
And with the Sheriff's Department, with the Office of Inspector General be involved in at least reviewing policy framework and certainly obviously a request for public once they're deployed. I assume that some of that would come.
Yeah, he certainly can be, just as he could request any in-car camera or whatnot that he wants to see or has an issue with. And so he has certainly access to all of it just as he would any other record. And obviously if he got a public records request, obviously he would forward that to our office for facilitation.
One other suggestion for maybe cost recovery would be that, a number of contracts we have, I know they were mentioned in Britt's presentation, but with regional transit, with the school districts, with the state with Folsom Dam and so forth. And if we deploy cameras, obviously we have a contractual rate that reflects, salary benefits and, loaded costs. It would seem to me that if we're now going to have those officers outfitted with body-worn cameras, that ought to be reflected in those recoupment of costs in the contracts, and would help us, I think, with the initial acquisition, but also obviously, the ongoing costs that are built into to the loaded costs.
Yeah, we've started having some of those discussions, but those will obviously be prospective recoveries and not obviously right now. We couldn't usurp existing contracts.
No, I'm not saying that, but if those
So
contracts
there could be a prospective benefit from that, that could help defray some of the ongoing expense.
All right. One last question to Sheriff is that in the reductions that were outlined relative to recommended, and you're obviously in concurrence with the salary savings and so forth, but the state apparently has gradually reduced, at least according to budget language, the funding for the sexual assault felony enforcement team, and so there's a position, I don't know whether it's vacant, you're going to be reassigning, but I guess I'm curious to the point that if that's an area where you've had folks assigned, if the response to crimes, the investigations that go behind those, hopefully the clearing or solving those cases is such that is this going to diminish the ability to follow up timely on those calls? And some of those are pretty complicated. They involve minors, they involve rapes and sexual assaults and some god-awful stuff. So
sure, obviously some serious offenses, serious offenders. So the answer to your question is I don't know. So my Undersheriff Manis has been dealing on the day-to-day. So he's got the pegs on the war board as far as where some of our vacancies that are making up the salary savings are going to come from. I'll have a discussion with him tonight, and I can get that information to you so you have it before you start session.
Well, again, you could staff, we can allocate the positions, obviously, but I'm curious about that one. Just because to my question earlier about some other categorical, if that's a reduction, I get it. That's a place where you make you come to some concurrence, but I kind of have an idea on the service to the people we all serve. So, and so
right.
Get back to us tomorrow on that. Okay.
So it'll be dual faceted, whether any reductions are contemplated in that unit and what the anticipated service impact may be.
Yeah,
if I understand your question.
There is one. I mean, we're limiting a position with this budget.
Okay.
That's what's proposed because the state funding has been reduced. That's why I was asking you. So
right.
if you're not proposing a backfill, then I assume that's a reduction. So maybe you can get some clarity behind that.
Yeah, I don't want to say up here that it won't be backfill because I don't know what that plan is, but I'll get you that information before you guys start tomorrow.
Thank you very much.
You bet.
All right, any further questions from board members for the sheriff?
Thanks very much.
Thank you all very much.
Thanks, Mr.
Health services next.
Okay. Is there...
Stephanie?
Is there any interest in having any break? I just want to see if there's, okay, we'll just get, we're going to plow through.
Thank you. That's fine.
Mr. Chair and members, nice to be with you again. Should I comment on the police thing first?
On the what thing?
You wanted me to
Police
talk
thing?
about the sheriff issue first?
I think if you roll through your presentation, then at the end, we'll
Okay.
come back to that.
Okay. Well, most of our budget presentation has been done by Britt, so in the interest of saving time, I'll just say that $95.2 million increase in appropriations, $28 million of which is recommended growth, which I'll get to in a second. Mental health services, as Britt has already said, 53.8 increase. That's predominantly from our MSHA expenditures that we expended last year and spending this year. We increased dramatically the spending for children's mental health and adult mental health.
Dr. Bailison, do you
Yeah.
want to advance the slides as you're speaking?
Oh, yeah, I've never done that before. Oh, great. They flow. How do I do this? Oh, here we go. Yeah, I got it. Okay. Substance use and prevention and treatment services, that's the drug Medi-Cal, the ODS waiver, that's bringing in additional money. That's gone up $7.1 million. Primary care has gone up $8.1 million, and some of that funding is for COVID issues. And then sorry, how does this flow?
Higher slide.
Yeah.
Higher slide.
How do I hit? Oh, that one? Yeah. Okay, sorry.
No problem.
Public health, the increase has been mild, except for obviously a significant amount of recommended growth, which I'll get to in a minute. And correctional health services has a $3.8 million increase with a $1.8 million recommended growth. So the recommended growth for DHS totals $28.2 million, as I said, of the $95 million. And $23 million of the $28.2 million is for COVID-19 response, which you're all very well familiar with. This is testing, business navigators, contact tracers, on-call temp services, homeless support services, including porta potties and water and things like that, and purchase of COVID PPE supplies and equipment. Correctional health services recommended growth is $1.8 million, which covers 13 employees. And then the fund balance for that Britt was talking about, we'll come back to you in October, to release the fund balance reserve is $45 million in fund balance for the COVID-19 things that you approved last week or the week before. You should know that we've actually spent about $30 million now of the $70 million, the 45 plus the 23.4. So we're moving along well on that. That's my response. That's my report.
Okay, could you do me a favor, please? Could you go back to the first slide just so the public has the viewing public has an opportunity to see the entirety of your
Yes.
SWIFT presentation?
Yes.
Okay.
7 minutes.
All right. All right. Any questions for Dr. Bielenson?
Mr. Chair.
Supervisor Kennedy beat you to the punch there.
Sure, good. He's quick.
Substance use prevention and treatment services, that's the Medi-Cal program. that
Yes, the ODS waiver.
Yeah, so that's now, so because of that, we can cover more residential care.
Yes.
I try to spitball as much as you can, but with the $7 million increase, that certainly won't meet the need. About how much need is there beyond what we're doing?
Brian? I'm not sure.
Me neither.
I'll have a response for you in just a moment. Come on.
All right.
How much need is there?
Good evening, Ryan Quist, Behavioral Health. I think we have more need. I don't know that we have an exact number that we have. So let me tell you how we're doing. Overall, our residential, we've gone from a 90-day wait time down to a 7 to 10-day wait time on average. Are there days where it's not that good? Yes. The women's beds tend to be faster filled than the men's beds, and so we still are looking for more men's beds. And then we also have challenges with withdrawal management, which is another residential context.
It's been a really big success story, because when I first got here, I went to the Access Center, there were at least 3 or 4 month waits.
Yeah, and it was, I mean, essentially useless.
Yeah.
But so in 7 to 10 days, if that's the average wait, is that adequate, or are we finding a drop off in that 7 to 10 days, a significant drop off? Because like the 30 days, if someone wants to get clean and sober, 30 days later is a different world. Is the 7 to 10 days meeting enough need, or is there still significant drop off of people from they initially seek services to when they're served?
So I'd say right now the 7 to 10 days is an average, and it's not consistent. So we want to keep building up our capacity until we can keep that consistent. Okay. We have another residential provider that's was never contracted with us before, who has now become Medi-Cal certified, so that will increase our capacity. And then as we finish getting everybody Medi-Cal certified, I'm hoping that there is increased incentive for them to dedicate more of their beds that they currently have being funded by other sources, being dedicated to Sacramento County in order for us to fund those beds.
Okay, thank you.
Supervisor Tully?
Yeah, a couple questions, one in primary health, the other one in behavioral health, so maybe while Ryan's up there, or Dr. Quist, on the there was a request that was not recommended for additional mental health services for 350 Medi-Cal eligible children and their families through the Flexible Integrated Treatment Program, and the full cost was $3.2 million. $1.6 million would have been, it's a 50-50 share or so. But in correspondence received from the Children's Coalition, it was pointed out that there has been determined to be a pretty serious unmet need, serious being my word of emphasis if I read this correctly. So could you just address that? Obviously you may have requested it, and obviously in budget recommendations we have different considerations, but I wanted to know what the level of unmet need is from your point of view.
We do continue to still have an unmet need in children's services. I'd say that was originally put into the growth request prior to COVID. So it was in a different budget environment than what we anticipated. So, but yes, we do continue to want to serve.
Well, you hit on my point. We're in a COVID environment. I think, certainly, I imagine my colleagues have had similar conversations. I've talked to a couple of folks who have outreached me, physicians who, are in the private sector, working with some of our major healthcare systems, and what they're seeing as it relates to children, certainly families, but to children in great distress, anxiety, suicidal tendencies, and increased numbers. And in fact, they've even invited me. In one case, invited me to come meet with some of their patients, assuming the patients were willing to do that. I didn't necessarily see the necessity to do that, but I guess to my question here, Ryan, that was pre-COVID. If it's been exacerbated by COVID, I don't know if there's anything we can do with the context of some of the healthcare monies that, we may be able to reprogram throughout the course of the year to fill some of that need. But if they've identified 350 eligible children pre-COVID or more, and if the situation is worsening, then I would say this to me is an unmet need as it relates to, the pandemic. So I guess.
My public service announcement would be we've seen a 50% reduction in the number of referrals for youth into our services. This is wrong. That there is not a decrease in need. There's not enough eyes on our youth, and so we need, if you see a youth in need, please make sure that you refer them for services.
Okay, but so just taking your public service announcement, if we referred somebody, do we have the ability to meet the need?
Right now, absolutely, yep.
Right now we do, because of the decline. But, well, I guess I would just ask maybe for you and Dr. Bielens, and and maybe there's an ability to, summarize some report tomorrow. But it would seem to me that if it's somewhere along the line, that's going to go upside down, I got to imagine. People aren't in school right now. We're not seeing some of those referrals, but I got to imagine that there's a great amount of distress out there, and it's just going to grow with some of the...
I should mention to that point,
Yes.
we are granting waivers to elementary schools. We've granted our first 3 waivers this week. They'll be able to open starting on the 14th or the 21st. These are elementary schools only, but just in response to your concerns.
Okay, well, thanks. And then, so my other question to Dr. Bielenson, I asked earlier about the WIC program. Again,
Yes, yeah.
I heard there were maybe some vacancies. That doesn't speak to
Yeah, I
the
can
need.
actually tell you, it's telehealth has made a huge difference. We have a tremendously greater uptake of visits on the telehealth side. We actually think that the feds in the state are going to keep it telehealth because of, it's actually one of the few silver linings of COVID, and we're getting many more. Our workers are much more efficacious at doing it that way. We are anticipating if they come back, if there'll be a replacement of those folks, then we will be able to get, we'll ask for more if we need them. But right now, we don't believe we need them.
So, I just want to
Yeah,
understand.
sorry.
Yeah, no, that's okay. So those positions aren't filled now.
Correct.
And you believe you're meeting the need through the telehealth and any
Correct,
outfield
because they're
service.
much more efficient visits, as you know, from having done Zoom. They can do much quicker visits with the patients, and the only thing that they got an issue with is lactation training for people who've had trouble with lactation, and that's the only reason that we found that we need people in-house. So it's actually a more at-home type operation.
Okay, so again, maybe that explanation as we come into, summarize that, because we did receive correspondence from Children's Coalition, obviously it's been talked about, and I want to be sure there's an understanding, and if I heard you correctly, you said that if you do see the need, you would be back requesting to...
That's what I was trying to say.
Got it. Okay, thank you. Thanks.
Supervisor Kennedy?
Yeah, this is probably back for Ryan again. If you want. Couple things is, and the three of us have had many conversations about youth mental health lately. Mm-hmm. And I was going to quote your 50%. You took my thunder away. Is there a plan? I realize that there are waivers that are going to be granted, but there's going to be some schools that will remain closed. Is there a plan to, we heard that we can meet the need if they come to us, but without that entry point at the schools, and I'm afraid that's not going to happen. And I don't know the answer at all. How do you reach out to people who are at home? Talk about
emergency. You want to talk about the emergency protocols? Go ahead.
I'm sorry. I think we've been talking with some of the same youth organizations that you've mentioned and raised this challenge with them, and they've been giving us advice on how to do some of that outreach, wanting us to get onto Instagram and things, apps like TikTok that the youth are using. Basically, in those instances, we're depending on our youth advocates who are paid in order to help support us to put out their own posts in order to help promote awareness and access to help. So we are working on a few different strategies, but we continue to be open to more suggestions if you have ideas about how to do outreach for youth.
And the schools are open, the cohorts are open currently, despite the fact we're in a purple tier for emergency visits with therapists.
Okay. And second question, not related to that, is you'd said something about detox facilities were a problem, or what was it? Can you explain that statement?
I'm questioning my language right now for some reason, but I think it's withdrawal management.
Withdrawal management.
And that would be a detox type supervised residential sort of a service.
And why is that a problem? Providers?
It's a difficult service to provide, and I think it has been historically challenging to find providers that were willing to do
So
it.
it's a lack of providers is one of the major issues. Okay, thank you.
So I have a couple questions here. One of the things, Dr. Bielenson, that I know you're very well aware of, because we've been on some of the same Zoom meetings in recent months, is that our Latino population and community leaders in the Latino community have been very vocal about making sure that there's proportional attention that's really paid to to that population as it relates to both the cases, the death rate in the Latino community when it comes to the pandemic. One of the things that I can't help but really think carefully about is the fact that we continue to have an enrollment cap on the Healthy Partners program. And I know that you've done a great job providing updates in terms of enrollment numbers. But given the nature of the pandemic and who it's tending to affect more than others in the community, and the very design of that program to really focus on people regardless of their immigration status, which tends to largely be the Latino population, what is in the current budget recommendation that might give us a little more latitude in the context of that particular program to help serve the Latino population in Sacramento County?
So we're at 3,700 right now. We can go up to 4,000, as you know. 3,700 we've been relatively stable at. We think it's because of the public charge issue, which we've been dealing with folks on for about a year now. I've also been meeting recently, as of yesterday, with the FQHCs to see if they can refer more of their patients who are undocumented to us, because that actually is in their economic interest to do so. And we will talk with the Latinx cultural groups to try and encourage people to come. But we've been doing a lot of outreach, and we have not been able to get. We're stubborn at 3,800.
What about the other? I mean, it's a pretty dynamic program. I mean, it's intended to serve a very kind of specific population. Enrollment caps are one thing.
Right.
I know that the expansion of specialty services has been another attribute that has really garnered the interest of the community.
Yes.
And myself. So can you speak to what in the budget is absent relative to that objective to expand specialty services?
Yeah, actually, specialty services, we're getting more from UC Davis now, because we've been expanding the number of specialty services that we're allowed, that are provided there: cardiology, pulmonology, dermatology, a couple other ologies. So we've been providing a lot of those services by our own docs that we've been getting from the increased Medi-Cal revenue that's been coming in with them providing care. So I don't think it's actually I don't think it's an issue of having more money. We have money left over. We're not left over, but we have enough money this year to pay for the specialty services. It's really trying to attract people to the center. That's really the issue.
So if, and I guess this is really directed to both you and Mr. Gill, but assuming that we see any changes in the trends relative to COVID-19 infection rates in the Latinx population, are we going to be flexible enough, given what you're recommending in the budget for public health, especially specifically for Healthy Partners, to do a mid-year adjustment, and so we're not ever hitting up against a ceiling in the context of a pandemic that happens to be affecting this population more so than most?
Right, so a couple things. First of all, we're doing a lot of other, so I thought you were going with the question at the beginning, La Familia and several other Latinx population groups are getting a large chunk of the money for outreach and communications. So they'll be doing some of that for the Healthy Partners program, and Rachel Rios is well aware of that. She's been highlighting that. Secondly, the data shows that the number of people with COVID has gone down in the Hispanic population, so that now it's a majority white instead of majority Hispanic, but that's not to say that it's not still a problem.
Okay. Let me switch gears a minute and get the attention of the CEO as well on this. There's been a lot of thought so far about repurposing 700G, the former office space that used to house the Sheriff's Department here in downtown Sacramento, and to repurpose it partially for meth addiction services that would really target people that are coming out of our main jail that happen to be suffering meth addiction, and be more than just a sobering center, but something a little more substantial. Where in the budget can I find any appropriation that would at least get us started to to either, convert the facility or, begin designing the program.
Probation, right?
Are you asking on the capital side?
Okay.
So, budget, right?
Well, there's money in the capital construction.
Is your
fund.
mic on, Brett?
There's money in the capital construction fund related to the doing the facility, but I don't. Is that the question?
Who wants to answer?
Sorry.
There's different departments touching that.
Good evening, Lee Seal with the Probation Department. I re-entered when I began to hear a question related to the work across the street at 711G, but I missed the whole question.
No. So there's been, Chief, there's been a lot of interest, especially expressed by me, for a new component part of our meth interdiction programming that would be housed at 700G, the former office space of the Sacramento County Sheriff's Department. Not all of the space, but it would be intended to, be very proximate to obviously the main jail, so that we could actually provide a service immediately upon release to folks that have a history with meth addiction that could be a little bit more than a sobering center for that particular behavioral health challenge. And so I just want to know kind of where we are in this budget that reflects at least a start on that, whether it's capital facility investment to redesign the space or to, begin the program.
Mr. Chair, not to interrupt, I think we have an audio-video freeze. Yeah, just one.
Take a 10-minute break.
Just one
Okay,
day.
all right. Well, you can think about it for 10 minutes. And then come back. We are in recess for 10 minutes. Of the Sacramento County Board of Supervisors for September 9th, 2020. Madam Clerk, will you please call the roll and reestablish a quorum?
Yes. Supervisors Frost?
Here.
Kennedy?
Here.
Natoli?
Here.
Peters?
Here.
Cerna?
Here.
And you have a quorum.
Thank you. For those that are viewing remotely, I apologize profusely. We had a temporary technical issue. Apparently, we almost broke the internet, so we are back online and resume kind of where we left off. I was in the process of asking Dr. Bailenson and our Chief of Probation, Lee Seal, some line of questioning relative to an effort that I know the CEO has heard from me about several times, and that is the establishment of a new complementary methamphetamine interdiction program that would be housed potentially at 700G, the site of the former site of the Sacramento County Sheriff's Department here in downtown Sacramento. And Chief Seal, you were about to explain kind of how this budget reflects either or the capital investment, initial capital investment to repurpose the space and or design the program.
Thank you. I appreciate the opportunity, Lee Seal, on behalf of the Probation Department. At the outset, let me say that this was really a collaborative effort with all the system partners. We have behavioral health here. They were really kind of a central component of this, the Public Defender's Office, but also the Sheriff's Office and the District Attorney as well. The project is what we call Jail Diversion Treatment and Resource Center. It will be housed at 711G in the Sheriff's former office right across the street here. And the purpose of the project is to allow easy access to the main jail for people who may be booked in and released or for whatever reason might have proceedings downtown. It's really to connect people with services, sometimes that lower level population, often misdemeanants who we know have oftentimes co-occurring mental health disorders, substance use disorders, as you mentioned, but even a trauma component as well. We will co-locate staff there with behavioral health staff, probation staff, public defender, and the idea is to give kind of a one-stop shop to make sure that people are connected with services with the goal of diverting them out of incarceration, out of the jail. It is state-funded entirely, so this is not out of the general fund. I'll defer to Britt if he has specific information, but we pursued a grant for $1.6 million. We came to the board several months ago to receive permission to receive that outside funding, and the purpose of that funding is really for capital investment into 711G to turn it into a place that really can facilitate all of those functions. That's going to take about a year, so we anticipate about a year from now having it up and running with existing county staff who will make it an effective program.
And I assume that'll include some behavioral health staff as well.
Yes.
Okay.
And Britt, where in the budget, can you say where it is?
So as Chief Seal indicated, we did receive a grant, and we have included money in the capital construction fund budget to cover the cost of the improvements to 711G Street.
So I assume that the year that it would take to actually get the capital facility at a place where it's ready to offer this service, we'll use that year to hone the design of the programming. And it's it sounds like it's more than just a methamphetamine addiction intervention. It sounds like it's much more comprehensive than that, and that's great. The original vision that I think I and some others have shared is that we know that there's a tremendous amount of meth addiction, unfortunately, that is co-occurring with all kinds of mental health challenges as well for folks that are booked into our main jail, and we ought to take advantage of the fact that they are going through withdrawal while incarcerated, and instead of upon release giving them every opportunity to go out and get high again, we ought to take advantage of the opportunity to offer them and maximize the services that we can. Those interventions that we know work best for that particular substance. It's a very challenging substance. It's got its own unique problems to try and address, not the least of which is that it can lead to psychosis. So I'm glad to know that the budget, and I'm not necessarily concerned with the color of money here. It's good to hear that there's a grant that we're using, but it's also equally positive to hear that we're actually doing more than just talking about it now.
Yeah, thank you, and we appreciate the board's support.
I think Supervisor Cerna and Dr. Bielenson wanted to follow up on a comment from the sheriff about how their teams work together. If I could have him come down and explain that.
Okay, Supervisor Controlli, did you have a question for Chief Seal by chance?
No, but it was kind of along a similar line, and I do want to hear, I know Dr. Bielenson was going to respond to the question earlier about the mobile crisis support teams, but maybe this dovetails with what you were just asking about. In the not recommended category, there was proposal for development of 2 outpatient behavioral services programs for the criminal justice population to serve approximately, as outlined in the budget report, 1,100 clients. It says these services would enhance reentry services, reduce criminal justice recidivism, and relieve pressure on the jail system. The funding would consist of 50% federal financing and 50% general fund, which is an eligible realignment program. I'm just curious, as I heard Chief Seal talking about the program that you brought attention to, Supervisor Cerna, I know have been leading the effort on that, as to this would be, again, at least in part funded, half funded by the federal government. So I'm curious about if we've got all these approaches for doing stuff in-house in the jail. Correctional services, we're putting 13 positions in there. From a health standpoint, we're putting 36 positions in from the sheriff's department. If we've got something that we're going to have 50% funding on that would actually reduce recidivism and the jail population, at least as is outlined here in the budget summary, why wouldn't we choose that? If we're going to pump millions in over there and down at RCCC annually, why wouldn't we do this? And I guess I didn't, if we don't have an answer tonight, I kind of put it out to Ryan, but certainly to Nav and to Britt and to Dr. Bielenson and whoever else is involved in this, because this is the type of thing, again, maybe a compliment to what was just addressed here, where if we're going to make a difference in the long-term housing situation in our jail, provide services in the community, what better opportunity than something like this? And if it's in behavioral services and it has the ability to serve 1,100 people, that's pretty significant. So I'm curious as to what happened and why we're not recommending this one.
Originally, excuse me, that was originally put into the growth request pre-COVID when I thought we had more revenue coming in. So we just don't have the same level of revenue coming in due to the economic downturns.
Okay, well then maybe it goes beyond that. So if it's pre-COVID, we're putting a lot of general fund in over there. So if we can reduce populations, you reduce census counts, and we can provide the services, then maybe be more than just a behavioral service. So I guess now I would just turn to you and Britt. Maybe you can respond tomorrow. But again, I'm very curious. This is, if we're going to make a difference, I'm much, I'm very interested. I won't say I'm very interested in seeing what we can do to keep people from being incarcerated, to help them be supported in the community, and and get it. If this has that ability to do it, and to have it, $1.6 million provided by federal funds, that's significant. When we're putting all general fund into the jail, both on the health services side, large part, some realignment, and certainly with other aspects of that. Why wouldn't we take advantage of this? And I don't put it all off on mental health. This is not on Ryan. And I'm not. I'm just curious. That to me is. This is where we need to be going in certainly as we complement some of the areas we're having to do under consent decree. So I guess I'd like to have some more background on this one, particularly now, if we could. Okay. Again, I'm wondering why I asked the question because okay.
I think Ryan answered it, but we can come back and talk.
Well, he said he didn't have enough money, but but this is.
I'm just alluding that Ryan did tell why.
Yeah.
But we can have more discussion tomorrow. That's all I'm saying.
But so let me be a little more specific here. I think that we're going to have many more conversations about consent decree, about staffing, about facilities, about programming, and to the point about diversion that we just heard about. To me, if we're going to have a complement of services, both for institution but also in the community, that this or something akin to this, along with other things we just spoke about, are really important because they need to be a part of the overall strategy. We can't fund them all. I get it, but if you can keep, serve 1,100 people and keep some of those folks out of jail.
All I was trying to get at is that we understand why it didn't come forward from the department.
Right.
We will talk to them.
Okay.
And we'll come back tomorrow and present it to you.
Again, as I'm looking at using general fund dollars, I might prefer, if given a choice, put some here and fund 2 less positions over in the jail. That's whatever it might take. So
but
again,
you do know the fickleness of this money too.
The fickleness of
any kind of federal money comes and goes too.
It does. So, but if it's a program that helps us,
I'm not disputing that. I'm not disputing the merit of the program.
Yeah.
You asked a very specific question. Why? That's what I'm telling you. The fickleness of federal money. But given your comments, we'll talk to the department, and we'll have the department answer what you need.
Okay. Thanks. Appreciate that. But I would like to hear on the mobile support teams. And the question I put to the sheriff earlier, that would be helpful to Dr. Belins. I think you were going to be able to respond to that about.
If you fund the MCSTs with the sheriff's deputies in it, it doesn't save any money. So you've got to work at saving money by getting. I was very pleased to hear the sheriff say what he said, that there are programs that Bruce and I and our other group that we're working on, like things like Cahoots in Oregon and in Denver, which are programs that use non-police dispatch to social workers and healthcare workers who go and do that work, and they've taken care of about 20% of cases in that way, or is investing in urgent care centers 24 hours, 7 days a week, because they are places for the sheriff, as he has said, to drop people off and then free up his officers. So there are programs like that we think we need to look at that take out the sheriff in an appropriate way, but allow us to provide good services.
Okay. Is that something we're looking at then? Is that what we're doing?
Yeah, we're talking about it.
Okay, very good.
That's the work that Bruce and all the departments are looking at, come to some kind of resolution on it.
And did you give a time frame for when might?
No, not at this point, because we're just right now getting all the data in, and the more we're getting into that, there's different decision points we have to come back to you.
Okay. And just one other clarification on we've received some information from our Public Health Advisory Board relative to the funding for HIV, medical care, and STD tracking. Apparently it's a grant we received, but we were putting on hold actually accepting the grant until, it says October, that was in the letter.
I don't think it's a problem.
It's not a problem.
No,
We're going
I don't
forward
think it's a
with
problem. Yeah, I'll check on it for tomorrow.
If you would, okay, good. Thank you, that's all I have to show.
Supervisor Kenny?
Yeah, just real briefly, because now is not the time for deliberations, I obviously, but since Supervisor Natoli brought it up, for tomorrow, I am going to be looking at some areas in which we can look more at prevention than incarceration. I think that this program, and I was going to bring up the Denver PD program.
That's it, it's cahoots.
Yeah, and I think that, it's penny wise, pound foolish to just look at incarceration without looking at getting people out and keeping them out of the criminal justice system. So I will be asking questions about that tomorrow.
All right, thank you. Okay, any other questions, comments for public health? Not seeing any. What's next?
Public comments?
Okay, did we want to hear from the chief, or is the chief here just to answer questions on the prospect of body cameras for probation?
Correct. If you would like, we could have the chief come speak about that.
Sure, real briefly, and then we'll get to a very patient waiting phone audience here. Thanks for being here, Chief, and appreciate your patience as well.
My pleasure.
So you and I have had a number of conversations and shared electronically some thoughts about the prospect of body cameras for our probation officers in light of the fact that there's a recommendation this budget cycle for our field deputies as well as our park rangers. And maybe just so I can kind of intercept maybe some of the concerns that my colleagues might have, or the public, or questions. You and I have talked at length about the fact that there would necessarily have to be some nuance to the deployment, given the fact that the roles and responsibilities of probation officers, are different.
Right.
They are sworn personnel. They do respond to critical incidents on occasion. But they also have this charge to really do everything they can to help people keep people from reoffending. And that necessarily means they're going into private residences, and sometimes they're around minors. So can you just maybe speak a little bit to how you envision, if it's the will of the board to fund this, how that would be rolled out?
Yeah, and I appreciate the opportunity to speak on this, and I want to thank you, Supervisor Cerna, and others for championing this. This really comes at the suggestion of yourself. It's something I support. I think in this day and age in particular, all of us want to see more accountability and more transparency, and that's something that we want to be a part of. To your question, the particular unique nature of our work that we would want to build into this program, if it's the desire of the board to vote in favor of it, would be to, and I really want to make this clear to the public insofar as they're watching, and really everyone, so that they understand so much of our work as probation officers is conversational, and much of that conversation is about treatment, it's about counseling, it's about personal, confidential information, families, youth, HIPAA-related information, you can imagine. And a big part of our day is engaged in that. We have to, therefore, build into our policy, and I need it to be the expectations of the public that, and I think it's really the expectations of our clients, the probationers themselves who we work with. I think they want that privacy and confidentiality, so we have to build into a policy our ability to appropriately turn off the camera and turn it back on in the right kinds of circumstances. I'm confident that we can work that out. I know that this is not a problem that is unique to probation. The sheriff's deputies will interview clients in a hospital setting, a domestic violence victim, all kinds of settings where they too will have to turn off their cameras. So this is not anything new, but I think just the extent of which we will have to do that, given our job duties, is just something I want to make sure it's baked into the expectations right at the outset, so that everyone understands.
Sure. No, I appreciate that. And again, as I mentioned, I know the ride-along that I did over 10 years ago, almost 11 years ago with probation, the POs that I were with for a morning, they happened to respond to a critical incident that required both sheriff deputies and POs that were in the area to respond.
Right.
And it was a gun-drawn kind of situation, and there was a suspect that fled on foot and that kind of thing. So again, for those that may not think or understand that our POs are actually engaged in some of those critical incidents, they are. And in fact, testament to that is the fact that on a fairly frequent basis, we see in either the Facebook posts or the newsletters that come out from probation, the fact that your probation officers have been integral to busting some pretty large drug and gun rings here locally too. So again, I appreciate your very careful consideration of this and your thoughtfulness. We appreciate you being here. I don't know if there's any other questions for our chief, but just want to make sure.
Just a comment.
Sure.
I'd say I was out with probation before your time, there were no arrests while I was there, but there were all kinds of other people around, and there were a lot of questions about health and what they were doing and things that you wouldn't. It's a privacy issue, so I'm glad to hear that you can turn the cameras on and off and accomplish that.
Thank you.
Yeah,
and I appreciate the chair's comments as well. We have over 150 armed officers. We're really one of the largest law enforcement agencies in the region. I'm really proud of the work that they do. It's a testament to their excellence that we don't find ourselves in many uses of forces. But we also know that, and I share your desire to be proactive. Let's not wait until there's a desire for transparency to have that incident on camera. So I do understand and support the desire to move in this direction.
Great. Thank you, Chief.
Thank you.
Okay. Now, the time has come. We will begin to hear from, again, a very patient.
Okay, let me give you an update. It looks like we have about 75 people in the queue.
Okay.
Is there a time limit?
2.
Okay.
Did they know?
You're gonna let them know they have 2 minutes, correct?
Yeah.
Okay.
Will you be running the timer?
Yes.
Chairman? Okay, thank you. Caller, please start your comments. You have 2 minutes.
The supervisors for their consideration.
Thank you.
Mr. Chair, can we have a report back on that tomorrow? Because we did talk about it a week ago, and somebody said they were looking at that proposal, so.
Yeah, and let's do this since it's a good first example. Anytime any of the 5 of us want some follow-up immediately based on a public speaker's comment, please speak up, and so our staff can take notes and know to put that on their list for follow-up for tomorrow.
Mr. Chair, I was just informed that there's a audio problem with the public comments, and so I don't know if you want to take a 5-minute recess. They're working with Metro to address that. We can hear the comments, but they're not able to hear the comments on the audio feed.
Okay. Yeah, we will recess for 5 minutes. I'd like to bring back to order this meeting of the Sacramento County Board of Supervisors for Wednesday, September 9th, 2020. Madam Clerk, will you please call the roll and reestablish a quorum?
Supervisors Frost, Kennedy,
Here.
Notoli,
Here.
Cerna,
Here.
and you have a quorum.
Okay, thank you. We were in the process of beginning public comment. Again, please forgive the delay. We had some volume issues. We want to make sure that everyone who is watching remotely can hear the public commenters as well as ourselves. So we've now adjusted the volume to make that happen. And for those that are expecting to speak before we hear from the second caller in a long line tonight, please know that we are taking copious notes, and that if a board member wants some follow-up based on public comment, we are going to be giving that direction to staff members as we take the comments, so that tomorrow we can have a informed conversation on the follow-up to tonight's proceedings. So with that, let's go to our next caller, please.
Right. Caller, please start with your comments. You have 2 minutes.
Hello, thank you for taking my call. Instead of defunding the police, we should be giving more funds to the police. There's plenty of crime in Sacramento as it is. Defunding the police will make criminals even more brazen, as the sheriff just showed you in his slide presentation. We need to keep the police fully funded now, more than ever, so that they can continue to help protect citizens and keep our community safe. Police officers put their lives on the line every day and are getting attacked and disrespected. In addition to their regular job duties, they now also have to handle large crowds, looting and burning during riots, lethal levels of hatred towards them, and a system that many times releases criminals right back into the streets. This is a time when we should be supporting and investing in our police even more. If you're looking to reduce funds anywhere, you should open up the economy and reduce the funds allocated to COVID. Please do not defund the police. Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Good evening, Supervisors. This is Kevin Mickelson, President of the Sacramento County Deputy Sheriff's Association. What I'm hearing and reading is accurate. There will be no proposal tonight to defund the Sheriff's Office, and I can say on behalf of the members of the Sacramento County Deputy Sheriff's Association and the vast majority of your constituents, thank you. I ask that you accept both the CEO and CFO's recommendation to approve the revised recommended budget. I would also like to thank the entire board for finally realizing the importance of funding body-worn cameras. This is not a new thought or proposal, and for at least the last 8 years, both the Sheriff and the Deputy Sheriff's Association have been in favor of implementing body-worn cameras. In previous budget talks, my recollection is that the majority of the board was not in favor of increasing the Sheriff's budget to cover the cost of body-worn cameras. The one positive, I guess, in procrastinating this long is that the technology has improved while the cost of storing the digital media has come down. Supervisor Frost hit the nail on the head in her comments about mental health. And you all probably already know that homelessness and mental health is the #1 issue your constituents have. I'm a bit perplexed that this will be the 11th budget cycle since the economic downturn in 2009, where we have not heard any discussions regarding the reopening of the Sacramento County Mental Health Facility that was cut out of the budget during the 2009 economic crash. It is no secret that our homeless population has skyrocketed since 2009. And most of that increase, in my opinion, is the direct result of losing the Sacramento County Mental Health Facility. Prior to 2009, every law enforcement agency countywide which includes deputy sheriffs, all of our city's police officers, and our California Highway Patrol officers, utilized the mental health facility when they were confronted with a person in mental distress. An officer could transport the person requiring mental health treatment to the Sacramento County Mental Health Facility, where the mental health professionals almost always knew them on a first-name basis. They could get that person back on their medication and usually had a phone number to a friend or family member so that they weren't being released back into their homeless state. Parents and private citizens could also transport a family member or friend that was experiencing a mental health crisis to the mental health facility. Law enforcement interaction was not always the alternative. We did not have the problems with our homeless population or persons in a mental health crisis prior to 2009 that we are experiencing today. Simply stating that we need to replace deputies and solely dispatch mental health professionals to these types of calls doesn't solve the problem. There is still nowhere to take them. Currently, law enforcement has two choices. We either take a person to the hospital where they are most often released back onto the streets, back into their homeless state within 23 hours because they don't want to admit the patient, or we take them to jail for committing a crime, and sadly, they receive better mental health treatment when incarcerated. It is my opinion that you have to start thinking about this issue now to figure out a creative way to revive the Sacramento County mental health facility during the next budget cycle. Thank you.
Thank you. Supervisor Kennedy.
Yes, this is for Ryan. I'd like to have a breakdown of what the number of beds are at our facilities, what the parameters are as far as the hours, who can drop off, who can't drop off, and also, it's getting too late already. And what the status of the law enforcement hotline is.
Okay.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Thank you. Good evening. My name is Judy Nutter. I am a 22-year resident of the Antelope area of Sacramento County. I would like to commend our Sheriff's Department for their wonderful service over the many years I have lived here, especially the POP Department. We have attended community meetings where they have addressed issues in our community and come up with solutions to the problems, and I am diametrically opposed to any defunding of the sheriff's budget in any of these critical areas that we need. In fact, I would say he needs more money to combat the kind of chaos that exists in our streets today in some of these cities that have chosen to defund their sheriff and police departments. So I just wanted to take the time. I waited online over 3 hours to be able for you, our supervisors, to hear what your community needs and wants. Thank you so much for your time.
Thank you.
Caller, please start with your comments. You have 2 minutes. Please silence please silence the meeting in the background.
Okay.
Okay, thanks.
Go ahead.
Hey, my name's Elliot. I don't have a whole lot to add as far as input, but I just kind of want to give you my opinion on the defunding the sheriff's department, or sheriff's office, I should say. I know that there's been a lot of groups that have talked about defunding the sheriff's office, but I think the sheriff put it in words better than I could. But I'm part of this, you know, I'm here a resident in Sac County, and I just want to say that I'm one of the silent majority that does support our local law enforcement, and I think defunding them would have detrimental effects to our community and our citizens. So I just ask that you all keep that in mind the silent majority that do support law enforcement and the sheriff's office, and just keep them funded because it would have detrimental effects on us. That's all I have to say, so thank you.
Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Hi, my name is Carlos Rodriguez. I'm a lifelong Sacramentonian, and I currently reside in the county of Sacramento. I just wanted to express my opinion or my voice that any decision to defund the sheriff's department would be a decision that is made by the individuals in the county board of supervisors. It's not a voice or an opinion coming from the public, the general vast public. Instead of defunding the police, I do agree that we need to, or the sheriff's department, I do agree that we need to reallocate resources and funds, but that shouldn't include defunding. That should include increasing programs like the crisis intervention team. I've had the opportunity to watch that, witness it firsthand, and see how a law enforcement officer and a mental health professional can coexist and bring or affect change in someone's life, as opposed to simply defunding, taking a big, giving in to public outrage that isn't necessarily representative of our public. I wholeheartedly disagree with the movement that is defund the police. I think overwhelmingly our sheriff's department does a fantastic job with the resources that are available to it. And any cut to that would be simply an opinion of a member of the Board of Supervisors, not the opinion of their voting public.
Thank you.
Thanks.
Caller, please start with your comments. You have 2 minutes.
Good evening, Crystal Harding, 23-year Sacramento District 3 resident. This is really a call to action for all of our youth and adult community members. We have to activate our civic engagement and get involved. I encourage you to review the vacancies to serve on boards, commissions, coalitions, and committees, or just be present and pay attention and share what's happening. We need to register, vote, and take action. We are the change we are waiting for. We can do this because we have the power and power to the people. There's more of us than them. When I saw the significant difference of how much funding law enforcement received than other programs like Child Protective Services or Department of Human Assistance and Public Health, it was devastating because it showed where your values were and what you saw were important. If public safety is the measurement and the indicator, how are we doing? They get funded, and what are the results and outcomes? They're even returning money back. So I would encourage you to figure out a way for them to collaborate with community. And instead of creating chaos in the midst of crisis, let's figure out how to collaborate and serve our community members. They need programs. Folks are unhoused. They are struggling daily. I don't know where you all live, but right in our neighborhood, North Highlands, Foothill Farms, and surrounding communities, we are hurting. We are in pain, and we encourage you to look and see and listen to us. We're calling for action. This is the moment in history where we will ask, what did our Board of Supervisors, our elected officials, do for their constituents when they were called? We've written, we've emailed, we've spoken out. These are our needs. How are you going to respond? How are you going to answer that call? We encourage you to make a bold, sustainable, and meaningful impact. Do you have empathy and consider the daily lives and struggles of the people you serve? What will your legacy be during this time? Invest in the people, programs, and prevention and intervention services instead of the after effects and the reactive approach. Let's get creative and innovative. We are intelligent, and I encourage you to ask the people who are served, the consumers that receive these services, how they feel. What's their feedback? How's the satisfaction rate? And again, we are looking up to you as our elected to do the right thing. You're supposed to be representing us, and we're telling you and telling you and screaming and yelling.
Can I get your final thoughts, please?
Thank you so very much for your time. We appreciate you, and I just encourage my community members to register, vote, and get involved. Peace.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Thank you. I'm Karen Humphrey. I'm one of several people who will be speaking to you this evening from Sacramento area congregations together. There's a detailed statement from Sacramento Act in set 1 of the comments starting at page 103. I support the entire statement and ask you to support all 4 of Act's major points. 1 is to provide at least $5 million in a new rent relief program targeted to the most vulnerable low-income residents. Second is to increase funding for homeless services beyond the level in the proposed budget. Third is to commit to develop a comprehensive collaborative regional plan to end homelessness. And finally, to commit to an inclusive, transparent budget process for 2021-22 that truly reflects our community's needs and values. Other speakers, as they come along, will address some of these issues. I'll focus on the planning and budget process points. Sacramento Act has long urged you to join other stakeholders to develop a collaborative, comprehensive regional plan to end homelessness, to make it truly rare, brief, and one time. The pandemic makes clear that lacking a plan means you have little context for the kind of crisis decisions you've got to make. There have been some baby steps toward planning and collaboration in recent months, but as yet there's no overall vision for ending homelessness in this region. In the meantime, the year's budget shows the same reactive approach the county has used for years, and which members of the public often feel unheard. Looking at the budget through the lens of this is all that's available may seem realistic, but it never addresses the underlying values of human need we should be upholding. Former State Schools Chief Elaine Easton notes that budgets are statements of values. Counties usually face more needs than they can pay for, so budgets bend to the loudest political voices, often those of law enforcement. The pending budget crunch in 2021-22 could be an opportunity to really focus on community values. For the next fiscal year, we urge you to institute a process that involves the community in a much more intentional way, that makes broad decisions about priorities up front, including revenue increases as well as program cuts, and then figures out the numbers. It should start no later than January 2021 and involve greater transparency of public information and multiple workshops or forums for community discussion.
Can I get your final thoughts, please?
Sacramento Act stands ready to help you implement such a process, and we urge you to start planning for it right away. Thank you very much for your consideration.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Thank you. My name is Betty Williams. I'm the president of the Greater Sacramento NAACP, a civil rights organization that's been in this community for over 104 years, representing 1,500 members. And we are in support of body cameras for the Sac County Sheriff. Sacramento NAACP has been advocating for body cameras for a number of years, which is long overdue. Every time we approach the sheriff or have meetings, we're being told that the County Board of Supervisors has not allowed them to have cameras because they have not approved the budget. It was Sac NAACP that was advocating for increased cameras within the jails in the past. Sacramento NAACP is inundated with calls that involve law enforcement of excessive force, and the number one complaint is actually coming from the Sheriff's Department, asking NAACP to retrieve videos to prove their innocence, and there is none. We at the NAACP would like to propose to work with the sheriff to create criteria that includes policy, procedures, and also incorporate transparency and accountability. They should not be left to do this on their own. We need the tools to allow us to help others that are calling to prove their innocence by showing a video. And we ask that you support the body cameras. Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes and silence the meeting in the background.
Thank you. My name is Brianna Mullen. I'm a constituent of District 3. I just want to say that I've worked for a constitutional officer and I've helped counsel thousands of elected officials across the state. And I know what you have to do in this budget is difficult. As an elected official, it's your job to listen to your constituents and respond to the changing landscape. And this job has never been harder. So I want to thank Supervisor Natoli for your thoughtful questions. You seem to be genuinely interested in engaging in a nuanced discussion tonight. The People's Budget of Sacramento has surveyed over 2,500 residents about their vision for where our finite resources should be distributed. I just want to put that in perspective because tonight you're going to hear from 100 callers, and that needs to be compared. In our survey, we've overwhelmingly heard that people need help with housing, public health, healthcare services, and mental health assistance. We need to invest in our community and help build resilience to help navigate these incredible challenges. And we cannot do that with a budget that funds the status quo. Even if the previous year's budget served the needs of our communities, how can we say that the needs of our community haven't drastically changed since March? An unparalleled climate crisis that blocked the sun today, a pandemic and a crisis of systemic racism concurrently requires a new plan for our public resources. Law enforcement cannot fight wildfires, they cannot treat COVID, and they cannot support our community members who have lost jobs, teach our children, house our families, or address racial injustice in our criminal justice system. It would be irresponsible for the board to not chart a new course in response to these crises. We need to invest in mental health first and community support teams that have already existed and are non-police mental health responses. If we're going to call out what people see as an uncontinued service on this community, we cannot continue to fund the same services. This discussion should not and cannot be fueled by fear-mongering and rhetoric. I want to point out tonight that the sheriff on social media encouraged people outside of the county to call into this meeting. So I want you to be suspicious of callers that come in. And we must focus on smart investment in research-based policy and look at a factual hard look of where our public resources have gone and where they've been ineffective. So I encourage you tonight to think about those. Thank you for your time.
Thank you.
Caller, please start with your comments. You have 2 minutes.
My name is Sabrina Rodriguez, and I am a resident of Sacramento County. I wanted to call and express my gratitude to the Sheriff's Department. I am very pleased with their service and would not support anything defunding the police. I think they need the resources they have to provide us with the level of security that we enjoy. I am in support of any type of programs we can offer to help the Sheriff's Department, such as adding social workers to help them more with like a crisis intervention so that they can deal with issues that the Sheriff's Department shouldn't have to deal with, which are more family issues that they are often called to. So anything that frees up the Sheriff's Department and their officers to be able to deal with crimes as opposed to issues surrounding, my kids are acting up and you need to talk some sense into them. So, as well as other mental health issues that could use some help. So again, I just reiterate, I do not support defunding the police, do not support defunding the Sheriff's Department. Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Good evening. My name is Heidi Kaiser, and I am the chair of the Policy and Advocacy Committee for the Children's Coalition. Firstly, thank you all for taking this time to meet with us to discuss passing a family-centered budget, prioritizing the needs of our children during this pandemic. Regarding staffing the WIC program, page I-59 of the revised 2021 budget currently being discussed states WIC's workload has not decreased despite rollout of the new WIC-wise computer system. The remaining staff will have to see more participants, which will lead to longer wait times for clients, possibly discouraging participation. This could lead to a further reduction in caseload, end quote. The coalition is just concerned about a budget that may discourage WIC participation through longer wait times. If pandemic-era state and national telehealth services have filled this gap since the publication of this budget proposal mere days ago, we are greatly relieved, but strongly urge explicit confirmation that these services will continue to be available after the pandemic. Furthermore, we entirely affirm Supervisor Natoli's synopsis of our position regarding mental health support capacity for the Medi-Cal eligible children through the FIT program. While referrals are currently down, most children have limited exposure to some of their primary trusted adults, mainly their teachers. As schools reopen and reporting from teachers becomes possible again, Sacramento County must have greater capacity to treat these children's mental health referrals. In the COVID era, not less. Furthermore, told us that you provide additional funding for homelessness services, prioritizing support for youth leaving foster care, as well as families with children, and funding for new social workers for foster children and child safety training. Equity starts with society's most vulnerable, our children. As the face of California's integration, we need to show America what the equitable California dream looks like. Start by taking care of Sacramentan kids. Thank you so much for your time.
Thank you.
Caller, please start with your comments. You have 2 minutes.
PJ? My name is PJ. I agree with Scott himself when he admitted that they don't solve anything. Homelessness keeps happening. Addiction keeps happening. He is a Band-Aid. The failure in the system for these people is that we are not investing in them. We're investing in their incarceration. Additionally, Scott's presentation was a straw man of what the defund movement is. Maybe there are other ways to deal with homelessness, etc., are exactly what we're asking for. Mental health first exists right now, and all of those headlines are bull. They're meant to draw clicks and have more nuance than defund equals bad for crime. Screenshots of headlines aren't reality. Nuance exists because we're human beings. And maybe he'd like to discuss the $100+ million in bad behavior lawsuits that his department has cost the citizens of this county. The latest story out of Utah is an exemplar of why we need to move funding from police to health services in order to ensure that our emergency response is commensurate with the need. A 13-year-old boy with autism being shot by an officer is the exact reason why we need mental health professionals in these situations. In mental health work, professionals often deal with dangerous situations and they manage to de-escalate. They manage to get a hold of the situation without using fatal force. This is why we need an alternative to 911. We need that to ensure that when these situations arise, whether it be a homeless person having a mental health episode or any other resident or a substance abuse issue where healthcare workers at a hospital manage to handle danger every day as a normal course of their job. All of these need to be dealt with by removing the police from the equation. Shooting someone who is suffering or affected in some way doesn't reflect well on us as a society when we view their life as less valuable, and so we send in police who end up injuring or killing them many times. These responsibilities need to be removed from police handling. Hours of training don't replace years of training. We need experienced professionals to help with all of these situations. And in case you're hearing this and thinking, we clearly need to send them more funding, then you're not hearing us. Body cameras mean nothing without an enforcement mechanism. Body cams are enforcement, hand-waving, but have no actual accountability. All they are is a tool that is currently being used improperly. The point is accountability, and that is a point that has never been followed through on. Qualified immunity and a myriad of ways police unions work to ensure the worst of the force stay on, or at best get moved around, isn't what police want from their police. It's way past time to continue throwing money at a broken system in hopes that it fixes itself when it is correct in every single way. We saw that this week as law enforcement sent out flyers in an attempt to coerce people using fear to continue their funding.
Can I get your concluding thoughts, please?
They were intimidating us for protection money. Move responsibilities away from police, invest in health services response teams, create an alternative 911, listen to the people who elected you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Hi, my name is Alexandra Cosentino, resident of Sacramento.
I ask that you please do not defund the police. As a citizen, I'm very concerned. When the riots were here, that was very scary. If we didn't have our law enforcement, I feel that our city would have been taken over. And I'm not sure the riots are over. Also, criminals are very bad people and they do bad things. And if we don't have the law enforcement behind us protecting the citizens and our community, I'm not sure what's going to really happen, but it's very concerning. So I ask again, please do not defund the police, the Sac County Sheriff's Department, or any police for that matter. And that's about it for now. Thank you.
Thank you.
Please start with your comments. You have 2 minutes. Hi, are you there?
Hello, yes.
Okay, you have 2 minutes. Go ahead.
Thank you. My name is Yelena Fedorchuk. Please do not defund. We need our police fully functioning and able to protect our community. Defunding will only make things worse. Actually, we need to increase the funding so law enforcement can get better training and maintain staffing. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Thank you. This is Rebecca Evans, Executive Director for the 80-Watt District, which is a PBID, a Property Business Improvement District. As a PBID of 196 property owners and about 350 businesses, I cannot express the vital need for funding of the Sheriff's Office. They absolutely deserve more than less. I ask you to oppose any funding decrease. The collaboration that we have created between the PBIDs in Sacramento County and the City of Sacramento, between our law enforcement of the sheriff, the police, the CHP, has been a huge success in multiple areas. Since the COVID law has come into place, we have had so many, it's probably quadrupled the amount of subjects that we have to work with that are alcohol and drug infected with mental issues. If we don't have the help of the sheriff right now, we don't have help because we have never seen a navigator in our area. We would love the idea of a crisis enforcement team to stand beside us to help create this. They've also helped us clean up the area with the hundreds of camping. Because of the camping law, they just leave trash everywhere. And we've had over 650 bags of trash just this year alone. We've had 2 homicides in the last month since the COVID started, and we've had prostitution. We were down, in January, we were down 45% in crime. And we're now having, with no school, the juvenile issues, and on and on and on. Without our HOT team and our POP team and Captain Barnes, who sat on the phone with the PBID managers every other day during the rioting so that we knew what to do, how to do it, and we all did it together, has been exceptional. And I just ask you again to oppose any funding decrease and celebrate the success that we do have in the collaboration of so many, along with all our law enforcement. Have a great night, and thank you for the time.
Thank you.
Hi, please start with your comments. You have 2 minutes.
Hi, my name is Lindsay, and my husband has served in both the military and in law enforcement. We have 3 kids, and we're actively involved in the community. Susan Peters is our supervisor. and we are eager to support public health efforts to lower our COVID rates so we can get people back to work and back to school. COVID is fast emerging as the leading cause of law enforcement deaths this year. It's hurting Black lives and it's hurting Latinx lives disproportionately in our county. So what I would like to ask for tonight is that this is a request to the Board of Supervisors to establish accountability to ensure that public health funds go to the Public Health Division to address COVID and the long-term effects of COVID. The CFO referenced that there were anticipated savings in health services and that health services funds could be reprogrammed. This raises a red flag. We're concerned about possible retaliation from county leadership towards public health, and we would like to support the Public Health Division having the resources needed to get our county back in action. We're currently in the purple, and we would like to be able to lower our rates the way that other counties, countries, and states have done, and we need the resources and the accountability to do that. Thank you very much.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Hi, Board of Supervisors. My name is Allison, and I'm a resident of Sacramento County. I'm a member or resident of Supervisor Cerna's district, and I'm calling in to express grave concerns about the budget that's being presented to you by County CEO Naciel. First, Supervisor Cerna, you committed to making the People's Budget Sacramento a part of the public record for the September 1st meeting. Can you let us know where the presentation is accessible and how it has been shared? I sent you an email with this request, so if you could follow up with me on this, it would be very helpful. I just want to be clear that the budget that's being presented to you increases the Sheriff's Department's budget and decreases the Health Department's budget in the middle of a public health crisis, a global pandemic, when arguably it's more important than ever to prioritize health funding. In governmental budgeting, you typically look at the effectiveness of an organization when you think about how to prioritize funding, and the Sheriff's Department does not actually have that great of a record of solving crime. So you're hearing from some callers, but the data actually doesn't show that the sheriff has been as effective at fulfilling its mission. So in terms of justifying resources, discretionary general fund resources, which you have the power to direct towards health and human services, you're directing it to a less effective organization, and that is really not the basis with which you should effectively, can direct our resources to make sure that we're getting kind of the best bang for our buck in terms of a recession scenario that we find ourselves in. I also want to be clear, the People's Budget in Sacramento presented to you the data of over 2,000 of your constituents and residents that are asking you to value what's in the best interest of Sacramento County and what aligns best with their values, and that includes community resources and not law enforcement. So you really need to take a look at how we should prioritize discretionary general fund resources and where we should be making the cuts. And it really should be that we make cuts to the discretionary general fund to the Sac County Sheriff's Department. If we don't want to talk about defunding, we should at least talk about cuts across the board that are needed to be made during this time in order to address this economic situation we find ourselves in. And so the Sheriff's Department should take at least an equal cut, as same as everybody other departments. And then also there should be resources allocated, additional resources allocated.
Can I get your final thoughts, please?
Thank you very much for your time. And Supervisor Cerna, please follow up with us on where we can find the People's Budget presentation. Thank you.
Thank you. Flo, will you help me tomorrow to make sure that that is accessible?
Yeah, and I actually have information
Great.
for you.
Thank you.
Mm-hmm. Please start with your comments. You have 2 minutes.
Hi, I'm a resident of District 1, and I want to make one thing clear to the board and to my fellow community members. I support defunding the police because the excuse of we just don't have the resources when we ask for more for our schools, for mental health services, for affordable housing, just doesn't cut it. We have the money, it's just going to the Sheriff's Department. If we're truly concerned about public safety, then that word needs to include all of our community members, and we need to talk about crime prevention. Public health experts have made the case for the link between economic disenfranchisement and crime. Investing in affordable housing, mental health services, and more actually takes care of our people. Giving that money to the Sheriff's Department does not keep us safe. The sheriff already gets over $400 million each year from the general fund, and he got $104 million of the coronavirus relief fund. He and Nav Gill have yet to prove how the sheriff is helping this community address the pandemic. Are they providing economic support or helping out with COVID-19 testing? In addition, as a state worker, I have accepted a nearly 10% pay cut as a result of this pandemic. I readily accept this, but as of writing this, I am unaware of a similar plan for either the sheriff's department or the probation department. Now I must ask this board, when working under a constrained budget, why is the already bloated law enforcement department getting so much more funding than other critical needs, such as economic support for residents who have lost all sources of income? I'll end by reiterating, supervisors, please divest from the sheriff's department and instead invest in what our community actually needs. Public health services, groups like Mental Health First, and affordable housing are just a few examples. Thank you.
Thank you.
Please start with your comments. You have 2 minutes, and please silence the meeting in the background while you're talking. Hi, please turn the meeting off in the background. It's your turn to speak.
Thank you.
It's your turn to speak. Can you turn the meeting off in the background while you're talking?
While you're bringing up the next caller, I'm just going to let those that are watching that are waiting to speak, please make sure you do not have the meeting on in the background.
Hi, caller, please start with your comments. You have 2 minutes, and please turn the meeting off in the background.
Yeah, hi, my name's Paul. I'm a homeowner in Sacramento County for over 20 years, and we are absolutely opposed to defunding law enforcement in any way. Rather than defunding them, we need to empower and support them in being proactive and keeping the peace and dealing with the ridiculous looting and vandalism that should not be tolerated whatsoever. The results of less law enforcement can be seen in other communities, and why we would want to end up like Portland is beyond me. I think it's ridiculous that this is even being considered. Thank you.
Thank you.
In the background,
Please start with your comments. You have 2 minutes.
Yes, I thank you for taking my call. I am a citizen of Sacramento County, and I say part of the silent majority who supports the police. And I'll be brief. My question is, who will benefit the most if we defund those law enforcement? It is not the law-abiding citizens. I am completely against defunding the police, as you should be all as well. The only people benefiting from less law enforcement are the thugs and thieves that are destroying American cities. And I would like to ask you to please vote against any kind of defunding of the law enforcement, because they deserve much better than this. Let's not turn Sacramento into Seattle, Portland, or Chicago. Thank you very much.
Thank you.
Please start with your comments. You have 2 minutes.
My name is Tim Verga, and I'm commenting on the issue of defunding the police or the sheriff's department. I'm a second-generation Sacramento County resident in Ms. Frost's district. I think it's pretty clear for those of us who lived in this neighborhood over the last 50 plus 60 years in reality, especially growing up in North Highlands, that less of a police presence doesn't make for a better community, especially in times of trouble and stress and all the issues that we have to deal with at this point. So I just want to make it clear that I do not support and will not support anybody who decides to try to defund the sheriff's department. Thank you very much.
Thank you.
Please start with your comments. You have 2 minutes.
My name is Abe Daniel, and I serve as the senior pastor of Trinity Life Center in Sacramento, California. Today I want to speak against any revisions to the county budget related to any defunding of law enforcement. As a pastor and a superintendent of a Christian school, we have relied on the amazing officers who have been called on for minor issues with the transient population loitering on our campuses, to major break-ins and threats that have resulted in damages as well as arrests. The officers we have interacted with have not only displayed professionalism and great care, but they've also earnestly worked to keep my employees and the families we serve safer. We not only stand in support of our law enforcement, but also believe that they need greater resources to adequately equip them as they provide high-quality public safety services to us as constituents, and as they work in partnership with the community to protect life, our property, to solve our neighborhood problems, as well as enhance the quality of life in our city. Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Sure. Sacramento native here. I would like to know why Nav Gill, who should represent the people's best interest, is proposing to cut health services and increase the sheriff's budget when we are in the middle of a pandemic. Our community members who can't pay rent need housing options, our small businesses need options, and the sheriff's department needs to repay the money taken from the CARES Act and the money used for the lawsuits against the sheriff's department back to services that will benefit the health and well-being of our families and friends. We demand that the budget cuts come directly from the Sheriff's Department and the carceral system so that these funds can be used to help our homeless community, which the police do very little to help, and provide resources for services that already exist that are proven to work, such as MH First and SAC Soup. No cuts should be made from the health services. Instead of investing in a department that solely reacts to crime, let's try to understand why these crimes are even occurring. Let's get to the root of these problems. Let's be preventative and not reactive. I believe that mental health services absolutely need to be separate from the police department. I also find it disgusting that Sheriff Scott Jones gets to speak for the supporters of Black Lives Matter and what the supporters actually want. He uses fear and unsighted articles to point the finger. Not once did he take any accountability. His homeless outreach program is a failure. You can tell by looking at our streets. His HOT program is also a failure. Why are we funding these programs? In recent years, the Sheriff's Department has hit record lows, historic lows in several crime clearing categories, including rape, homicides, and burglaries. Scott Jones admitted that he does not have a better model than the ones his department currently has. Why are we putting all of our general fund into the jail? Sue Frost should be ashamed for applauding police for, quote, packing when responding to mental health crises. These crises won't be solved with death, but with the de-escalation and understanding. No one needs to die. Doctors and mental health specialists deal with violent patients all the time and yet never feel the need to kill their patients. So please reallocate the funds to services that work. Support the people's budget. Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Hi, my name is Natalie Anselin, and I'm a resident of Sacramento County. As far as the money being allocated to inmate health and safety, that should have already been happening. According to SAC-B, excessive force and abuse by deputies at the jail was known but not discouraged by Jones' department. 2 deputies were recommended for termination, but Jones rejected that in favor of suspension. SAC-B estimates that the county has paid more than $16 million in excessive force damages linked to Jones' department in the last decade. You're not going to manipulate us into believing this will change if Jones gets more money. Inmate health and safety must be enforced with the existing sheriff's budget with full transparency. Tonight, Jones blatantly dehumanized Sac County residents. First, he says that Black Lives Matter wants to defund the police, and then 30 seconds later says no one wants to defund the police. So who counts as a person to Jones? Also, how is he, quote, not fear-mongering, bringing up the goal to abolish? So what? The current call to action is less money to the police. That's it. We want the budget to prioritize human needs. That will reduce crime by removing the primary source of it. The COVID-19 homeless response plan must entail simply housing the houseless. How are you going to try to scapegoat that issue by claiming houseless people are on drugs and decline health right after admitting that sometimes you're not able to refer them anywhere to stay? Providing widespread free housing is the only way to ensure public health and safety in this pandemic, including mental health. Mental health resources don't need to collaborate with police. That would only make it inaccessible to all the people who Jones doesn't consider human. Money should go to mental health first, which already exists. Give us back the $104 million that was stolen from the CARES Act funding and allocated to the sheriff. Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Hi, thank you for the opportunity to voice my opinion. I am a Sacramento County resident and a homeowner. I have dealt with the Sheriff's Department for many years through good and bad situations. I have also attended POPs meetings. I highly encourage all of you to not take any of their budget. Since COVID hit, they have had to deal with more, since our governor feels it's okay to let prisoners go early and various other reasons. They do a fantastic job in our community. Supervisor Frost knows that for sure. And I would highly encourage you guys to not take money away from them and to continue to support them and the good work they do. They do a lot in our community. They care, their officers care, and they do many, many events to contribute to our community. Again, thank you for the time.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Thank you. I'm Sean Michael, longtime resident of District 5, and I support the People's Budget of Sacramento. The People's Budget should be used to allocate funds for the 2020-2021 fiscal year. First, many of the Sheriff's comments were misleading and distorted. I request that the Sheriff release links to the actual sources in his presentation. Second, at least one of the articles he included, which I Googled and matched to his photo in real time, is from Breitbart.com, a website associated with Stephen Miller, a figure characterized by the Southern Poverty Law Center as a white nationalist. Why is Sheriff Scott Jones showing screenshots from alt-right website to the Sacramento County Board of Supervisors? As someone who is supposed to be a law enforcement expert, the board should press him on which sources he used to cite crime statistics and why he chose them. Why wouldn't he, for example, use crime data from the specific law enforcement agency he mentioned instead of relying on random blogs and white nationalist sources? Second, we need to increase funding to serve the people of Sacramento, not to further bloat the sheriff's budget. Studies, including a 2010 meta-analysis in the Journal of Police and Criminal Justice, have consistently shown that law enforcement funding does not correlate with improvements in public safety. By contrast, increased funding for health and human services, economic growth, and housing support do improve public safety. I urge the board to enact a budget based on research, not fear. Due to COVID-19, the need for housing, employment, food, and health assistance has skyrocketed. The 2020-2021 budget should reflect this reality and shift funding away from law enforcement and toward the actual needs of Sacramento County residents. Again, I urge the Board of Supervisors to keep its promises, the needs of the Sacramento people, and refuse to continue bloating the budget of the Sheriff's Office that has proved itself unresponsive to change and best practices. Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Thank you. My name is John D. And first of all, I'd like to thank you all for the work that you do. I know it's not easy. My family's been in Sacramento for 3 generations. I'm pushing 70 years myself. And I'd just like to say I'd like the Sheriff's Department to have more money, not less. Our downtown area looks like a war zone. And something really needs to be done. So I support the Sheriff's Department in funding them fully, if not more. Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Hi, thank you for taking my call. I just want to thank my supervisor, Sue Frost, for her responsiveness to me. I'm a lifelong resident of this community. I've personally met Sheriff Jones. I find him a very upstanding leader in our community, and I am a widow raising 2 children on my own. I, like the silent majority, need to know that I am safe in my community. If you don't have safety and you don't feel like you're safe, nothing else matters. You have to feel safe in your home, in your community. I also hear the concerns about the mental health issues that go on with our homeless population. It's a grave concern to me. I just don't think that you should be taking any funding away from the Sheriff's Office. They are a fabulous liaison for the taxpaying citizens as well as our disenfranchised population. I'm hoping that there is an answer to these people that we see on the streets that my heart goes out to, that I know most of us, we're human, our hearts go out to seeing these people. They need help. But taking money away from the Sacramento County Sheriff's Department is not the answer. Those people on the street need them as well. They're as more subject to crime than even people in their homes. So I'm totally opposed to taking a cent away from the Sacramento County Sheriff's Office, and also finding a way to, conjure up resources to help what we see on the streets day in and day out. We all have humanity. I believe that from the bottom of my heart. It's just a juggling act to see that the resources are allocated, fairly. But, I don't want, like the callers before me, I don't want to see this wonderful community turned into a Portland, a Seattle, a New York City, Chicago. We don't deserve that.
Can I get your final thoughts, please?
Thank you. Thank you for hearing me out. I do appreciate it. Bye-bye.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Hi, my name is Keon Bliss, and I'm from District 1. And I'm kind of just blown away at how little neither Nav or Bruce seem to have learned, or the board learned the lesson coming from the scandalous mismanagement of CARES funding. So I'm going to point out a couple of facts before this board decides to capitulate to Jones and his 9.5% of the population that votes for him. So during the pandemic, Nav Gill's revised budget is to give the sheriff a $10 million budget increase while rejecting critical funding proposals for other health and human services. And despite being one of the most well-resourced agencies in the region, the Sheriff's Department maintains one of the worst performance records in California. And yet, no matter how much money you give Scott Jones for body cams or staffing the areas that you want him to, the sheriff actually has no legal obligation or fiduciary duty to spend his budget on anything he wants to. All this talk around body cameras is an uninspired red herring meant to distract the public from the root problems in policing that necessitate their use in the first place.
And the converging crisis we face today really requires much more bold, imaginative thinking beyond just giving law enforcement 37% or 70% of our county's general fund budget. So, to my first point of the budget cut, if anybody remembers, Nat Gill claimed that he gave 85% of CARES dollars to sheriff and probation because it would free up general fund resources. So we shouldn't be seeing any cuts to health services. And yet, as some of you have already pointed out, $17.8 million in cuts are being proposed, with the largest chunk, 35.4%, coming from health services. Health services fund critical safety net programs, particularly WIC, and provides primary care, pharmacy services, mental health services, substance abuse treatment, and public health services vital to contain the coronavirus and addressing the problems that necessitate supposedly Scott Jones and the sheriff's existence in the first place. And yet, public health has already been the smallest part of the county budget for at least 10 years, and he's already taken money that was meant for public health to serve Sacramento during the pandemic and gave that money to the sheriff. Again, performance-wise, contrary to what many of Scott Jones' supporters would believe, the sheriff's department has actually been investigating far fewer cases.
Can I get your final thoughts, please?
Solved any of them. With a budget exceeding $400 million, the sheriff should actually be able to do more.
Can I get your final thoughts, please?
This is way less than 2 minutes. You should absolutely be reinvesting the sheriff's dollars.
Thank you. Thank you.
Caller, please start with your comments. You have 2 minutes.
Thank you. Hi, this is Matthew with the Sacramento Food Policy Council. I'm calling in today to urge that you increase funding to the Department of Health Services and Public Health in the midst of the COVID-19 pandemic. Proposals to cut 3 vacant FTE for the WIC program are especially concerning to us, as effective implementation of this program is a lifeline for low-income families, and impacts on this program will likely disproportionately burden communities of color. Cutting additional WIC positions in this year's budget would be an unfortunate continuation of last year's budget hearing, which included cuts of over 34 FTE to CalFresh and WIC staffing among health services and the Department of Human Assistance. This year, it is critical that you provide additional resources and FTE to fund food and nutrition support programs and planning. In addition, it is critical that you fund community-based housing and mental health support programs. Furthermore, additional resources and FTE for long-range planning activities focused on environmental justice, food systems, and climate change are needed now for a resilient and equitable post-COVID future for Sacramento County. Our county's emergency food providers have seen a massive increase in demand, with the Sac Food Bank and Family Services' most recent mega distribution drawing 5,000 families, the most they have ever seen. Emergency food is vital and is necessary in a county where at least 42% of food insecure, of low-income adults are food insecure, and that number is only increasing. But it's also critical that we approach our most complex and pressing issues, such as food insecurity, housing and homelessness, climate change, and reimagining public safety with systemic and data-informed solutions guided by those most impacted by the issues. That's why we are working with public health and long-range planning to conduct a county-wide and comprehensive food system assessment and action plan. We also support the demands of the people's budget, which are based off survey responses from over 2,500 county residents. In particular, our budgetary goal as a county should be that 33% of the general fund go to human needs and health services. No cuts should come from health services, human assistance, fair housing services, parks, or economic development and small business support.
Can I get your final thoughts, please?
Sure. By supporting COVID-19 testing and prevention measures, increased worker protections, and rental assistance, our communities will only be healthier and more resilient.
Thank you.
And they will be more food secure.
Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Good evening, board members.
Although I respectfully disagree with the Sheriff's General comments this evening, I do concede body cameras is an endeavor that I do support. Certainly, board members are aware of new situations where the story cannot be fully ascertained because an officer did not wear their body camera. However, as it has become more common, law enforcement agencies, not only within California, but nationwide, are courted by entities like Axon, formerly Taser International, who is the preferred provider of law enforcement tasers and other police equipment. They have achieved this position as evidenced by reporting in news publications where they have exerted extensive company funding to court law enforcement officers and giving them tools to lead and push their law enforcement agencies and their products, to say that their products are without peer. And in turn, they attempt to convince their procurement departments to accept sole source requests or falsely assert that there is no competition for body cameras. This is patently false. There is market for competition. Let's avoid publicity, such as situations where the city of Los Angeles attempted to piggyback off of a current county contract for body cameras. Thus, I ask that the board inquire of the sheriff where they are in their procurement process and involving county's own purchasing staff in this process. Please task Sheriff Jones with providing detailed information sooner as opposed to later. It should be noted that the Sacramento County Code delegating contracting authority to county officers does not establish such a delegation to the sheriff. The board, however, does authorize this to the county purchasing agent. It is exceptionally disconcerting that Sheriff Jones, by his admission, has advised that he and his staff are already in the process of evaluating potential sources of body cameras. But I would wager that this is potentially outside of a formal, publicized, competitive bid process run by its purchasing department. Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Good evening, Chair Cerna and Supervisors. My name is Mike Jaskey, representing Sacramento Area Congregations Together. SACTAC submitted detailed comments on 4 topics. These comments were included in Set 1, starting at page 103. I'm going to focus in my remarks on the topic of homeless program funding. We acknowledge that total homeless program funding through the Department of Human Assistance has increased in the proposed budget. We appreciate the efforts of Ann Edwards and DHA staff to provide program level funding information to us so we can really understand what is being funded. We hope supervisors will approve the proposed DHA budget as modified in one way. We recommend additional funding for encampment outreach. After extensive discussion with DHA and DHS staff, we now understand that DHS includes in its budget funding for enhanced encampment services out through December 31st. Enhanced services means more sanitation stations, placement of trash receptacles and waste pickup, consumables, mobile showers, etc. This is expected to cost about $1 million for the 3 months of October, November, and December. We strongly recommend extending this encampment support program through the end of the fiscal year. We just can't drop these services in the middle of the rainy season in Sacramento. Extending it to an additional 6 months would cost approximately $2 million. We really would appreciate continuing these services and the support that these encampments have been receiving. In summary, please find the additional resources somewhere in the overall budget to help improve the lives of homeless people in our community. Thank you.
Thank you. Let's see, Bruce, this one's for you. In response to the comment/suggestion by SACAC by Mr. Jaskey just now, tomorrow I'd like to understand that if it's of interest to the board to enhance what we already have in place in terms of encampment outreach, what that might look like, and kind of give us some order of magnitude in terms of the value of various amounts of adjusted revenue that we might use to address some of the issues that Mr. Jaskey had brought up. Okay, thank you.
Caller, please start with your comments. You have 22 minutes.
22?
Hi, good evening, Board of Supervisors. My name is Liz Blum, and I'm a resident of District 1, graduate student and an advocate with Decarcerate Sacramento. We understand that the consent decree states that staff must be increased to meet minimum constitutional and statutory standards. But the very next line of the consent decree states that the parties agree that reduction in jail population is a cost-effective means to achieve these standards. County Council even agreed that a reduction in jail population is a cost-effective means to comply with the consent decree. The recent Kerry Group report also recommended a coordinated jail population reduction plan. There is no such plan at this point, so these staffing allocations are premature. Britt mentioned earlier in his presentation that county mental health caseloads and populations are down, so the level of staff needed is lower. The same logic should apply to the county jails. Since COVID-19 began, over 30% of the jail population has dropped. These numbers, which, by the way, should be released at least weekly by the sheriff, but are not, these numbers last showed that the jail populations are at around 2,800, which is less than 1,000 people than the average, which is less than the average daily population before the pandemic by about 1,000 people. Meanwhile, crime rates in Sacramento are at a 20-year low. The Mays consent decree does not once mention a staffing ratio that is required to meet out-of-cell time requirements, but we can assume that a drastic decrease in jail populations would also drastically decrease the number of staff needed to meet the consent decree. The fact is that there are things that the Sheriff's Department could already be doing without more staff or without more funding to start meeting the terms of the consent decree and human rights, but his jails remain abusive places that compound trauma on everyone in them. NAV's budget actually rejected plans to reject 2 outpatient behavioral health programs at $3.2 million that would relieve pressure on the jail system. Sheriff Jones stated in his presentation that corrections simply cannot be cut due to the consent decree. This is a blatant lie.
Can I get your concluding remarks, please?
Yeah, one more sentence. We know that the county needs to meet the terms of the consent decree in the next 5 years, but your plans are inefficient, ineffective, and threatening more budgetary violence on our communities.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Thank you. My name is Chris Evans. I'm the Executive Director of the Antelope Business Community in Antelope. And just a couple of quick comments tonight for you as I've been listening to the meeting. First of all, thank you very much for your service. We do appreciate you. I know tonight's a tough night and the next few days are going to be hard. We know you're making some tough decisions. And a lot of the decisions you're making aren't even been caused by you. It's COVID has caused us to have a problem. So let me give you some firm numbers from the property business improvement districts. And this is collective of the county because, as Rebecca told you earlier this evening, the PBIDs in the county work collectively. Our calls for service of our security teams are up 100% since January. Of the increase, about 95% of those calls are related to drug activity or drug addicts specifically. My district in Antelope looks like a sea of hypodermic needles in certain spots, and we go out every morning and religiously look and try and find them and get them up, and we live in fear that some kid is going to come along and get stuck with a black tar heroin needle. So our district is holding on by its fingernails, and we're not trying to assess blame here. We understand the reasons for no bail. We understand Dr. Bielenson's orders. We understand what's going on. But what we don't understand is how you could possibly consider adjusting the budget for one of the most vital teams we have, and that's the hot team and the pop team. You know, we count on these as a PBID. All of your county PBIDs count on the hot team and the pop team to help us do our work. And let's face it, what other options do we have? I mean, the laws have changed. Criminality is a lot easier now. You can't arrest people for stealing in grocery stores. And now all of a sudden, like for example, tonight, Mr. Chair, at the beginning of the meeting this evening, you had several letters from groups, and I'm sure they're fine groups, wonderful organizations. I know we have Sacramento Steps Forward. They do a lot of good work with the homeless here in the community. But I will tell you this, Sacramento may step forward, but they've never once stepped into Antelope. I don't think they could find North Highlands if I sent them a GPS and dropped a pin. But the people who do come, every single time we ask for help, is the hot team and the pop team. Sergeant Lynn.
Can you conclude your comments, please?
Yes, absolutely. I just wanted to say in closing, we count on Captain Barnes and the hot team in the Sacramento Sheriff's Department, and I think he should increase the funding, not decrease the funding. And again, thank you so much for your service. We appreciate what you do. Have a good night.
Thank you, Chris. Next caller, please.
Please start with your comments. You have 2 minutes.
Hi, my name is Gina Barnard, and I am a resident in Susan Peters District. I'm calling tonight to ask you to not accept the budget as presented by Nav Gill and to revise the budget according to the values of the people's budget. Sheriff Jones himself in his presentation shows a lack of wanting to help homeless or people who are mentally ill, which I actually agree with. The sheriff's department should not have anything to do with being first responders for homeless or mental health, and his attitude clearly shows that he does not want to be a part of that as well. I believe that there should be no cuts to health services, and that no more money to the sheriffs. They already took the $104 million of the CARES Act funding, which should have gone to the public health department. Again, if people are calling in worried about crime, drug activity, law enforcement doesn't help with that. Proactive preventative programs help with that. There are studies that show that when people are unemployed, when people are hungry, that's when crime can happen. So we need to invest in these proactive programs and not invest in being reactive with law enforcement. And so that's really what the defund movement is talking about. Thank you so much.
Thank you. Next caller, please.
Thanks.
You're welcome.
Please start with your comments. You have 2 minutes.
Hello, I'm a resident of Sacramento County for about 20 years. Defunding the police is a movement by criminals, rioters, anarchists, and some Democrat politicians, and it is absolutely insane. It is not supported by law-abiding citizens. COVID and other community programs are not the main priority here. It is public safety and law and order so people feel safe in their community and so businesses feel safe to operate. If they don't, people and businesses will move in order to get that safety. Criminals, anarchists, and rioters create fear, and they harm citizens much more than COVID or any other community issue. Defunding of the police will further hurt law-abiding citizens and businesses in the form of increased crime, while at the same time helping criminals, looters, and rioters. Just look to the Democrat-run cities where all the rioting and criminal activity has been occurring, some of which already defunded their police. Law enforcement need their resources and an increased number of personnel and funding now more than ever. All other community programs are secondary to safety, law, and order. I am urging everyone to vote no on any movement that restricts or defunds resources from law enforcement. I'm asking that a movement be initiated to increase funding to law enforcement. I urge viewers to remember who votes to support the defunding of police and to remove those board members from office at a future election. I want to thank Sheriff Scott Jones for being a true leader and for all his efforts in keeping Sacramento safe, and I support his presentation 100%. I want to thank all law enforcement personnel who put their lives on the line every day. We need to focus on public safety more than any other initiative, and now more than ever. And to do this, we need more funding and resources for law enforcement, not less. Regarding homelessness, while I believe that intervention and recovery programs can be a good first step, you can't help someone who doesn't want to help themselves, and some homeless are beyond help. For these individuals, I feel that asylums should be reopened to get the homeless off the streets, which will provide them with a safe environment, while at the same time protecting the outdoor environment from littering and human defecation.
Can I get your
which has gotten
concluding remarks,
completely out of
please?
control. which has gotten completely out of control in Sacramento. Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Yes, my name is Kula Koenig, and I've really been struggling trying to figure out what to say to you all that hasn't been said, or that would actually get your attention, or that would seem important enough to you to listen to what the people have been trying to say. And the only thing I can think of is that you care about the position that you hold right now as a county board of supervisor. And so you have to feel like that position is in some way threatened. And so you're probably weighing the consequences of which side do I go with, right? You know, who's actually going to help keep me in office and who's not. And so maybe you think that the sheriff and those who have called in saying that you shouldn't defund the police, that you should invest in community and care, that maybe they will show up for you when it is time for that reelection. And I'm calling to say that we are watching. Those who care for community investment are watching the way that you deliberate these decisions and the decisions that you make, because it is about people's lives. I too live in North Highlands, Foothill Farms area. I've lived here since I was 12. Yes, I am a homeowner, if that means anything. I'm a person who cares about people, and I'm urging my county board of supervisors to really ask yourselves, do you really think that it is okay to give the county sheriff so much money? Do you really think that it is okay to have Nasgio lie to you? Who's your boss? Who's the boss? Is he the boss of you? I don't understand. I'm asking you to really think about, make the bold choice. I know it's hard. I know it's scary to be courageous and say, I'm going to change things. And I'm really going to say that I'm not going to cut anything from health services, from housing, from small business. I'm not going to do that. I'm going to let the sheriff shoulder that burden. I know it's tough, but that is the right
Can I get your
thing to
concluding
do.
remarks, please?
And we are watching. Thank you so much.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Hello, my name is Eric. I live in Fair Oaks. I'm actually calling in support of law enforcement, but I'm also calling in specifically in support of the maintained full budget for the Sacramento County Police Probation Department. The Probation Department does have the ability to enforce the law. However, that is a small fraction of these services they offer to the community. They have many outreach programs. They have many things that they do in collaboration with other agencies. And I believe that if the public knew exactly what they had their hands in as far as what the probation department does for the county as a whole, I believe that they would support me in saying that I support the full funding of the probation department. Thank you for the time.
Thank you.
Please start with your comments. You have 2 minutes.
Hello, my name is Trina Whitney, and I've been a resident of Sacramento and District 1 for 30 years. I'm seriously disheartened by the current budget proposed by County CEO Nav Gill, and I ask that you reject it. It's a blatant betrayal of the people of Sacramento. It robustly overfunds the sheriff and incarceration. It fails to invest in creative and dynamic community-based solutions and in any substantial and sustainable way. It fails to expand the profoundly inadequate mental health system in Sacramento and the massive shortage of affordable and super affordable housing that we face today. Systemically, the status quo is failing in Sacramento, and the traditional approach of expanding the sheriff's budget is not the answer. If it was, we wouldn't be in the dire situation we're in now. I implore you, before voting on this budget, take a long, deep breath and imagine for a moment what our county would look like today if over the last generation we had funded housing, mental health care, food security, robust education, community enrichment, and public health and human services as robustly as we funded the sheriff and incarceration. Many define insanity as doing the same thing over and over again, expecting different results. And by this definition, this proposed budget is insane. It's nothing more than the status quo, and by many measures, it is worse and more uncertain than ever because it's based on the one-time funds that Nav Gill himself has regarded as fickle and uncertain. Our current budget strategy must be reimagined, and we all know it. The solution to crime is preventing it in the first place. That's where our priorities should be. The evidence is overwhelming. Quality housing, health and mental health care, healthy food, robust education and skill development, living wages, and treating people with dignity is a way to change our society and to stop the insanity, truly. Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes. Caller, please start with your comments. You have 2 minutes.
The solution to crime is preventing it.
And please turn the meeting off in the background.
Turn it off.
Yeah, thank you. Okay, go ahead.
Hello, my name is Corey Ring Martinez. I'm a District 1 resident and a longtime Sacramento County resident. In a moment when people are literally choking on the air in the midst of a global pandemic that's ruthlessly attacked people's respiratory systems, NavGill's business as usual budget neglects areas Sacramentans urgently need investment in to survive this pandemic. Specifically, investment in housing and environmental justice and climate change was among the priorities from the People's Budget Service, and yet NAV is rejecting a bunch of money for planning and environmental review to update the Climate Action Plan and address the increased demand for affordable and attainable housing in existing communities. For all those people that care so much about homelessness, this is a moment when we could really be trying to prevent a lot of this from happening in the first place. As I mentioned earlier, this is particularly egregious given the dangerous air quality that's exacerbating COVID-19 risks. Furthermore, I reject the premise that defunding the police will lead Sacramento to be a Portland situation. The violence in those cities was primarily violence instigated against protesters by police forces and white supremacists. Furthermore, is it not violence to underfund critical public health services during a global pandemic? Is it not violence to underfund mental health services and preventative services instead of relying on this carceral system? I want to echo what a community member called in recently, talking about, what is it that's going to make you listen? I really resonate with that because I feel like a lot of you have already made up your mind. And I want to say to you that we are preparing and we will vote you out.
Thank you.
Please start with your comments. You have 2 minutes.
Thank you. I'm Ann. I've been a resident of Sacramento County for 40 years. I'm speaking in support of the Sheriff's Department and in opposition to the very bloated budget for the Department of Health. The Sheriff's budget needs to be increased, not decreased in any way. We need to have 2 officers in each vehicle for safety, for their safety, for our safety. They have enough going on that decreasing their budget is absolutely the last thing that should be on any of you supervisors' mind. And frankly, I'm ashamed that you are even considering it. Our social services, mental health system, which so many of the callers tonight have spoken towards, it is a dismal, ineffective system. It needs to be fixed from within and not by taking money from law enforcement money to prop it up. Fix it from within before you start taking money from anyone else. Please stop messing with our safety and stop messing with our lives this way. They're very important to our community. They are holding our community together. They are a critical structure. Without them, things would really get worse. Look at the other cities that are having issues. Not one of your callers tonight who has spoken out against the sheriff made any comments about our safety, made any comments about all the destruction that was done. These people don't care. You need to stop listening to them. They had cookie cutter statements. I'm sure there's more on the line waiting to speak, but you need to stop listening to these other people. They are not stakeholders in our community. No one asked me about the people's budget, and the people's budget has nothing to do with me. It is a very progressive movement that is trying to take over the government and defund police. Please look at the health department and start defunding them.
Can I get your final statement, please?
I am calling to support the sheriff department, and I will not support a single one of you or anyone else
Thank you.
takes any money from the sheriff department.
Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Hi, thank you guys for your service. I'm for defunding the police and relocating that money back into the health or the CARES Act. The money was originally taken from the CARES Act and put into the police department, and it should be put back, especially since we have a global pandemic happening. And among Sacramento County, like I said, I'm a South Sacramento resident for 20 years. Among my streets, I see homeless people. I see, just needles on the ground, all this. The people are truly suffering and need services to help them. An officer showing up with a gun and aiming it at another homeless person isn't going to be helping them. To throw them back in prison for a couple of days, a couple of weeks, and then bringing them back into the street. We need programs that are ready and set aside to help our homeless and the homeless population in Sacramento. Thank you.
Thank you.
Callers, please start with your comments. You have 2 minutes. Oh, please turn the meeting off in the background while you're talking.
Hello, my name is Robert Copeland. I live in District 1. I support the people's budget, and I think we should weed out all the bad sheriff's department. Any lawsuit that the sheriff's department gets should be out of their pensions, not paid by the taxpayers. I hope Scott Jones heard that.
Thank you.
I'm not done.
Okay. You got a minute 30. Go ahead.
Police, sheriff's department is not solving crime. It's not going to help solve the crime. Prevention will solve. Like, put money in the services, like for the homeless population, and maybe mental health services. Get rid of the hot team because they're doing more harm than good. More money should go into affordable housing. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Hi, I'm calling in tonight because I've been a resident of Sac County for 36 years, and I think it would be an absolute disgrace to defund our police. There may be some police within the police force that need training, but to defund police in a time when there's so much craziness going on in the world would be an absolute disgrace. I don't even know how many times in the time I've lived in Sac County that we have relied on the police, and I've lived across the street from homes that are drug homes, and the police have to go there and help. But I just hope that you guys really, really consider to not defund the police in a time that we're going through right now. It would be crazy. Could you imagine if Sacramento ended up like Seattle or Portland? It would be unreal. And every single one of you and every single one in the county need those police to support us and protect us. It will turn into absolute anarchy without them. And that's all I'm calling for tonight. I do not think we should defund the police. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Perfect. Thank you. My name is Christy Fletch. I'm an attorney in Sacramento, California, and I would be so deeply disappointed if there was any movement here tonight to defund the Sacramento Sheriff or the Sacramento Police. The police give everyone in our county and our city protections that go above and beyond the normal day activity of everyone. They protect all of us. And I can't even believe that the Board of Supervisors would even consider an action to defund or direct movement away from our county and our city of Sacramento police officers. These police officers go beyond. Every day they defend our county and our city, and it would be so irresponsible to defund them at all. Thank you for listening to my comments, but I can't believe that our mayor or the Board of County Supervisors would even contemplate defunding our police. Thank you so much for listening.
Thank you.
Please start with your comments. You have 2 minutes.
Hi, I just want to let y'all know to not defund the police, but defend them. We need more police on the streets. We need more support for our police officers, and we need to unite in this. Thank you.
Thank you.
God bless.
Please start with your comments. You have 2 minutes.
Hi, my name is Michelle Kraft, and we need more funding for our Sheriff's Department, not less. We had attempted home invasion. We had 2 patrol officers, and that was 2/3 of the force that was protecting all of our towns at this time. We need more. I mean, the response time is not even enough. Our sheriff's officers do not have it. There's not enough of them to protect us all, and we need more. Some people are saying, oh, we need more mental health help. Well, that's fine, but when a homeless person is blocking the door to my place of business and I can't go in, I still need to be able to call the sheriff to say, hey, I need help. I can't get into my place of business. I don't know if they're armed. I don't know if they're mentally ill. I don't know that. I cannot assess that. That's why we have law enforcement, and we need our law enforcement. Please, please, please do not let Sacramento become one of these riot cities. We need our protection. We need our law enforcement. Thank you so much.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Carrie Weaver is my name. I'm a resident, and I'm calling to request that the budget that's been requested by the Sheriff's Department be fully funded.
Thank you.
Okay.
It's a new record, I think.
Caller, please start with your comments. You have 2 minutes.
Yes, hi. I am a Sacramento resident, and I am 100% against defunding the police and the sheriff's department. If anything, they need more funding. Our safety, my family's safety, relies on this funding. Please do not take it away, and do not listen to the activists that come from out of town or anywhere else. We need the sheriffs and we need the police department. Thank you for listening to me. Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Hi, my name is Julie King. I'm a business owner in Orangeville, California. I am 100% against defunding the Sheriff's Department for any reason whatsoever. As a matter of fact, I feel like they deserve more funds so that they can have better resources, better training, and further education. And I feel that defunding them would go against all of the forward progress that we have made at Orangeville. Thank you.
Thank you.
Caller, please start with your comments. You have 2 minutes.
Hi, my name is Say, and I wasn't gonna talk originally, but then I felt like I needed to respond to all these comments about the need for funding for the Sheriff's Department because of need for public safety, and I think that it just is it reflects an incredible lack of imagination, as well as, quite frankly, laziness on the part of people who are forming ideas about how to help and create public safety. That the only idea is we can be reliant on a punitive justice system that is frankly abusive and so frankly rooted in systemic racism. So who's safe there? Who feels safe in that regard? Obviously, I mean, the unhoused populations as well as people of color, it doesn't make sense to continue funding this system that is clearly broken. So yeah, I mean, I think that's my main point, is that we have to imagine other ways of having justice, and yeah, that's all.
Thank you.
Please start with your comments. You have 2 minutes.
Hi, my name is Jennifer. I've lived in Sac County my whole life, and I am calling to support the sheriff. I think we need to, if anything, increase their budget. If there's any talk of defunding, if there's a decision to defund, I and my family are fully prepared to leave the area in fear of our safety. And I think a lot of other people feel the same way. That's not good for business. That's not good for our economy. That's not good for California. And I think we need to dismiss the defunding of the sheriff or SAC PD with the way things have been going, especially. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
I have 2 minutes. Am I on now?
Yep.
Yes, please.
Okay, my name's Evelyn. This is really a scary story to tell you, but it happened on August 25th or 23rd on Sunday. It scared the daylights out of me, and it's not something I really want to talk about, but I was assisted by law enforcement after negotiating the Marconi curve on Business 80. My car started flashing yellow lights, so I tried to get off the freeway. When I got off the freeway, my car flashed red lights all over my dashboard and came to a dead stop. A man stopped after my car. I asked him to put his flashers on and help me direct traffic. He went into my car. This is all on the 911 call. It's all on the 911 call. I screamed at this guy to get out of my car, get out of my car. He screamed at me, don't call 911, we can do this ourselves. He was next to my purse, next to my phone. For all I knew, he was going to grab my car keys. And anyway, so once he knew I had called 911 and law enforcement was on the way, he left. And 2 other women pulled over and they stayed with me until one of the officers showed up. When the officer showed up, this man came barreling across the street after the other women left. This man had been waiting across the street, not willing to assist any other motorist who might have slammed into me because my car was not movable. I have a big SUV and it was not movable. And he didn't want to use his beat up old truck to move my car. So you can go ahead and try the 911 call. It's all on there, okay? The law enforcement agency that helped me has been praised by me on Facebook by name. It was the CHP, but if I had gone less than a mile further, I would have been smack dab in Sac Sheriff territory, and they would have had to handle this. On the scale of Fruit Loop to absolute lunatic serial killer, I don't know where that man landed, but the fact that he was across the street watching 3 other women direct traffic, he wanted to have a relationship with me and my vehicle, not with any other innocent motorist who might have come off that freeway and slammed right into us.
Can I get your concluding remark, please?
You cannot defund Sac Sheriff because they won't be able to defend us.
Thank you.
Please start with your comments. You have 2 minutes.
Hello, my name is Mike Ralston. I'm a retired Sacramento County Deputy Sheriff. I served for the last 21 years, some of which at that time was under Scott Jones, who I love and appreciate greatly. Please, Sacramento Board, do not cut the Sheriff's Department. This is a time where we all need to come together. I agree with that. The Sheriff's Department has just tried so hard to meet the needs of the community. It's sacrificed so many of its people, and the overall effect has been very positive, but I know we have a long way to go. Do not cut the Sheriff's Department funding, especially when it comes to the patrol services, but I'm going to say for the overall package of the whole organization, because the changes that asthma, Sheriff Scott Jones has put into play, especially with concerning correctional stuff to try and help people get back on their feet and to reach out to communities in need, has really grown the last 3 years immensely. So in addition to that, my wife's a deputy probation officer with the Sacramento County Probation Department. She actually works in pretrial services. She actually is in an implemental phase of trying to make changes. A very key element. Pretrial services is replacing bail. Before I was a deputy sheriff, I was a bounty hunter for years. I'm not kidding. The job that they're doing in probation is actually replacing all of the bail bond industry and all of the elements that to make things as equal as possible, as egalitarian as possible for the people of Sacramento County. So please do not cut the 2 key organizations, Sacramento County Sheriff's Department and Sacramento County Probation. Additionally, recognizing that the DA's office, which is doing a marvelous job of prosecuting and also helping to mitigate a lot of the impact of things that have happened when it comes to protesting and things like that, which are all totally viable elements that the sheriff's protecting, probation's protecting. By all means, please do not cut those things. If anything, you want to fund those more because
Can I get your final comments, please?
And that is it. Thank you.
Great.
I appreciate your time and carry on. Keep up your good work. Thank you.
Thank you.
Please start with your comments. You have 2 minutes. Hi, can you turn the meeting off in the background while you're talking, and please start making your comments? Thank you.
Okay. Good evening. My name is Rick Eaton. I'm a resident of Carmichael and a small business owner. I'm also a member of Sacramento Area Congregations Together. Sacramento Act urges you to make significant changes to this proposed budget. We have submitted to you a very thoughtful and detailed letter addressing our concerns, in which we've made 4 specific recommendations. Our communities are facing 5 crises as we meet tonight: the pandemic, an economic crisis, an impending eviction crisis, a crisis of confidence in our current approach to law enforcement, and a climate crisis that should be obvious to all of us. It is simply irresponsible and a failure of leadership to ignore these crises and adopt a business-as-usual budget without significant changes. Now I will address our specific recommendations regarding rent relief. Tens of thousands of renters will face eviction and bankruptcy in early 2021. At the same time, we know that thousands of landlords face default on their mortgages as a result of their tenants' inability to pay. A rent relief program administered by SHRA as part of the program they are standing up for the city of Sacramento will have 3 immediate benefits. It will prevent low-income tenants from accumulating more debt. It will stave off mortgage default for thousands of local landlords, and it will pump much-needed money into our local economy, aiding all of our struggling businesses. We urge you to treat this action with the urgency that it deserves. We have heard far too many comments from staff tonight about looking into and talking about things. We need you to act boldly and as quickly as legally possible, and not wait until October to consider this important action. Thank you very much.
Thank you. Before we go to the next caller, Supervisor Kennedy.
Thank you. Mr. Gill, or Mr. Ferguson, either one. Does this budget, he brought up a good point that reminded me, does this budget in any way help or conversely hinder our ability to get the climate action plan done?
Actually, it helps. We have money in there to move it forward.
Great. Thank you.
Thank you. Next caller, please.
Please start with your comments. You have 2 minutes.
Hi, I was calling because I wanted to let the Board of Supervisors know that we do not want the police defunded. I live in Antelope, and we already do not see the Sheriff's Department here enough. And people in Antelope just think that they can do whatever they want. And as a mother with 2 children, that greatly concerns me. And it concerns me that people want to defund the police and take away things and services that are there to support us and help us in times of need and to protect our communities. And so I am urging the supervisors to not defund the police. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
I could empathize with the folks that are worried about the sheriff losing its funding and not being able to provide the security that they're so desperately needing for. But if you're actually looking for genuine public safety, you're looking in the wrong place. Even by the State Department of Justice's own numbers, the Sheriff's Department only cleared about 38% of the violent crimes they investigated in 2009, which is well below the state's average of 45%. And that's multi-years running, as far back as 2016. And that's with a budget exceeding $400 million. That includes just 9.3% of 161 sexual assaults that they investigated, well below the state's own abysmal average of 35%. And if one duty the board cares most about, protecting property, the sheriffs cleared just 5.6% of property crimes investigated in 2019. These clearance rates represent the second worst for the department in at least 20 years. And to keep in mind, these are only cases where someone was arrested or charged, not necessarily convicted, which makes it a lot easier for them to inflate their numbers. Even with crime at a 20-year low, the sheriff's budget continues to grow even as it investigates fewer cases. In fact, if you were to compare this to the Sacramento Police Department, which they actually investigated more violent crimes last year and cleared more of those violent crimes on less than half the sheriff's budget. So, just to summarize, health services is getting the most cuts during this next budget cycle at a time when we in Sacramento clearly needed the most for foundational housing, health infrastructure, and as well as addressing the converging crises, as many people are pointing out. The sheriff's budget represents 37% of our general fund, or it has in the past, which is disproportionate to the community's priorities and the money already having been given to the sheriff. It's not being utilized effectively per the rates outlined previously. This imperative this board to actually really think outside the box, be more imaginative than a lot of the callers and the sheriff's department.
Can I get your concluding remarks, please?
And actually make bold changes that actually prioritize human well-being and our needs for the community, not just law enforcement.
Thank you.
Please start with your comments. You have 2 minutes.
My name is LaDonna Colton, and I'm a resident of Sacramento County, and I just want to call regarding just funding for our law enforcement agencies in Sacramento County, and I'm interested in the most complete funding possible for the law enforcement agencies for the safety of all of our citizens. I'm not interested at all in any way in redistributing or reducing funding to law enforcement. I think a robust law enforcement is the absolute very best way to keep our citizens safe and our county protected, and I'm in full support of law enforcement in this county.
Thank you.
Thank you very much.
For $150,000 for consultants that we said I think we're waiting to see.
Please start with your comments. You have 2 minutes. Hi. Yeah, thank you.
Should I start now?
Yes.
Okay, thank you. First of all, thank you for your patience, and thank you for taking my call and your public service. My name is Dennis Wade, and you're having to make a lot of tough decisions. Sometimes it's helpful when making a tough decision to get back to basics and think about the mission statement of the county, which is to improve residents' quality of life by providing cost-effective public services while fostering economic health, regional cooperation, and stewardship of community assets. So I have 3 questions that I'd like to bring focus to the mission statement, which is all of our focus in trying to improve the quality of life here in Sacramento. But the first question is, what is more fundamental to quality of life than protection of life against violent crime? Second question is, which department in the county makes the biggest impact to protection of life? And thirdly, Are your budget reductions to the Sheriff's Department consistent with your most fundamental responsibility to protect citizens' lives? Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Okay, my name is Catherine LeGros, and I was born and raised in Sacramento County. I've lived here. I was born in 1965. Safety, I raised my family here, and my family lives in Sacramento. And safety is a very important aspect of my family's life, and I want the sheriffs to be fully funded and safe so that they can keep our streets and our community safe. The Sacramento County Sheriff has always been very professional and helpful, and during times like these, we need more law enforcement, not less. Thank you for letting me make my comments.
Thank you. Please start with your comments. You have 2 minutes.
Yes, my name is Wendy, and I am opposed to defunding the police or taking away from their budget. We need more money for police. We need more availability to get equipment and to have training, not less. I'm fully for more funding.
Next caller, please.
Please start with your comments. You have 2 minutes.
Thank you. My name is Janine Bedling, and public safety is very important. I love our communities. We need to make sure that we're adequately funding our police department and our sheriff's office. They are protecting us every single day, and that's why we love our town, is because of the great men and women that put on the uniform to protect us. So I urge each and every one of you to protect our town and to honor our police officers and our sheriff's officers. Thank you so much.
Thank you. Next caller, please.
Caller, please start with your comments. You have 2 minutes.
Okay. Yeah, my name is Andrew, and I'm a citizen that live here in Sacramento. I've been here, born and raised around this area, and the amount of chaos that's going on in this city right now is tremendous. We cannot defund the police. If anything, we need more police present and to calm this whole wave down. Anyway, that's my comments.
Thank you. You want to make an announcement?
Please. Make your announcement.
No, do you want to make the
Oh,
announcement?
sure. Okay, so right now we have 55 callers left in queue, and the public comment line is closed. Mr. Chair, I recommend that you close the public comment period for this budget item number 1. Take all the rest of the callers that are in queue, and then when you guys resume tomorrow, the public comment period is closed for item 1.
Okay, very good. So, given that, and assuming that the callers that have been waiting, that are continuing to wait, are listening, I would suggest that if you've already heard a comment that you're agreeable with, if you continue to want to make your comment, you're certainly welcome to do that, but you might want to think about a very abbreviated comment, such as, I agree with fill in the blank in terms of your position on the budget, so that we can make sure people have a chance to be heard tonight as the evening draws late.
And I would also like to add that they can submit a written public comment to boardclerk@saccounty.net. That's boardclerk@saccounty.net. Your comment will get added into the record. Okay, we're gonna. Please start with your comments. You have 2 minutes.
Hi, my name is Brian Gibson. I'm a Antelope resident in Sacramento County for the last 35 years. I want to express my admiration for Sheriff Scott Jones and all that he does to protect the citizens of Sacramento County, and truly believe that we need to fund the Sheriff's Department, and we actually need more funding to maintain peace and tranquility in the area. And Sheriff Scott Jones has our 100% support. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Hi, this is Gail Delahan. My husband and I live in Fair Oaks, California, and we would like to agree with all the comments made in support of the sheriff's budget and for the reasons given regarding keeping our city safe from especially with the rioting that's going on now. Thank you.
Thank you. I think people actually listen to me.
Please start with your comments. You have 2 minutes.
Okay, my name is Derek. I'm a citizen of Sacramento County, calling to make sure the police and the sheriffs are not defunded. There's a lot of crime going on, even in my neighborhood, and they don't even have the resources now to deal with it. I just have to fill out a written report online and hope that somebody eventually comes out. I'm really hoping that the police actually get more funds so that they can actually do a better job of supporting our community. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Hi, my name is Krista Brooks. I've been a resident of Sacramento County my whole life. I've loved living in Sacramento County, and for the most part, I've always felt safe. However, in the past couple months, I don't feel that way. I have grave concerns with defunding our police department. I think enough chaos has broken out within the last couple of months in Sacramento that I personally have had friends whose businesses have been destroyed. There's been homes that have been destroyed. Our county jail has been destroyed to the point to where the National Guard has to come in. I think that in itself is enough reason to fund our police departments more. You know, if Sacramento defunds the police departments, we have less officers, which means, and that's already a problem. I have friends who have graduated the academy who hardly see enough pay for their monthly bills in the beginning of their career to put food on the table and support their kids. If anything, they need more funding. We'll have limited officers on patrol, which lessens response times. I know I have 2 little ones who I'm constantly in fear of at school. I mean, I wish we had officers at the schools. And with the less response times for emergency situations, I mean, things like murders, rapes, school shootings, armed robbery, kidnappings. I mean, we don't need less response times. We need faster response times. Some officers who've been in the department long enough, you know, I'm starting to hear the question that why are they going to support a community who doesn't have respect for them or who's thinking of defunding their resources for their safety. You know, they have families to go home to too. So if anything, I think we need our officers. We need them in our communities. We need more of them in our schools. We need more law and order in Sacramento. That's pretty much wraps up my comments. That I think that defunding our police departments is just one of the most ludicrous things I have ever heard of doing.
Can I have your final thoughts, please?
That's it.
Thank you.
Please start with your comments. You have 2 minutes.
Thank you very much. My name is Alex. I'd like to begin by thanking you all for your time and taking the comments. My husband is a local firefighter paramedic, and I am an ER nurse locally as well. We live in a rural part of Sacramento County, Wilton, which I'm sure you're all familiar with. And because we live in a rural community, we're serviced almost exclusively by the Sacramento Sheriff's Department. Despite being both highly trained in emergency response, we do still dial 911, and because we live rurally, our response times are often longer, of course, than if we were in a more densely populated area. I have been following linear thinking, and I find some serious concern with the principles of defunding our sheriff's department. I think that defunding the department will lead to a forceful reallocation of the sheriff's resources because they will have less to provide. And what that does in turn is creates even longer response times for those who might need it the most. As you know, firefighters, along with many other types of public servants, are shift workers. And when my husband is on duty, I'm alone with a toddler for days at a time. I believe that defunding the Sacramento Sheriff's Department is really an unacceptable action when it leaves contributing members of society waiting even longer for help or safety or whatever needs may arise that the Sacramento Sheriff's Office can provide. I would hope that the board takes this into consideration. While I know what people, I think, hope to achieve with defunding any kind of, public service, I think that ultimately what it's going to do is harm people who are servants themselves. And so I just wanted to share that input. I really thank you for your time.
Thank you.
Please start with your comments. You have 2 minutes.
Hi, thank you so much for taking my call. I really appreciate you guys. I know it's tough to sit here and listen to all of us talk. I want to say I'm passionate about law enforcement because I grew up in Sacramento and my husband is a law enforcement officer and I know what they go through every day. They're good people. And if you guys want to keep recruitment in law enforcement of Sacramento County up, and you want to have good people representing our community, you need to pay them. You need to fund the department, or you're going to get horrible officers that shouldn't be officers. We also elected you to keep us safe. Government is supposed to, one of its basic jobs is to keep us safe. The majority of people want law enforcement to be funded. Please don't fund us. We want to be safe. Don't cave to the squeaky wheel. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Hi, thank you for giving me this opportunity to talk to you. Reason of my call is I want to ask you guys, please don't defund the police. We need our men and women in blue. They sacrifice their life every day to keep us safe and keep our kids safe. With everything going on now, all the crime happening, if we don't have our officers, how we want to live? What's going to happen to our kids in case of kidnapping, rape, or something happens to them? Who we have to go to talk to and ask for help. Let's show our love and support and thank them for everything that they do for us, and let them know that we need them. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Okay.
Go ahead.
Okay, thank you. Thank you for taking my call. My name is Morris Bailey. I've been a resident of Fair Oaks, California for the last 50 years. I think that would be a very, very poor maneuver to take and defund the Sacramento County Sheriff's Office. I think that would be, if you look at other places that have defunded, the service has completely went in the sink. I think that would be a very, very poor move. All right, thank you very much.
Thank you
for taking my call.
Thank you.
Please start with your comments, and please turn the meeting off in the background. You have 2 minutes.
Hi, thank you for taking my call. My name is Lisa, and I've been a resident of Sacramento County for over 20 years. I am in complete support of keeping our police, our fire, our sheriffs, all of our law enforcement. I have children that I'm raising in Sacramento County, and I need them to be safe in the schools and out in public. I need our businesses to be safe. I need to be able to be safe in my own community. As a victim myself of a kidnapping, if it wasn't for law enforcement, I may not even be here today. So I urge you to please keep our police, keep our fire, keep our sheriff. Please keep us safe. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Thank you. I will remain anonymous. I am from Orangevale, lived here 43 years. I think defunding the police is the most absurd thing I've heard in all my 60-plus years. Police took an oath to protect and serve, so how have they become the enemy, the bad guy? They should be given the tools and support needed to protect us. Look at Portland, Oregon, New York, San Francisco, Sacramento, all the other cities with looting, destroying businesses, killing people. Not peaceful protesting. I'm all for peaceful protesting to be heard. This is not what this is. The police should be allowed to stop the crime and protect the people and end the madness, or it's just going to continue and get worse and worse. I hope this defunding goes nowhere, and it should be on the ballot so the people can decide, not the corrupt Democrats of California. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
This is Karen Baird, and I wish to tell the supervisors, please do not defund our police or sheriff's department. We need our law enforcement to keep our communities safe. It's a very small percentage that is protesting and wanting to defund them. I believe most of us want to keep our police and sheriffs. They are what helps us have a thriving community. Thank you.
Thank you.
You have 2 minutes. Please start with your comments.
Yes. Hi. Hello. So I want to start with calling attention to the sheriff's presentation. First, he has absolutely no right to say that literally everyone else supports funding the police. I'm a primary care physician. I'm a homeowner. I have a master's in public health. I have a fellowship in psychiatry, and I support defunding the police. My support is backed by data and peer-reviewed medicine articles, and not right-wing propaganda. Being in medicine has shown me that the police harm individuals. I work in Sac County, and we do not have adequate access to mental health resources. The clinic that I work at doesn't even have adequate access to basic medical supplies. People who are on Medi-Cal in Sacramento County receive substandard care compared to people with private health insurance. I am a physician here in the middle of a pandemic and told to bring my own personal protective equipment to work. And move on to all the commenters who talk about safety. Again, I challenge you to look at the data here and look at the facts. Don't listen to a presentation that has pictures that have been posted from Google. 83% of the crimes are property crimes. These are crimes often of survival of poverty. Sometimes they're driven by substance use disorders. Sheriffs do not prevent these crimes. Again, the data shows our Sacramento sheriff here, the one who's trying to advocate for this money, only clears about 8% of these crimes, which is not very much at all. So they are not providing safety for us. They are only harming our community. We should not be a county that prioritizes property over people. Your budget will impact thousands and thousands of lives. And you need to think about that when you're making these choices. And we need to do better. We need to do better. And we need to support our community.
Can I get your final thoughts, please?
That's all. Do better. Support
Thank
our
you.
community.
Thank you.
Please start. Please start with your comments. You have 2 minutes.
Start.
Go ahead, please.
Hi, my name is Morris. I've lived in Sac County District 3 my entire 22 years of life. I'm calling because we're living through mental crises right now. People are hurting and our basic needs aren't being met. We live, dream, and work in Sac County in a changing world and are finding our tax dollars aren't funding the services and resources we need. We're in a global pandemic. Families are struggling, mass evictions are ahead, communities are reckoning with systemic racism, businesses are closing in this economic crisis, and to top it all off, climate change continues to compound all of our problems and exacerbate natural disasters. We've seen world record temperatures in California, sustained heat waves, mega fires, and the subsequent brownouts, ash, and poor air quality that we breathe today. We need cooling centers. Our elderly and disabled communities need access to reliable, decentralized, clean power. Our unhoused communities need our compassionate support. People need access to mental health care and basic health services and contact tracing to survive this pandemic. Our children need to see healthy models of restorative, not punitive justice in practice. Our families need WIC to access food. We need clean air to breathe. We all need to work together to build a renewable, sustainable, emission-free society in the next 10 years if we want to have a livable future. These are all matters of life or death. Fortunately, investing in people and community services has preventive intersectional co-benefits. We can improve people's quality of life, which will relieve stress on families, poverty, and crime, and will improve our economy and environment. The People's Budget has already shown overwhelming popular support with over 2,500 Sacramentans in just a few weeks. We need an aggressive, funded climate action plan that creates jobs by investing in updates to the infrastructure and services that we desperately need. We need to be asked about our needs and heard through participatory budgeting. We need long-term cooperative regional strategies for development with our cities and utilities. We have a budget. The question is how you choose to spend it. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Hi,
Hi, my name is Evan. I live in Fair Oaks and have lived in Sacramento County since 2004. I'm a privileged white man who makes a comfortable living. I help raise an 11-year-old that I need to keep safe and healthy. He's a little brown kid who has autism and wouldn't be able to answer sheriff's orders in a timely manner before they might shoot him, like they have to other disabled community members. Back to my original point. To put it simply, your constituents are suffering through insufferable times. They need your help. To get to the brass tacks, what's come out of our brave county health officers and our reputable media sources like the Sacramento Bee is that Sheriff Scott Jones and County CEO Navgil have been trying to manipulate the budget from the inside. You know this, and we know this. If it was merely embarrassing that the sheriff and county CEO are trying to manipulate funding behind the scenes, I wouldn't waste my evening away from my family. But it's affecting your constituents' lives. And that's why I'm hoping that you, our leaders, will stand up for the needs of Sacramento County residents, even in the face of pressure from these two men. You all are the ultimate deciders. Standing up for Sacramentans in need looks like restoring the $104 million that was taken from CARES Act funding that was misappropriated to the Sheriff's Department. It looks like ensuring the budget cuts come from the only logical place, the sheriff's budget, which receives the lion's share of our county funds. It looks like ensuring that no less than 1/3 of the general funds go to health needs and human needs, which obviously makes sense during COVID. It doesn't quite make sense to me why I have to call in to beg you to please fully fund health and human services during a pandemic, but please don't take my word for it that it's the right thing to do. 2,500 of your constituents have let you know in just the past few weeks alone through the People's Budget Sacramento survey. So please do the only thing that makes sense. Fully fund health and human services during the worst pandemic that we've seen in the last 100 years. Nothing else makes sense. And I just want to end with something. I want to ask.
Can I get your final thoughts, please?
If Sheriff Jones truly wants crime rates to go down,
can I get your final thoughts, please?
Yes. Why is he adamantly opposed to investing resources in prevention or any other?
Please start with your comments. You have 2 minutes.
My name is Robin, and I live in District 4. As you consider this budget, you have the opportunity to begin a shift in Sacramento County from a county that puts nearly 3/4 of its financial resources into law enforcement to a county that supports and focuses its resources on building a stronger community that benefits all of its citizens. Having people say that the majority of citizens want to continue to oppress the most oppressed folks in our community is not an acceptable reason to continue the oppression. At what point do those who face the most oppression receive the help needed? We have thousands of unhoused folks in our community, yet our county budget does little to support housing people. Instead, you support a carceral system in Sac County that is not only racist and classist in nature, but doesn't even provide a safe, clean, healthy environment free of mistreatment and abuse by sheriff officers to those living inside the jail. We have a great need for mental health services in our community. Mental health agencies are bursting at the seams and cannot provide the care needed. Yet you don't increase spending in mental health services. But instead you invest in law enforcement officers who are not trained to care for those in a mental health crisis to provide this care. We have the Sheriff's Department and even board members, Sue Frost, who use fear-mongering as a way to garner support rather than actually working for the betterment of our entire community. It is time to start looking at how you can invest in Sacramento County, invest in the lives of people. I'm tired of hearing, quote, we have limited funds for meeting the needs of people, when so much money is sank into holding up an abusive system that does not address the needs of our community. I ask that you run mental health first, to put trained mental health providers in front of those in a mental health crisis who are not carrying guns and rolling up with lights. According to Sheriff Jones' estimates, we're looking at a minimum of 36,000 calls a year that could be and should be handled by people who know what they're doing.
Can I get your final thoughts, please?
Yes, invest in the needs of those most in need, and you will strengthen our entire community. This means investing in housing, mental health, health services, education,
Thank you.
programs.
Thank you.
The people's budget.
Please start with your comments. You have 2 minutes. Please mute the, can you mute the meeting in the background, please?
Yes, I can. Alrighty. Thank you so much for taking my call, and thank you so much for your service. I do ask that you do not defend the Sacramento County Sheriff's Department and law enforcement. If it is decided to defund them, it will only embolden those causing the violence, vandalism, and the anarchy. And if defunded, the crime rates will very likely increase, like they have in other cities, including New York City, Portland, and Seattle. Not only in cities, but also in residential neighborhoods and areas where they have businesses. Also, thousands of prisoners have been released from prison early. Not a good time to defund law enforcement. There have also been warnings that the rioting and violence will increase between now and November 3rd, which is Election Day, and even after Election Day. Not a good time to defund law enforcement. We need our law enforcement for safety and law and order. And I also want to take my time out to thank you for listening to my comments, and also to our law enforcement. I support our men and women in blue. And again, I respectfully ask that you don't defund the Sheriff's Department and law enforcement. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Hello. Good evening, board members. Thank you for taking my call. As a lifelong county resident, I would like to take a moment to voice my support for increased funding of the Sacramento County Sheriff's Department. They are the men and women in blue who keep our communities safe, and they have a difficult job of doing so. And I feel that it's important for us to show support for them, but to also have increased funding for our Sheriff's Department. It is especially important that we show our support for our deputies more now than ever. As a county resident, if funding were to decrease, I would feel less safe in my own home, and I would feel less safe in my own community. Increased funding will allow for us to feel safer, and not only that, it will also allow for the Sheriff's Department to fight crime. And I would ask that you do not allow the voices of the vocal minority to silence the voices of the silent majority. The silent majority of us want to see our sheriff's deputies do their jobs, and we want to see them do their jobs well. Our sheriff's deputies risk their lives for us every day and every night, and I ask you board members to increase the budget and to allow for increased spending of the Sheriff's Department. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Hi, this is Tim McMahon, Mr. Chair and Supervisors. I want to express my strong support for the Sacramento County Sheriff's Department and urge you to maintain funding for the Sheriff's Department at or above current levels. Government's fundamental purpose is to protect the rights of its constituents. Law and order is the means by which government achieves this purpose, and it is the Sheriff's Department that maintains law and order. It is for this reason that funding for the Sheriff's Department must be made at or above current levels. Unfortunately, we are seeing in some of our cities throughout the United States what happens when law and order breaks down. Innocent people are deprived of their most fundamental rights of life and property. I do not want to see this happening in our communities, and it is for this reason that I strongly urge you to fund the Sheriff's Department at or above current levels. Thank you.
Thank you.
a moment to voice my support for increased funding.
Hi, can you turn the meeting off in the background?
Yes.
Okay, thank you. And then start with your comments. You have 2 minutes.
Yes, can you hear me?
Yes.
You need to turn off the background, please.
I did, thank you. I wanted to start off with a quote. Riot is the voice of the unheard. Martin Luther King Jr. said that. And while oftentimes white supremacy and the white power structure sees MLK as this big ally to their way of living, to say that they support Black lives, really and truly you don't, and you haven't, and you didn't when he was alive. And so I want you, especially Serna, Phil, this is Sonia Lewis, and we've had several conversations, and I want you to think about and ask Scott and Navgil and Brett, I want you to ask them where the money's gonna come from when Michael McIntyre's family gets paid off. I want you to ask them where the money's gonna come from when Ryan Ellis's family gets paid off, where Marshall Miles's family gets paid off, and when Antonio Thomas's family gets paid off. I want you to ask them where those funds are in the budget. And if you don't know, Phil and Kennedy and Natoli, the only three of you who have questions in regards to this budget, I want you to really think about when bad things happen on Scott Jones's watch, where does that money come from? You know, I participated in a lawsuit last year, and I won. We sued Scott Jones. And I kind of feel a certain kind of way that I was awarded money that I know is taxpayer dollars because of a lawsuit based on Scott Jones's bad behavior. And so I've given most of the money away because I know that there are people in community who need more than I do. And so I want all of you to think about not protecting people who look like you, but protecting people who have less than you. I think that's the creed that we should live by, trying to reach a place of humanity. And what I'm seeing tonight, it almost makes me feel just like Kula said earlier.
Can I get your concluding
You're
remarks,
not
please?
listening. Okay, thank you so much, Phil. Just 1 second. I feel like you're not listening to us. I feel like you've already made your mind up.
Thank you.
And I really think you need to listen to the call.
Thank you.
Please start with your comments. You have 2 minutes.
Go ahead, please. Go ahead.
Please start with your comments. You have 2 minutes.
Hi, this is Gabrielle. I'm way down at the bottom of District 8. And when it comes to the sheriff's budget and just the budget overall, my fear is that we're going to end up looking like Portland and New York, where there's increases in crime, delayed response times, and just chaos. And as it is right now, in our area, we already deal with delayed response times. I think it's more important that we have more de-escalation training, the cameras on everybody, increases in staff, expanding their training on how to deal with mental health, especially with autism and the increasing needs there, more mental health staff, having them available 24 hours, not just the 9 to 5 like y'all were talking about earlier. And all of those things take money. And yeah, we can expand that to community helping out, but then you end up with situations like Kenosha with people that aren't fully trained and whether what they're doing is right or not. We just end up with a mess. And so, yeah, we need change, but until that's figured out, I think we need to keep the funding where it's at and increase it if all possible. Thanks, guys. I know it's late. Have a good night.
Thank you.
Please start with your comments. You have 2 minutes.
My name is Aban. I'm a lifetime District 2 resident. Every single person, every single caller who wants to give the police more money has either committed a crime or has had a loved one commit a crime, even if it's something small like jaywalking. The police commit crime every day. Politicians commit crime every day. We have a rapist in the Oval Office. Sheriff Jones has a research report that's over 300 pages, all about corrupt things he's done. He's in a hate group, the Federation for Immigration Reform. Oh, and he also encouraged people that aren't in Sac County to call tonight. If that's not a crime, then it should be. Crime is not and has never applied equally to people based on their actions. It is a political tool that's used against people that police want to incarcerate, while the people who police want to keep safe will never experience that harm no matter what they do. Criminals are not evil monsters that you have to clutch your pearls in fear of. They're human beings who almost always are committing crime out of necessity. A necessity that could be alleviated if we put money into prevention instead of punitive violence. Police do not stop crime. They literally come after the fact. They do not stop anything. And as many of us know, they don't even help us afterward. Taking money out of actual resources to help people and putting it toward cops directly means that crime will go up. People will be struggling more. Police will have more riot gear to test out on our communities. This is reductive circular reasoning where you always want to militarize state agents and people become more despondent, and then you have to militarize the state agents even harder. We break the cycle by caring about people, not by creating a dystopian military police state. And as a final remark, Nav Gill blatantly lied about funding the climate plan. Have a nice evening. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Hi, yes, my name is Michelle Wright, and I'm a District 3 resident. I first want to comment on Sheriff Jones' presentation of random headlines about crime in cities that just defunded their law enforcement. It's very laughable because obviously defunding forward-looking budgets would not cause a sudden increase in crime. And I honestly can't believe that this was his idea of a compelling argument of why we shouldn't defund law enforcement. Furthermore, the lack of data collected and compiled relating to mental health-related incidents further shows his ineptness of this department. This is 2020. Data-driven decision-making is the standard, and the sheriff's display of fear-mongering rhetoric is dangerous and should not be incentivized. Based on that presentation, I can't understand why you would trust the Sheriff's Department with further funding. I also found it especially insulting that Sheriff Jones referred to me as someone who's not a person of consequence. However, this was just a small display of the issues with the Sheriff's Department. A slight insult is far less harmful than the violence that the department regularly inflicts on the poor and disenfranchised in our communities. The documented and unnecessary episodes of police brutality as a result of deputy escalation can be stopped if we reinvest our county's budget into policing alternatives like mental health crisis response, addiction treatment services, affordable housing, jobs programs, and shelters for our unhoused citizens. These are programs that address the roots of crime and public safety. And while the recommended budget contains an increase in funding for the Sheriff's Department, the Health Department is slated to be cut. We have since learned about addiction treatment services that have 7 to 10 day wait times and others that are underfunded by 50%. Furthermore, the health services budget appears to be based on current caseloads and isn't considering what the future state of our community will look like in the next year as the effects of the pandemic increase. Thank you, Supervisor Natoli, for bringing up the WIC program. That's a great example of a recommended cut that seems short-sighted given rising unemployment. The county budget also proposes to cut rental assistance when 100,000
Can I have your concluding remarks,
people
please?
need housing help. Please invest in alternatives that help our communities and do not hurt them, community members and do not hurt them.
Thank you.
Please start with your comments. You have 2 minutes.
Yes, I made it through. I just want to shout out. You guys should probably get up and take a stretch break, but you can do that while still listening to me. This is Rose, and I'm a homeowner and a resident of Sacramento.
I'm going to take her up on
I
that.
actually recently read the Sacramento Sheriff's Office. They have a motto, and their motto is service with concern. So my question is, concern for who? I would like to also ask who the proposed budget concerns and who does it ignore. What do we value and who do we value? Does it cost more in the long term to be preventative or reactive? What would our community look like if we focused on actual care and prevention? If people have a place to live and a place to poop, guess what? You don't have to spend thousands on cleanup, those 600 bags that were cleaned up, and you don't have to have people blocking the sidewalks. If we fund public health services, we give people the mental health care and wellness support they need before they have a crisis. If we have accountability in the departments, guess what? The county won't have to continue paying for bad behavior lawsuits in various departments that amount to millions of dollars and unknown amounts of future funds. Millions of dollars. Guess what? We have community groups that have already stepped up during this pandemic and before to provide the services we are asking for, so fund those. It already exists. I actually agree with the previous statement by Scott Jones when he said the sheriff can get out of the homeless crisis business. He also said that 120 calls a day can be routed to another department that would be better equipped to handle them. So I ask you to take him up on that offer immediately and reallocate the funds. Thank you.
Thank you.
Please start with your comments. You have 2 minutes, and please mute the meeting in the background while you're talking. Go ahead.
Hi, my name is Mercedes. I'm a resident of Mr. Kennedy's district. I also work in Mrs. Peters. Needless to say, I've been on hold for over 5 hours now. Just a couple things I want to say, because I don't want to reiterate so much of what you guys have already heard, but I do have a question for all of the callers that are so concerned that we are asking for you to completely dismantle and abolish the sheriff's department right now, and that once we do that, we're going to turn into Portland, Oregon. I just want supervisors to know that that is direct quote from fear-mongering propaganda that the sheriff and his advocates promoted to his social media following immediately preceding this meeting. So I'm not really sure where all the fear and aggravation is coming from. As a caller mentioned earlier, a lot of the statistics that the sheriff used came from Breitbart and alt-right sources. As far as what you're seeing in Portland right now, that is another example of state-sanctioned police violence against peaceful protesters. That's what's happening all across this country, and that's why you see people calling for the police to be defunded. From what I can see, the people's budget is not asking you to completely take all the funding away from the sheriff. They're asking that you reallocate those funds according to what the people actually need. How long are we going to continue to take money out of public health, out of public services like education, like programs that address poverty and homelessness that are directly correlated to increases in crime? Where do you think this supposed crime wave that the sheriff and his supporters are so afraid, where do you think that's going to come from? We all know that comes from, that's directly correlated to divestment in community practices. So like the people's budget says, support community priorities, make those investments now, because if you don't, you're going to have to pay for it later. And that's just period, point blank. Good night.
Thank you.
Please start with your comments. You have 2 minutes, and if you could silence the meeting in the background while you're talking.
Okay, I believe I'm silent. Am I on?
Yes, go ahead, please.
Yes, my name is Lynn Williams, and I live in the Meadowview area. And I just want to give you a quote from Nina Simone, who said that slavery has never been abolished from the way America treats black folks. And I say that because we are living in a time where all of these people are calling in based on the orders of Scott Jones, who is also associated with, let me just remind you, with FAIR, who is a very racist organization. We are getting calls in tonight from supporters of people of Scott Jones, basically asking for Jones, saying that he's a hero of some sort, as if he's doing something to make their lives more comfortable. He really is. You know what? Because they live in fear. They don't live in a Meadowview or Del Paso Heights or in a Oak Park. They don't live in North Highlands, where when the Sacramento Sheriff's Department comes in and they see black bodies, it's a different approach. And so, you know, it's funny that Scott Jones wants to talk about body cams now and that there's this big conversation, but I can remember back when Joseph Mann was murdered, we asked for the Sacramento Police Department and the Sacramento Sheriff's Department to equip all of their officers with body cams. So we can't continue to let these lies stay out there. I'm a former lead member with BLM Sacramento. He has lied on that organization and other organizers in this community. We stayed very silent, peaceful protests near his home, but he wanted to say that BLM harassed his family. There are millions of dollars in lawsuits, and that people within his department are being rewarded for bad behavior. I just want all of you to watch. Do me a favor. Watch Decarcerate Sacramento's community forum that they had this past Sunday. Listen to the voices of those people. Listen to the breakdown of the people's budget. My last ask of all of you is to draft a public statement acknowledging that systemic racism has been a problem in this country. And in that statement, I want you...
Can I get your concluding remarks, please?
Okay. I also want you to address how you plan to curtail the harm, trauma, and oppression of black people in Sacramento going forward.
Thank you.
Please start with your comments. You have 2 minutes.
Go ahead, please.
Caller, are you there?
Yes, sorry. My name is Shane Logan. I am a professor of sociology with an area of emphasis of crime and law and incarceration. I have lectured on the topic of defunding and restructuring police departments for quite some time, and I have to say that my years working next to and with the probation department under the amazing leadership of Lee Seal and Marlon Yarber and David Simone, they've shown incredible leadership and a progressive cultural development within their organization that has been the model that we have needed in Sacramento. I run a reentry organization through the college, and from the very beginning, they've been incredibly supportive, giving both time, energy, and resources to support the development of the program, which has resulted in our program being the model for statewide development of community college program development and partnerships with other probation departments. I understand the defund movement, and I support the efforts to create a more progressive agenda in addressing reentry. But one of the most important things that we need to acknowledge is that the Sacramento Probation Department is not part of the problem. They are a model of solution that we should be holding up and supporting rather than demonizing. Thank you very much.
Thank you.
Please start with your comments. You have 2 minutes.
Okay.
Go ahead, please.
Good evening. My name is Matt Rizvani, and I appreciate the opportunity to comment on your budget discussion tonight. I would like to express my opposition to any sheriff's department's budget reductions or realignment. In my opinion, the county has two purposes. One is the welfare of its residents and being a safety net for those who need it. The other is to provide for public safety, which should be the county's premier focus. Without effective public safety, the county would be failing its residents. Without that, we have nothing. We just turn into one of the communities we see on TV night after night being looted, burned, and destroyed. So, I urge you to vote no on any budget reductions or changes to the Sheriff's Department's budget. I would also like to add quickly that my family and I live on Garden Highway in Sacramento, and the sheriff deputies that serve our area are probably among the best in the nation. We, as well as many of our neighbors, appreciate what they do day in and day out. And thank you for your time.
Thank you.
Please start with your comments. You have 2 minutes.
Awesome, thank you. Late good evening, supervisors. My name, both my wife and I, Bob and Teresa Moneymaker, we have been residents of the county for over 50 years. The one constant in the time that we've spent here in Sacramento County has been the Sheriff's Department through thick and thin, and we strongly urge you to not defund the department. There is a need for mental health, and the funds should be found for them. Do not defund the Sheriff's Department. Thank you for your time and your patience. Bye now.
Thank you.
Please start with your comments. You have 2 minutes, and please silence the meeting in the background while you're talking.
Yes, my name is Kathy Woods, and I'm calling to overwhelmingly support the people's budget. My family and I have been residents of Sacramento County for 33 years. We've watched the problem of police violence and systemic racism grow under the leadership of Scott Jones. We are aware of the millions of dollars paid out in lawsuits by the county due to the violent and sexually inappropriate behavior of SSD deputies and the sheriff himself. That alone should make this an easy decision. If you give people housing, they have enough food, there's going to be less crime. It's a no-brainer to reallocate funds from the Sheriff Department into the community. What we need is to have the Board of Supervisors return the $104 million that was taken from the CARES Act aid package that was misappropriated to the Sheriff's Department for their payroll to the community that needs it. Giving this money to a department that is already grossly overinflated budget, instead of putting it towards public health, was the wrong thing to do. Any proposed budget cut should come from the Sheriff's Department. The millions they've cost the county in lawsuits should make it easy to justify that. Sheriff Jones himself kind of increased the case for defunding. They can't handle the homeless. They can't handle the mentally ill. There are trained professionals with years of training who can handle that better than the deputies. You know, I have witnessed horrible abuse of people who are mentally ill. No cut should come from health services at all. Given the financial, physical, and emotional toll on citizens due to the state and county's response to this virus, it's vital that there is enough funding. We need at least a third of the general fund to be allocated to the needs of human beings in the community. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Hi, good evening. My name is Amanda McAllister-Wollner. I have been a resident of Sacramento County for over 20 years, and I am proud to join the thousands of others who responded to the People's Budget Survey, calling for leadership from this board and for investments in health and human services. I currently live in an unincorporated area in Sacramento County, and I see the results of the bloated Sheriff's Department budget in action every day. I see it in the numerous sheriff's SUVs that swarm to issue traffic citations and harass people in my neighborhood. I see it in the lack of services for my unhoused neighbors. Today I heard Sheriff Jones say that he would like to get out of the business of responding to mental health crises and calls to provide services for people experiencing homelessness. You have the power to give him what he's asking for and what the people are asking for. We need Sacramento County to put more funding toward public health, mental health, human assistance, to fund services that already exist, such as Mental Health First and the Gender Health Center's respite programs, and to support new solutions that meet the needs of our communities. We're in the middle of a public health and economic crisis right now. And in order to meet this moment, the county must restore the $104 million that was taken away from CARES Act funding and allocated to the sheriffs. The county's proposed $17.8 million budget cut must come out of the sheriff's budget. And I also want to clarify a question that was asked earlier by Supervisor Kennedy about the climate action plan. The requested $150,000 to draft of the climate action plan is not included in the budget before you today and is listed as not recommended by NAVGIL. In closing, no cuts should come from health and human services, and no less than 33% of the general fund must go to human needs and health services.
Can I get your concluding remarks, please?
Yeah, and I just ask that you listen to the people and to what we shared in the people's budget.
Thank you. Supervisor Tully?
Yes, thank you, Mr. Chair. Just to follow on, and maybe Supervisor Kennedy's going to weigh in, but I understood we were on basically a time schedule to have the climate action plan back to us early part of next year, and that funding was in place to fund that. So, again, I haven't looked at the specific reference, and I know you responded earlier now, but I understood that we were on board in the planning department and other related agencies to have that before this board in a few months.
We are. I checked with Leanne. She said it's in there. And what I need to look at what that unfunded is, but that could have been when we were asking for the different development interests to weigh in and give us the agreement that they'll pay for a portion
versus us paying for it.
Yeah, because we were going to do 50, and then when we did Mather South, we had come up with a suggestion, came up from Supervisor Cerna to go to all the different development interests, get 50%. I don't know if it's alluding to that or not, but I'll look into it. But
Okay.
Leanne's basically telling me that it is in there. We are on track to get it done.
Maybe just have a breakdown that you can distribute a one-pager to all of us tomorrow. Supervisor Kennedy?
That's what I was going to ask for.
Okay, all right. Very good.
Please start with your comments. You have 2 minutes, and please silence the meeting in the background.
In order to meet this moment, county must. Thank you. I want you to remember there was a day back in September of 2018 when a group of organizers met Scott Jones and the Cops West conference that was taking place downtown at the convention center. And I want you to remember that we had 178 coffins lied in the middle of J Street as a visual representation to explain why the police needs to be defunded. And it's not just because of the 178 lives that were taken at the hands of law enforcement that year. It's also because we need to fund things that have to do with human rights. Poverty is killing Black people literally and figuratively in this country, in this state, in this city, and in this county. And so when we talk about what we can be doing better, all of you can be taking a look at
when 911 calls are made and what the response is and if law enforcement actually helped. 90% of the time, law enforcement gets there, they take a report, and half the time the information is inaccurate and they don't follow up. And don't let that take place in a community of color. They will tell you based on their response whether or not they value your life. And I'm here to tell you that when they engage with community of color, they don't value our lives. I also want to leave you with this one last question. And that question, Mr. Sterna, I'd like for you to ask of Scott Jones when he has conversations with his officers and deputies. I'm a relative of Stephon Clark, and I want to know why did the helicopter pilot operator that night turn the bright ass light that we're used to seeing when the helicopter flies in communities of color? Because had that light been on, maybe his life would have been saved. Maybe they would have seen a cell phone instead of a gun. And so these are the problems and the reasons why we say defund the police. There are so many other ways we can lift and center the most fragile in our communities.
Can I get your concluding remark, please?
Yes, one last thing. Don't think about yourselves. Think about those who don't have. You are part of the haves, and there are people who are part of the have-nots who really need our support.
Thank you. Supervisor Kennedy?
Thank you. Mr. Gill, I've asked for 9/11 information, remember, data, and whatever's available, and whether it's whatever demographic information we gather, whatever information we have on 9/11 calls, 911 calls. It doesn't have to be during this budget, but if I could get that when we're through with the budget, I'd still like to have that.
Okay.
Please start with your comments. You have 2 minutes.
Hello, my name is Dr. Flojan Kofer, and I'm an epidemiologist, the Senior Director of Health Policy at Public Health Advocates, and a resident of District 1. As the board passes the budget, its goal should be supporting the needs of the county. During the CARES Act conversation, NAV, who has given himself a $30,000 pay increase, said that CARES money was allocated to the sheriff to save money in the budget. Momentarily setting aside the fact that supplanting existing budget funding with CARES is illegal, that means that there should be $87 million that are passed along to public health. Instead, $17.8 million in cuts are going, the majority of them are going to health services, 35.4%. Making cuts to health services is problematic because they've already been the smallest part of the county's budget for at least the last 10 years. And most of their money is federal money, which you all admit earlier tonight is not stable or consistent. To be clear, no cuts should come from health services, human assistance, fair housing services, parks, or economic development and small business support. I empathize with many of the people calling tonight concerned about public safety. If you haven't read up on it, I'm sure defunding the police raises questions about who will keep you safe. So let's answer those questions with facts. Fact number one is that the police don't prevent crime, they respond to it afterward. So let's talk about the quality of that response. Despite being one of the most well-resourced agencies in the region, the Sheriff's Department maintains one of the worst performance records in California since 2010. With a budget exceeding $400 million, they only cleared 38% of their violent crimes and just 5.5% of property crimes. Even with a 20-year crime low, the sheriff's budget continues to grow. In fact, the Sacramento City Police Department cleared more violent crimes last year with less than half of the sheriff's budget. And the sheriff already cost our general fund $151 million in losses for excessive force. He also refused to share his COVID jail data with the Board of State and Community Corrections, making us and Tehama County the only two delinquent counties. So to recap, the sheriff cost us hundreds of millions of dollars for behaving badly, shirked rules when he doesn't feel like following them, didn't prevent crime, and didn't solve the majority of the crime.
Can I get your concluding remarks, please?
So my bottom line is this. Emergency response is important, but it's only part of what makes us safe. Prevention is more important, and that's the most important aspect of public safety. And I ask you to pass an evidence-based budget that prioritizes prevention, not rhetoric-based.
Thank you.
Please start with your comments. You have 2 minutes.
Hi, I'm speaking out against the drastic budget cuts to the Sheriff's Department. The first point I want to make is that I urge you all to look at where the Sheriff's Department money is being spent. Reducing the department's budget that drastically will affect either directly or indirectly these functions of the Sheriff's Department. The Youth Services Unit, the Homeless Outreach Team, the Community Services Unit, the backpacks and school supplies given to children in low-income neighborhoods, Unity in the Community events, and Shop with a Cop events, to name a few. All of which are enjoyed by people in various communities and various cultures. And secondly, I'm not sure if any of you know what it's like to have a loved one in law enforcement, but let me tell you, it's very difficult. There's always a feeling of dread in the back of your mind that today might be their last, and that feeling is especially prevalent today with cops being the target of violence and insults. These people go out into their communities every day to protect and serve, and it kills me to see them met with such rejection, criticism, and violence. They step up where no one else will. Especially with the way that legislation is going, our police officers need to know that there are people out there who are rallying for them. People in this profession everywhere are losing hope and losing their passion for this profession. Please be the reason that they can be passionate again. I urge you to make the decision that is best, not the decision that will get you reelected. You are one of the last things standing between us and anarchy right now. Please don't be fooled to defund our police. Thank you.
Thank you.
Hello, caller.
Yes.
Please start your public comment. You have 2 minutes.
Okay. My name is Joanne Harding, and I oppose any cuts to the Sheriff's Department or the District Attorney's Office that would compromise their ability to ensure public safety. I oppose cashless bail. I oppose any attempts to implement the direction and priorities identified in the people's budget. A fully funded and staffed Sheriff's Department is our protection and security against all criminal activity and lawlessness, including violent riots. We need a fully funded District Attorney's Office to investigate and prosecute crime, and we need to keep our bail system. When cashless bail has been recently adopted in places experiencing violence and riots, it has served to put violent offenders back on the streets to immediately reoffend. No other county program you're considering is worth anything without first having law and order. Regarding the people's budget, the voters of Sacramento County did not elect our supervisors to reimagine public safety. This concept is a dangerous social experiment, and it certainly should not be rushed through via the Board of Supervisors budget process. Please vote for a fully funded Sheriff's Department and District Attorney's Office. Please vote against cashless bail and against all provisions of the people's budget. Thank you for continuing to protect county residents and for keeping our streets and neighborhoods safe.
Thank you.
Thanks.
Hello, caller.
Yes.
Please start your public comment. You have 2 minutes.
Hello, this is Tony from District 3. I respectfully want to go on the record stating that I am opposed to any and all actions under any name that you may call it that would involve or result in the defunding of the Sheriff's Department in any way, especially now during these extremely troubled and trying times in our county and country. It is not the time to take away the law and order. If anything, our foundation of law and order must be preserved, as it is needed now more than ever before. There are groups that would have us become a lawless state and nation. They are undermining this country. Those groups are bullies, criminals, and terrorists. We must stand up to them and give our full support and respect to those who protect and serve our communities, our state, and our nation. Do not allow the false, noisy rhetoric of the ignorant bigots whose real agenda is to destroy America to triumph. It is imperative that we stand strong and, at the minimum, keep the budget of the Sacramento County Sheriff's Department intact. The best scenario would be to make a loud, clear statement in support of law and order and for those whose shoulders that responsibility lies on. I say let's increase their numbers and their budget. Thank you.
Thank you.
Hello, caller.
Hello.
Please start your public comment. You have 2 minutes.
Good evening, Board of Supervisors. As a resident of the County of Sacramento, I fully support our law enforcement and especially our Sheriff's Office. They are fundamental in our community and keep us safe. Without the Sheriff's Office, we could not enjoy our community as we currently do. The Sheriff's Office deserves more funding, if anything, to continue to do their job. Given the unrest we see across the country, only demonstrates how important our Sheriff's Office is. I do not want our county to look like the disastrous cities and counties who've chosen to defund their local police and Sheriff's Office. Sacramento needs to be an example for cities to emulate and know that we keep our citizens safe. The Sheriff's Office also combats homelessness, and the HOT team does a tremendous job. The Sheriff's Office is in need of more funding to expand their HOT team. You cannot send in a citizen who cannot defend themselves from the majority of the homeless who are on drugs and can become violent. Increase the sheriff's funding so they can make a difference and keep our community safe. Thank you and have a good night.
Thank you.
Please start with your comments. You have 2 minutes, and please turn the meeting off in the background.
Go ahead, please.
Do not give extra funds to the sheriff. We saw the body cam footage on the news when Stephon Clark was murdered, yet the officers remain employed. So don't ask for more body cam support. Accountability comes from policy, not increasing budget. Restore the $104 million that was taken from the CARES Act funding. The millions in budget cuts must come out of the sheriff's budget since it is the largest portion. Absolutely zero cuts should come from health services while we are still in a pandemic, for goodness sake. We are also recovering from the wildfires and smoke. Your constituents have been protesting every weekend for months, demanding to divest from cops and invest in communities. The safest communities do not have the most cops, they have the most resources, and you starve us of these resources with a budget focused on police and prisons. That presentation from Sheriff Jones was a joke. Screenshots of news headlines in other cities and photos of cops' cars on fire do not count as evidence. Absolutely disgraceful you let that racist sham continue. There's a quote that comes to mind right now. Apparently, some quirk in human nature allows even the most unspeakable acts of evil to become banal within minutes, provided only that they occur far enough away to pose no personal threat. The police violence and housing crisis in this county are terrifying to encounter. It seems none of you have experienced these things recently, since you continue to consider funding their expansion. The Sheriff's Department is used to shield comfortable citizens from the realities of decades of local government negligence, so that this violence stays out of the personal realm. You can stop this by supporting the people's budget now. Callers in support of expanding the sheriff's budget lack understanding of our county's current spending and community safety. They know only a concern for personal safety. They cite anecdotal evidence and a fear of a future without law enforcement as the reason, not because the sheriff has effectively reduced housing issues, violent crime, or any other threats to their safety. They have safety now. The people advocating the fund do not have that same safety. Right now, people are dying from the police violence, from lack of stable housing, and a lack of appropriate health care. Again, support the people's budget. I yield my time.
Thank you. Hello. How many more?
Please start with your comments. You have 2 minutes.
Good evening, Board of Supervisors. My name is Felisa Concepcion. I am a resident of District 2, and I am a social worker, and I support the people's budget. I have a master's in social work with an emphasis in public policy and criminal justice, and although I am a South Sac native, I have spent my recent years in Washington, D.C. as a full-time policy analyst at the Justice Policy Institute and a part-time case manager for returning community members facing homelessness. Defunding law enforcement doesn't mean defunding emergency services. It means investing in community-based emergency services and responses that don't involve law enforcement, like the organization Mental Health First. Defunding law enforcement means investing in services that address the underlying issues of crime. The Sheriff's Department's own data shows that they are not contributing or improving public safety. They have the second worst clearance rate in its existence. They are not solving crime. They are not preventing crime. They are not intervening with crime, and they are not helping community members recover from the harm caused by crime. Supervisor Solcerna, I know you were planning on investing in police body cameras. However, case studies in jurisdictions like DC and LA have shown that cameras do not change officer behavior and does not prevent abuse. It does not prevent use of force and police murders. Look at SAC TV. They have body cameras, and they recently shot and killed 2 of our community members in the past month. If we move forward with body cameras, the sheriffs should pay for it with their own budget. They have helicopters, jet skis, boats, so they can afford their own body cameras. Your budget affects the lives and well-being of your constituents. It affects our quality of life, our lifespan, our mental and physical health, our housing. So please adopt a budget that reflects and prioritizes the needs of your constituents, the needs of Sacramento County. All public comments tonight, whether to support the sheriff or defund the sheriff, are in support of decreasing crime. We want to feel safe in our communities. That's why we're calling. And it's your choice to decide if you want to continue to fund traditional public safety that obviously isn't working.
Can I have your concluding remarks, please?
Or invest in services that prevent and recover and help us recover from crime. And my last remark is that Scott Jones' presentation was made up of Facebook clickbait, and the People's Budget presentation was made up of data from a survey distributed to 2000.
Please start with your comments. You have 2 minutes.
Hi, good evening. Courtney Hansen, resident of District 1. I need you to know that Sheriff Jones' news articles are, in fact, from far-right conspiracy theory outlets, including Breitbart, whose founder was just charged with fraud, and a journalist whose focus is, quote, radical left and Islamic terrorism. He's insulting your intelligence. Scott Jones is comfortable with body cams now because 5 years have passed since his reform became popular, and now we have data proving they are completely ineffective. Thank you, Natoli and Kennedy, for asking crucial questions. Overall, I am extremely disappointed that this board is considering a business-as-usual budget when we are at this historical juncture. The People's Budget had a press conference this morning uplifting the needs and priorities of over 2,500 survey constituents. When a formerly incarcerated woman spoke about how 3 years in our jail system exacerbated her mental health conditions, I couldn't stop thinking about how this board is considering hiring 42 new officers instead of funding community-based programs like Mental Health First. When anti-police terror advocates talked about the extremely high rate at which people with disabilities are killed by police, I couldn't stop thinking about the head of the Sheriff's Association and how he tweeted that if you don't follow an officer's orders, you deserve to be executed on the spot. When housing experts reminded us that it is sheriff's deputies who forcibly remove us from our homes when this board fails to protect renters. I couldn't stop thinking about NAB's recommendation that you deny a minuscule $19,000 to Fair Housing Service for a renter's helpline. You are part of a defund movement, whichever way you go. You can either defund our life-affirming services, or you can make a dent in the sheriff's bloated budget. We are begging you for food and housing security, and you're proud of body cameras and mental health-oriented jails. I've studied incarceration for 10 years, and throwing money at the problem will not work. And I know we'll discuss item 2 tomorrow, but while everyone is listening, I want to flag that this board will be considering $66 million.
Can I get your concluding remarks, please?
Without any resemblance of jail population reduction plan in place. We need you to slow this spending down and bring us.
Can I get your final remarks, please?
Talk about decarceration.
Thank you.
Please start with your comments. You have 2 minutes.
Okay. Good evening. I would like to express my support for the current law enforcement budgets and disavow any reallocation or defunding of those budgets. I am, however, in support of more robust social programs and spending funds to address the social and economic needs of our community. I understand that in doing so, we address the root causes of crime, support our communities even better, and would also take a load off of law enforcement agencies. However, the positive effects gleaned from increased social programs will take time, and the reduction in crime will not be immediate. To defund law enforcement prior to the reduction in crime or workload would be irresponsible and dangerous to the very communities we wish to serve. Do not make this a zero-sum game between public safety and public services. Do not make one good thing the enemy of another. We need our law enforcement officers. We need them to be highly trained and highly professional. In fact, the better trained they are, the more we can ask them. We can hold them to a higher standard. Cut their budgets, and as the old adage goes, you will get what you pay for. Thank you for your time. Thank you.
Thank you.
Please start with your comments. You have 2 minutes.
Hey, thank you. My name is Mike Braxton. I reside in District 1, but my shop is in District 4. I recently had incidents in both areas within 5 days of each other that cemented for me the need to maintain or increase the budget of the Sheriff's Department. On August 17th, decisive action by Sheriff Patrol Deputy Carey and North Area Homeless Outreach Deputy Wright resulted in the rescue of a young family of 4 that included 2 young kids. This family had spent the weekend parked near my business in the 107-degree heat. The gratitude on the faces of the family I will never forget. You can't decouple policing from homeless outreach. Here's why. In District 1, during the week leading up to the 22nd of August, temperatures exceeded 100 degrees daily. I was concerned for the people living in RVs, motorhomes, and cars that had taken up residency on a large parcel of dirt that had no shade, bathroom facilities, running water, or electricity. Homeless Outreach responded and discovered an elderly couple with their special needs daughter among those living in squalid conditions and removed them to the safety of an air-conditioned hotel room. The policing component came into play when the officers' observative skills located a trailer that looked very much out of place among the RVs. They discovered that the trailer had been stolen from Roseville less than 24 hours earlier and contained $30,000 of new ice skates that belonged to a skate town. 2 arrests were made. The Sheriff's Department Patrol and Homeless Outreach teams remain the only entities in the county tasked with the daily first contact with the ever-growing vehicle homeless.
Can I get your concluding remarks, please?
Early prevention leads to more successful outcome in homelessness.
Can I get your concluding remarks, please?
Say again?
Can I get your concluding remarks, please?
Yes, well, that's what I was doing. Early intervention leads to more successful outcomes, and if anything, the hot team needs to operate 7 days a week and not 4 days a week. That means an increase in budget and personnel.
This is the last call. Caller, please start with your comments. You have 2 minutes.
Oh my God, thank you. 7 hours later. Good evening, Board of Supervisors and staff. Thank you for taking my call tonight. My name is Diane Turn. First, I would like to thank all of you for the incredible continued work and commitment to our community during this unprecedented time. I am a longtime and proud Sacramentan homeowner and will forever be part of Sacramento County. I have absolutely no plans of leaving. Basically born here, arrived here now when I was 8 months old, and 40 years later, I'm still here. Sacramento County is my home, our home. We are all entitled to feel safe at home. If the decision is made to reallocate funds elsewhere and defund our law enforcement agencies, we will not be safe. Defunding the police is not the right answer. Officers have to wear several hats when they're out in the field. Instead, let's train our officers on how to address mental health. We need to increase our law enforcement, not abolish them. Community engagement and collaboration is key to the success of building our communities, relationships among citizens and law enforcement. I hope and pray that each and every one of you on the board will make the right decision in protecting all of us. I'm asking all of you to please do not enact or support any laws, bills, proposals in defunding our law enforcement agencies. We cannot allow Sacramento County to become cities such as LA, San Francisco, Seattle, Portland, Washington, D.C., and New York, as well as Austin and Baltimore. Sacramento is the capital of our great state. Our city and county is one of the most diverse places in our great nation. We cannot allow ourselves to become victims of crime. We must protect and save our law enforcement in our community. We have to lead by example, not become followers. We cannot have and must not have a chaotic, lawless society. You see what's happening in all the cities and states where defunding has been implemented? Sheriff Jones provided a visual of what would happen to our community if this were to occur. Residents would be terrified to even step foot outside their homes, knowing that they would not have anyone to call for help. It would be detrimental and catastrophic. Our government must do what they have been elected to do, and that is to protect and serve their constituents. I, as your constituent, am pleading all of you to please do the right thing. Please do not defund our law enforcement agencies. Supervisor Frost.
Can I get your concluding remarks, please?
Yes, sir. Supervisor Natoli, as a resident of District 5, I'm counting on you and every member of the board to make the right decision for all of us.
Thank you.
Together we are stronger. We must remain united for all. Thank you.
Thank you. Okay, that concludes public testimony. Certainly want to thank everyone that waited for hours literally to address the board this evening. I think the fact that you're willing to do so speaks to your perception about the import of this annual exercise that we as your Board of Supervisors go through. And quite frankly, despite the late hour and the fact that it's almost Thursday, I am really encouraged to see the kind of participatory engagement that we've enjoyed thus far, given the amount of public interest in what we're doing, regardless of what position you might have on different aspects of the budget. So in terms of process, what I'd like to do quickly, if possible, is maybe go from my left to right, starting with Supervisor Natoli, and just, if we can, as briefly as possible, give some impression to Mr. Gill and his team about the questions or issues that we want to have addressed tomorrow. I think that's a good way to kind of conclude the evening. So we'll start with you, Supervisor Natoli.
Well, thank you, Mr. Chair. And again, I would just echo your comments. Thanks to all the callers and certainly to our staff that's been in the audience this evening and all those that have tuned in and may not have called in, but obviously followed this hearing with interest. I'd asked many of the questions that I had earlier in the evening. I hopefully those were captured. We'll be very interested to have responses to a number of those. One question that came up in the testimony here about a half hour ago was there was a point made on the renters helpline, and I guess a pretty nominal amount. It was put less than $20,000 request that was not recommended, but I think it goes to, again, discussion that's been pointed to all evening long as relates if we got situations in our community where folks are at risk of losing their housing because of the pandemic. It would seem to me that we would want to make sure we have sufficient resources in that area. I don't know the nature of the request, but I would hope that by tomorrow we could have some feedback on that. And I guess lastly, Mr. Chair, I would just say that as we're talking about meeting the components of the consent decree, and I asked earlier this evening about having kind of a composite so there's understanding about the amount of resources that are being dedicated. But I will say that one of the things that really resounds with this member of the board, recognizing that certainly there's legal parameters to that settlement, is to have a clear understanding of where we're going relative to staffing, to facilities, because we're getting bits and pieces. Obviously, it's being brought forward in a fashion that will have us consider at different junctures. But there's long-term commitments. I think certainly I'll just speak for myself that I recognize that as part of that settlement that some of the staffing that would be required, both on the correctional health side, but certainly on the sheriff's side of the equation, that we were going to be many tens of millions on an annual basis. But as we have heard comments, certainly during this hearing, but also in past hearings, and we'll continue to hear, if we're looking at, a strategy that will employ, both hopefully reductions in population, but also obviously better conditions in the jail, because that's what that's what we've agreed to do and need to do. I'd like to see a more comprehensive. We're not going to have this by tomorrow, but and not just to gain an understanding for this board member, but I think to know where we're headed, because again, we're adding millions and millions and millions to our budget annually. I trust this done certainly to meet what certainly our top staff sees as being the proper approach. But we really haven't had a lot of discussion, certainly in this setting. And so, again, maybe from the October timeframe, we could have some discussion around that. We wouldn't have filled all those positions. And if we're going to continue to do this year in and year out, and we'll be back in these chambers in less than 9 months as it relates to budget, and if it's going to require additional commitments, I think some of what we heard this evening will be even louder in some of the, feedback that we get relative to that. So I'd like to have some discussion around that. I don't know if we're going to get to it tomorrow, but I think we need to I need to understand what the plan is, because obviously we're setting in tone that's going to be a long-term commitment for this county as it relates to how we operate our jails and staff them, and certainly provide for health services. And I think part of the strategy needs to be what we do outside as well. Thanks.
Great. Thank you. Supervisor Frost?
I just wanted to thank all of those who waited so long to make public comments, and I also wanted to make mention, there were a couple of public comments that mentioned about the wildfires, and I know in the past we've accommodated some of those folks who were displaced at Gibson Ranch. I think my understanding is we can accommodate up to about 1,000 people quickly, and up to 5,000 within a week camping, and we have restrooms out there. I don't know if we're in communication with the other counties that have displaced people, but I just wanted to make sure we were mindful that we could possibly anticipate helping some of those people.
We are in communication, and we'll absolutely keep that in mind.
Thank you.
Supervisor Peters?
I was interested in the conversation we were having about the mental health mobile crisis centers, and I wouldn't expect that we can have something tomorrow, but maybe give us an idea of what the process might look like to expand that program and how long it would take to get it moving. get it expanded.
Basically a timeline.
Pardon?
Timeline on.
Yeah. Thank you.
Supervisor Kennedy.
Yeah, I'll be talking more about that tomorrow. I don't have a whole lot of questions because I've been peppering them throughout the night. So, but I am going to be specifically looking at that issue and how it fits in the overall picture with the sheriff's budget. And even with without prescribing anything, because I'll leave that to the experts, but I have done some research and found some examples of what have worked and even the funding that has gone into them. So I will be bringing that up tomorrow.
Good. I look forward to that conversation. I've made mention of the things that I wanted some follow-up on, including the encampment outreach issue. We've talked a little bit tonight about the WIC reduction. I think I'm going to go out on a limb here. I think there might be enough interest in trying to find some restoration of that. So I'd like to know what our options are for that. That again is about $190,000. And one of the things I don't think has been made mention of tonight relative to the Children's Coalition is the fact that they are interested in a different source of funding to protect the foster parent recruitment, retention, support services that I guess are being, that some of the funding for that particular element of Child Protective Services has been cut by the state. So I'd like to know a little bit more about the dynamics of past funding and what opportunity there might be to respond to what looks like about a $300,000 hole. And then, of course, again, appreciate Chief Seal for being here for the duration, and I look forward to a conversation about the proposed body cameras for probation. So I think with that, that's going to give us enough to have a constructive, productive conversation tomorrow. We are reconvening, are we not, at 9:30, Madam Clerk? Okay. And then we also have in-home supportive services as well as the CIP in addition to the continuation of tonight's item.
Yeah.
Okay?
Did you say that the public comment period is closed?
It is closed.
Thank you.
Yeah.
Just want to be clear on that.
On this section, but on if
This
they-
section.
Yeah, but okay, on items 2 or 3.
People are certainly welcome to call in on the other two items.
Okay.
So, all right, so do we need to have any formal motion for continuance, or are we good?
I think, yeah, let's do a motion to continue this to.
Okay. Chair will move it. Is there a second?
Oh.
It's been moved and seconded. Please vote.
Unanimous vote.
Okay, very good. With that, we will adjourn till 9:30 today.